live, okay?
We are live now, sir.
Good evening, everybody. This is Dr. Apoor Mehra with Dr. Zainab Vora, welcoming you to this Cerebellum Mega Recall session for the FMG students, the lovely FMG students. Zainab, I think they would like to listen from you, the welcome.
Hi everyone. I hope you are all doing well and relieved after the exam. And apart from, the recall that we are about to do, I hope you are just taking a step back and relaxing. That is very important. बहुत मेहनत की है सबने. No matter how it goes, I think immediately after the exam, it's a natural tendency. We tend to focus on the tougher questions, on the questions जिसका answer end तक याद नहीं आ रहा था, and that is what we take away. But there are lots of things that you would have done correctly which you don't remember. So just give yourself a pat on the back that you've successfully completed a major milestone, and just relax. जो भी हो गया, जैसा भी हुआ, you will get to know when the result is, but the exam is now over. So stop thinking about it and do think about the questions and give us the options, but don't think about how it went, अब क्या होगा, अब क्या करना है. Mind को rest दो, eat some good food and drink some good drinks and relax. That is very, very important. And do let us know how you're feeling. We are very eager to talk to you and listen to how the questions were and how we can help your juniors going ahead. The main purpose of the recall is, not to see ki sahi answer kya tha. The main aim is how do we see the exam pattern evolving from now, and what do the juniors take away from it. So that is the main aim of this exercise. So do tell us what do you feel? How was the exam for everyone?
Zainab, we've all given exams. It is a tough thing to do in life.
Yes.
It is not very easy to give any entrance exam. The only thing I like about the FMG exam is you're fighting against a number. So you're not fighting against each other. Next, any competitive exam they have, they will be fighting against each other. But even then, what I realize is you made a beautiful statement: eat good food. I don't think so they're going to listen to food. You said have good drinks. On a Saturday or Sunday evening, when you speak about good drinks, the doctors won't think straight. And that's why Rohitash has already said, Madam, which drink? So wo bilkul focused hai. He's not worried about everything else. It's just focusing about what drink. Anyways, there are two papers in FMG, right? Part 1, part 2. So for my thoughts, whichever early reviews we have, Zainab, the first one was a little difficult, and the second one was little connected, the clinical touch, right? So what I realized was, what I got from orthopedics were the questions which were straight on. So I will like to continue discussing, but before that, let's just talk about some of the questions which I saw. Dr. Vivek sir has also joined us. Before we go ahead, Vivek sir, आप welcome करें सबको एक बार. I think the students will love to listen to you.
Sir, I think sir, आप start कर दो. I'll just take 2 minutes. आप और Dr. Zainab start कर दीजिए.
Sure, sir. So Vivek sir ने हमारे को अनुमति दे दी है. So this is my screen, and I will just like to start discussing. There was a few of the questions which I have got. All right. So if I look at the first question, they had given a history of a young boy, 10 to 12-year-old, and in that they had mentioned about tibia. All right. So they had spoken about tibia, and they had spoken about a growth. All right. And in the growth which was going away from the bone, right? So 2 years back, a similar question came as an image-based question where they had shown a growth from the lower end of femur. And this growth is a bony growth with a cartilage cap. So this bony growth means osteo with a cartilage cap is called as chondroma. It's also called as exostosis. It grows away from the joint. All right. And this is not a bone tumor. It's a developmental abnormality. And when you take an X-ray, you see the bone, you don't see the cartilage. But when you touch the bone and you touch the cartilage. So the classical line is large to feel, smaller on X-rays. That is what is the take-home message. One of the student also mentioned, sir, the question came in a different way. It was the same age group, 10 to 12-year-old, tibial thickening with night pain relieved on taking salicylate. So if you get that question, night pain relieved on taking salicylates, right? So that's osteoid osteoma. Osteoid osteoma is a diaphyseal lesion. It's not a growth. It's a cortical thickening. One of the bone tumors where CT scan finds its importance. And the growth is called as a nidus. Nidus ka matlab hota hai seed, right? The beej. That's the growth of it. All right. So this is osteoid osteoma. So the osteochondroma is a growth. Osteoid osteoma will have night pain relieved on taking salicylates. In fact, it's a tumor that disappears on taking aspirin. This is a question that came 5 years back in FMG exam as well. All right. So now the students are telling night pain not mentioned. So if pain not mentioned, a growth, osteochondroma was the first question. Going to the next, they had spoken about wrist drop. And it definitely makes sense to ask wrist drop because radial nerve palsy is the most common nerve damage in the human body. And the radial nerve palsy will cause wrist drop. So loss of wrist extension is called as wrist drop. And the most common cause of the radial nerve palsy is the fracture shaft of humerus. All right, that's what is. And remember one statement I want to tell you, whatever is common usually has good prognosis. So this is the commonest nerve palsy, and it is also the one which has a good prognosis, right? And just for recap, right, around the shoulder, whenever you have a question, think about the axillary nerve. Around the arm, think about the radial nerve, all right? Behind the medial epicondyle, think about the ulnar nerve. The head of radius, think about the posterior interosseous nerve. So these are important things that we should keep. Around the hip, think about sciatic. Around the knee, the neck of fibula, the common peroneal nerve causing a foot drop. So upper limb, the wrist drop, lower limb, the foot drop. These are two important things that you must keep in mind. And going to the next, the question that came to us, right, was about the elbow deformities, This is something, agar neend mein bhi koi aapse puche to aapko aana chahiye. So the angle between the humerus, right, the forearm and the arm and forearm is called as the carrying angle. When the distal body part goes towards the midline, it's called as varus. Elbow is cubitus, so cubitus varus. And if it goes away, it's called as valgus. So they had shown that they had written in the history, child had injury around the elbow treated by an osteopath. Some splintage was given and later on developed deformity. And they had given an image. So if they had given this image, varus looks like a gun stock or cubitus varus deformity, or if they give you the other one, this is valgus. So we have both the thoughts, right? Some students are still mentioning they were the varus. Some are mentioning valgus. So I have got both the images for you. All right. So wherever you want to keep it, it's your tick. All right. So Navrang, this is what I just said. Valgus था तो ऐसे होगा बेटा, अगर वायरस था तो वैसे होगा, जैसे आपको ठीक लगे आप काम चला लीजिए और खुश रहिए, गुस्सा नहीं करिए. गुस्सा जो है वीकेंड पे इंसान को क्षति पहुंचाता है. क्षति मतलब नुकसान. और ये इंग्लिश सेशन है, इसे इंग्लिश में बातें नहीं करनी. Anything which has a different blood supply is a question. Normally blood supply will come from center to distal. But if it comes from distal to proximal, it takes a reverse. It's a question. Two places where this blood supply is reversed is in scaphoid and neck of femur. All right. That is why these two places, there is something wrong with the blood supply. So when the blood supply is distal to proximal in a fracture scaphoid, all right, there are some issues. This is an area which is in the snuff box. The anatomical snuff box has 3 bones. The scaphoid is what we remember. But when they used to be PJ exam, trapezium and base of first metacarpal were the other options which people never looked at. They would just mark scaphoid, all right? And this anatomical snuff box has a notorious name that comes from Mexico, right? Where people would put some powder here and snuff it up. So it was called as a snuff box. But let's focus on orthopedics here. So anatomical snuff box, tenderness, X-ray normal, put a cast, repeat an X-ray on the 10th day, you can see a scaphoid fracture. So scaphoid fracture, that's how it looks like. It fractures from the waist. And the portion which is below the arrows is the proximal pole. And that's the area that undergoes the avascular necrosis because loss of blood supply with a cut. You know, at the beginning of this session, there was a discussion about the drinks, good drinks to be taken. So we talk about the drinks. The first glass is always the same glass. पहला ग्लास हमेशा पार्टी में ऐसे ही होता है, इसे बोलते हैं ग्लास होल्डिंग कास्ट. आखिरी में रिस्ट ड्रॉप हो जाता है, ऑलराइट, उसे बोलते हैं द Saturday night palsy or the radial nerve palsy. So we are talking about the first glass, and I hope there is no wrist drop occurring on. And the dead bone is white, you know, it's white in color. This is how the avascular necrosis of the scaphoid will look like. All right, my friends, there was a deformity of the hip joint shown, and they had asked you a test, Thomas test. If they had asked you any other test of the hip, this is the most common test asked. This is for a hip flexion deformity. But if they had asked you any other test of the hip, do come back to me. I will be discussing that in the future sessions that we have. And then they had labeled up the structures around the knee and asked you that where will you have the housemate's knee? So it's housemate's knee. When you're mopping up, when you are cleaning up the area, you kneel on your knees and clean up the area. So the pre-patellar area is the one that comes in the contact with the ground, and the bursa there gets inflamed. So it is called as a pre-patellar bursitis. PH is a mnemonic. And this is a small table of inflammations around different joints called as tennis elbow. So that's the lateral epicondylitis. Golfer's elbow, the medial epicondylitis. Friction of the elbow around the foot is student's elbow. The first extensor compartment, the FMG exam favorite, is decurvence tenosynovitis. Pre-patellar bursitis is housemate's knee. And infrapatellar bursitis is clergyman's knee. And then they had shown this photograph, all right, where a small structure was on the anterior part of the flexor aspect of the arm. This is the belly of the biceps because of the rupture of the long head of biceps, called as a Popeye sign. Students are confirming Thomas test for there. They're also confirming that the bursa was asked, and they have confirmed the housemate knee was asked, and they had asked in this question, why will it happen? It will happen because of the rupture of the long head of bicep. They had not mentioned the sign, Popeye sign. All right. This is what I have in ortho till now. My role was very, very simple. My role was to welcome you all into this session. Right. My role is basically to pass on the baton to your favorites. I have two individuals right on the screen, which I can see, and you will be falling in love with them very soon. We have Dr. Zainab Vora and we have Dr. Vivek Jain sir. In my entire talk, I was noticing किसी ने एक भी दिल नहीं उड़ाया, और अब आप देखिए ये दोनों आएंगे तो दिल की बौछारें लग जाएंगी. And I wish that you people have great evening. All right, and I am very sure that you're going to have good time. Over to you, Zainab, and over to you, sir. Thank you very much.
Thank you. Hello, sir. Hello, Vivek, sir. How are you?
Hello.
Sir, can I start?
Absolutely, Dr. Zainab, absolutely.
Okay. Hi, guys. So now we'll be doing the radiology questions very quickly. Let me know if there are any questions apart from this. These are the ones that I've gotten so far. So the first question is, An image-based question. So there was a 6-month-old child admitted in the hospital with bilious vomiting. The abdominal X-ray has been shown. What is the likely diagnosis was asked. So as you can see in this X-ray, just let me know if this is the X-ray that was there, a similar X-ray. So what you see is that the stomach is filled with air and there is one more bubble. So this is what we classically refer to as the double bubble sign, something that is very, typical, very cliched exam question as we say it. So this is the double bubble sign and it represents duodenal atresia. That would be the best answer here in case there are 3 bubbles, right? Meaning that there are 3 loops of bubbles which are distended. That would be ileal atresia. So what we see here is a triple bubble sign. And congenital hypertrophic pyloric stenosis, you can just rule it out of the fact of the history only that there is bilious vomiting. If there is obstruction at the level of stomach, you will have non-bilious vomiting, right? So that is the first thing that you can rule it out with. And if in the X-ray we have to talk about it, we are going to have just one distension here, one bubble, single bubble is what we see in CHPS, right? So this is what you need to know. And midgut volvulus is something wherein you're going to see a barium image usually, wherein they'll show you a corkscrew sign. So this is not something that wherein they're showing you that. So they'll be seeing a corkscrew sign here. So this is duodenal atresia. Case history में newborn दे रखा था, ठीक है. I think that doesn't change anything. As long as the image was like this, everybody, are you newborn was there, ठीक है. Fair enough. Any age, like till, as long as it's a child who's having obstruction, which is bilious vomiting, it will be duodenal atresia. Yes, everything else is okay with this question. So this is duodenal atresia. Next question was radiological investigation of pheochromocytoma. I don't know if this was directly asked या फिर इसमें history describe था, hypertension, sweating, palpitation, ऐसे करके पूछ सकते indirectly indicating towards a pheo, or they can directly ask you. The good thing is they did not confuse you with statements. They directly mentioned radiological investigation of choice. Otherwise, the investigation panel for pheo can get a bit confusing and controversial. But अगर radiological investigation पूछा है, तो answer is without any doubt MRI, right? So radiological investigation for pheo, which is the best to localize it, it's going to be an MRI. And remember, on MRI we see a very, very hyper intense signal. It's a very T2 hyper intense lesion, जिसको हम बोलते हैं light bulb sign. इतना bright होता है, it looks like a light bulb, right? So that's why it's the best investigation. It has the highest resolution of picking it up. अगर option में MIBG PET था, or I can still, if I give you one more option here, Dotanoc PET. Remember, still the answer would be MRI. Answer will not change because radiological investigation to localize कि pheochromocytoma adrenal, suprarenal में है या कहीं और है, extra adrenal है, MRI will be our best bet. But if they ask you metastasis, right, investigation of choice to know metastasis in a pheo that we are thinking would be malignant, MRSA metastasis, MRSA MIBG. That's how you remember. If they ask you investigation of choice for knowing an extra adrenal pheo, जिसको हम नाम देते हैं paraganglioma, then your best answer would be Dotanoc PET. As I said, pheo में investigations are very controversial, very confusing. So अगर ये words है, सिर्फ इतना कि लोकलाइज करना है pheo है या नहीं, MRI बेस्ट बेट. अगर मेटास्टासिस का नाम था तो MIBG पैट. अगर पैरागैंग्लियोमा, एक्स्ट्रा एड्रीनल pheo की बात हो रही है, then Dotanoc PET, right? So I've given you all of the options and their respective answers. CT unfortunately is not very sensitive in picking up pheochromocytoma, nor is ultrasound, and FDG PET doesn't have any role here. So ये 3 तो out है, but इसके अलावा I've given you the relevant options. Now coming to the non-radiological aspect, just to clarify the topic of pheo in itself, अगर आपसे पूछते हैं initial investigation, right? So usually what you will start off with urinary metanephrines, right? So initial would be a urinary metanephrine test that you can do. Okay. हिस्ट्री था कि 24-hour मेटानेफ्रिन हो चुका है, फाइन. सो अगेन, सो दैट दे हैव सिंप्लीफाइड इट फॉर यू. उन्होंने आपको ज्यादा कंफ्यूज नहीं करा बाय गिविंग 24-hour प्लाज्मा मेटानेफ्रिन इन द ऑप्शन और 24-hour यूरिनरी मेटानेफ्रिन इन द ऑप्शन, बिकॉज अदरवाइज इट वुड बी बेटर देन MRI. So they've already said this and then they are asking, okay? MRI was not in the option, and if MRI was not in the option, then I think उसकी जगह other options remaining the same, then you go for MIBG, right? So the order would be, agar MRI nahi tha, if Dotenok PET was there, choose that. If that was not there, then choose MIBG. You know, so it will depend totally on the options. Agar MRI nahi tha, then go for MIBG. But CT, ultrasound, FDG, they do not have any role. So that is what is very categorical. So ye jaan ke, then, you know, you can give me the options. ठीक है, I think that's fair enough. Most of you are saying that कि MRI नहीं था, बस MIBG था. So I guess then MIBG would be the best answer if it was the case. ठीक है, fair enough. Okay. Radiotherapy se direct question tha. Radiotherapy in FMG is particularly important. Even if you look at their blueprint, no, they say that radiotherapy will be 5 questions, radiology is 5 questions. Not that they follow it to the T, but the radiotherapy weightage is definitely more than NEET and INI. And this time also you had 2-3 questions. ठीक है? हाँ, fine. So ultrasound, MIBG, FDG. ठीक है? So we've decided we go for MIBG then. Okay. Linear accelerator is used for the production of. Was this question there? ये question था. तो इसमें answer होगा. क्या answer होगा? What do you think? The linear accelerator is an instrument which we use for production of X-ray and electrons, right? 2 things are produced from it. So out of this, X-ray would be the best answer out of the given option. ठीक है? Protons are produced in an instrument known as cyclotron. Neutrons we do not use anywhere in radiotherapy, and gamma rays are produced by radioisotopes like cobalt-60, cesium, जो हम nuclear reactor में बनाते हैं. X-rays and electrons come from LINAC, and this is what we most commonly use now. X-rays are the most commonly used agents for radiotherapy, and linear accelerator is what we use. Yes, so this was straightforward, clear. Everybody, इसमें कोई controversy नहीं है, no doubts. Linear accelerator, also known as LINAC. Okay, so this is for radiotherapy. फिर here I'm not so sure about the options क्योंकि मुझे सारे options recall नहीं हुए. So help me with this. Which of the following is true about radiotherapy? Vomiting is a late adverse reaction. So this is definitely false. Vomiting is an early reaction. It's a deterministic effect which happens early. It's very general knowledge kind of a statement as well. Signs and symptoms are reversible. No, they are not reversible. Once the damage occurs, once the side effect happens, they're not reversible, right? So particularly when they're talking about syndromes like hematopoietic syndrome or GI syndrome or CNS syndrome, these are syndromes or systems which are affected by radiotherapy. Once affected, it's not reversible. फिर बाकी 2 options I don't think were very accurate as I've shown you. So you can just tell me what were the exact options. But out of this question, I'll just tell you dose of the radiation at a point is inversely proportional to the square. So this is known as the inverse square law. And this indeed is a true statement. और ये बहुत बार पूछा गया. This is a very, very repeated previous year question. And last is pairs actively dividing cell, which is also wrong. Okay, so you are saying it was all about CNS toxicity and there were questions on necrotic encephalopathy. All right. हमको ऑप्शन समझ में नहीं आ रहे थे उसमें. Okay. All right. So I don't know what to do about that then. ठीक है, in case you remember like something vaguely, you can let me know later on about what were the exact options. There was necrosis due to radiation is worst. Okay. Pretty non-specific, I guess. ठीक है, so it was on CNS toxicity. Let's see if I can get the exact options and I'll add it in the recall video. Otherwise, अगर सबको ही नहीं समझ आ रहा था, then I don't know what to do about this question. But what you can take away, at least for the juniors who are watching, is that inverse square law is something जो बहुत पूछा जाता है. So just know about that. All right, so I think we can move on. GI adverse effects bhi tha. I'll tell you the sequence. One question again, which has come a lot of times, is the sequence. Okay, so remember, pehle hematopoietic syndrome hota hai, which happens around 1 to 2 grays of radiation. Fir hota hai GI syndrome shutdown, which happens somewhere around 10 to 20 gray radiation. And then the final one is cerebrovascular syndrome, which is the brain and the heart, jo ki around 100 gray, 20 to 100 gray ke beech mein hota hai, which is the severe most effect wherein death happens in less than 48 hours, right? So iske around usually questions aate hain in almost every exam, right? So you should know about this. If there was something specific about brain encephalopathy, then we can talk about it. But I think by encephalopathy, they mean cerebrovascular syndrome. So just know about this much, okay? Right, what about this? Was this question there? Trauma approach? Again, almost every exam has a question on approach to trauma. 22-year-old man presents to ED after a road traffic accident. BP was low, so person is in hypotension. There is tachycardia, respiratory rate is fine. What will be the next step? So as long as they are asking next step, chahe banda stable hai ya unstable hai, it doesn't really matter, right? What would be the next step? Next step is going to be EFAST. So whether the patient of a road traffic accident after blunt trauma is stable or unstable, it would be EFAST. Okay. Direct cause of PPH, तो I think Raina ma'am gynae में discuss करेंगे, मतलब atony और trauma, she'll discuss I think with options. Okay. All right, Rajashri saying ma'am 48 hours नहीं था, 1 week था, then that's also a wrong statement, है ना? इसमें death occurs in a matter of hours. If your heart and brain stop, you're not gonna survive for weeks. So that's gonna be a wrong statement again. So here the death happens in hours, here it happens in weeks, and here it happens in months, right? So that's the timeline in which the death usually happen and the symptoms span over. ठीक है? हाँ, तो ये वाला सवाल ठीक है एवरीबडी, ट्रॉमा वाला क्वेश्चन. तो दिस इज वेरी एक्सपेक्टेड क्वेश्चन. वी ऑलमोस्ट डिस्कस इन एवरी क्लास. यू स्टडी इट इन सर्जरी एज वेल, रेडियो एज वेल. सो द नेक्स्ट स्टेप, वेदर पर्सन इज स्टेबल और अनस्टेबल, इज गोना बी EFAST, right? So just to complete this topic very quickly, if the person is stable and the EFAST is positive, the next step would be CCT. If EFAST is negative, the next step would be to observe. Unstable patient, irrespective of the EFAST, we have to shift to OT because the person is not responding, right? So this is the flow chart जो हमें पता होना चाहिए. Okay? एक question ही नहीं था. Some people are saying कि option ही यही थे. Okay? ठीक है, if it was not there, then we can move past it. Some people had told me that this question was there on trauma. Okay, anyways. So this is what we had as far as radiology is concerned. If you have any other questions that you can recall, then you can tell me right now. अगर कुछ याद आ रहा है, anything else from radiotherapy or radiology that you can remember? कोई और image based question? Was there any image based question on horseshoe kidney? Horseshoe kidney की CT image पे सवाल था. This is also a repeat question. Same question came in the January exam. Did this question come? This question was not there, but history same tha. Okay. There's no EFAST. All right. Okay, let's see. Agar question, if you know the exact details of this trauma question, then you can let me know. Or maybe agar surgery tak yaad aa jata hai, to you can tell Amrit sir as well. Horseshoe kidney was there, right? So there was that. Apart from that, any other question that you know from radiology that you want to ask or discuss? Otherwise, we have Vivek sir waiting with lots of questions from PSM. Okay, I guess this is it. So, anything else, you can just ping me up anytime. Thank you so much and all the best, and just chill out and relax and pat yourself on the back. You have given a very good exam, and irrespective of what happens, you have to enjoy now and take a break, take a step back and enjoy life. That's very, very important. Sir.
Vivek sir.
Yes, sir.
हमारे जो स्टूडेंट्स हैं वो आपको सुनने के लिए बड़े ईगर हैं.
Okay.
और before you start, we will like to thank everybody in the team Cerebellum for conducting this session on a short notice. And more importantly, all the teachers of Cerebellum who are always ready for the students. So I believe that you people utilize this and understand the way that the questions are coming and how the teachers are teaching you to approach them. Because जिनका ये FMG हो गया, हम आशा करते हैं तो आगे जाके नीट का एग्जाम देंगे, और जिनका अगला FMG है, तो as Dr. Zainab just said, they will learn how the questions are being framed. So now you have one of the most experienced teacher of the country who has been training FMG students for almost 2 decades now. And his books, his notes are the gold standard for PSM and almost taken as the textbooks now all across Southeast Asia and different countries. And there is no limit to his hard work for his subject and the love for his. He is somebody who is just not sending his books to different countries. He also loves to travel to all those countries to check whether the books are there or not. So इसे कहते हैं the checking system of the books and cerebellum. Over to you, Vivek sir.
Thank you so much, Apoop sir, for such an elaborate introduction. Thank you, Dr. Zainab ma'am, for such a lovely, fast presentation. And friends, as Dr. Zainab says, believe to rakho. I will tell you just one more thing, add to it. Videos to dekho. Please watch videos. Do not rely only on notes. I know all of you are going to clear the exam this time itself, but at least to your juniors, you should convey this message. Watch the videos, videos to dekho. Okay, friends, let us start now with PSM questions. I've got around 18 till now. I expect 3 to 4. You will help me construct more. 2022 we get every time. What I've done also in this particular session is I've taken screenshots from my mobile app videos. This will help you realize the importance. Okay, we have to watch videos. Majority of questions we can solve if you have just watched the videos once. So there were around 18 questions I've got till now. Choices you will help me complete. And I'm hopeful by the end of this session, we'll make it 20 to 22 questions. So let us start with the first question. What is the target for reduction of MMR by the year 2030? Friends, I'm also looking at your YouTube chat box. This was asked from Sustainable Development Goals. There is a separate video on Sustainable Development Goals under the unit International Health in PSM videos. And what is the answer to this question? Look at this. Yes, I have mentioned categorically that target 3.1 says MMR should be brought below 70 per 1 lakh live births for the maternal mortality rate. Similarly, we have for under 5 mortality rate 25, neonatal mortality rate 12 per 1,000 live births. So this is question number 1. I'm sure majority of you, rather all of you must have got this right. Okay, Dr. Yogesh, Dr. Medijat, Dr. Indian Scholar, you are right. I'm so happy to hear that. So friends, this was the first question. Second question, number of live births per 1,000 women in reproductive ages. This was again a repeat question, friends. I'm looking at your response right now. Could you please tell me the answer? Is it TFR, GFR, age specific or gross reproduction? In case any choice was wrong or I have written wrongly, please do let me know. I'll keep on correcting it side by side. In the chat box, you can write. Okay, friends, chat box has gone quiet. This is a repeat question. We have discussed this in the video demography. There is a separate video of indicators. So this is very right. Many of you have, most of you are marking correctly, rather all of you are marking correctly. This is GFR, general fertility rate. All of us know total fertility rate is total number of children born to a woman. Age specific fertility rate is that when we look at 5-year age intervals. Gross reproduction rate is number of girls born to a woman in her entire reproductive lifespan. Right. So this is GFR, general fertility rate. Then there was a question on expired drugs disposal. Friends, if there was any change in the language, do let me know. Otherwise, what should be the expired drugs going into? This was older category number. Before 2017, there were category numbers. This was older category number 5. Discarded medications. So discarded medications goes into yellow, red, white or blue. I'm looking for your answer, friends. I'm looking at the chat box. Okay, Dr. Sachin Vijarnia has answered correctly first. This is yellow bag incineration. And I'm sure you have marked this correctly because in the video also, and you must have seen in notes also, I've mentioned this categorically. Look at this. Expired medications, incineration, and this is yellow category. So just tell me one thing. Was the method of disposal also given along with the categorization? Was it only yellow, red, white or blue? Or was it also given like this? Or was it given like this? Yellow incineration, red autoclaving, white iron foundries, or so on? Okay, thank you, Mr. Doctor. So it was only related to yellow. So what I will do is I'll remove incineration from this. Right. Then there was one question on mid-arm circumference measurements. Friends, I don't know the questions at all. Do let me know, was it related to PSM? If yes, what was the exact question? Could you help me reconstruct this question? In case anyone is not able to write anything right now in the chat box, you can also WhatsApp me the question on this. Also, we have 2 Cerebellum Telegram groups. You can send your questions there also. Mid-arm circumference. I can tell you what I've taught you. I've taught you regarding mid-arm circumference using Shakir's tape as the field instrument, and the cutoffs is include more than 13.5 normal, 12.5 to 13.5 as mild to moderate malnutrition, and red color severe malnutrition below 12.5. If you remember carefully, I have told you categorically both in Hindi as well as English video that only WHO has a different cutoff for severe malnutrition, where they don't take mid-arm circumference, they take mid-upper arm circumference cutoff less than 11.5 as the criteria for severe malnutrition. So please remember, if they have asked WHO cutoff for severe malnutrition, that is 11.5. In case it was not in the choices at all, then you have to go for Indian less than 12.5, 3 color-coded tape that we are using in India currently. Yes, SAM cutoff, okay. Dr. Traveling is telling SAM cutoff. So friends, definitely it must be 11.5. Severe acute malnutrition, if they are asking, then this is 11.5. Okay, great. Okay, friends, we move forward. There was a question on medical termination of pregnancy. In fact, there were 2 questions from MTP. One more question will come later. Medical termination of pregnancy can be done until 24 weeks period of gestation for. First, tell me, friends, was this a question related to what are the indications, or was it related to only the timing till what time we can do medical termination of pregnancy? Just please confirm. Okay, Dr. Navrang Chaudhary, it was about severe acute malnutrition. Okay, it is not PSM, but I've taught you in PSM. WHO has a different criteria for SAM, less than 11.5. I've also told you the 3 other indicators we use beside this for severe acute malnutrition or SAM. That is covered in Nutritional Rehabilitation Center, NRC. Okay, last option was minor. Thank you, Dr. Yogesh Rathore. Thank you so much, friend. Okay, friends, what I can tell you, you can find the answer in that MTP currently is permissible up to 24 weeks period of gestation. I've taught you in the video. Then it is low risk 0 to 20 weeks, high risk 20 to 24 weeks. Low risk, only 1 doctor's opinion is sufficient, whereas for high risk, 2 doctors' opinion is required. I'm telling you this because later one more question will come from MTP Act of India. Then they have told that when you look at high risk, under which conditions it should be done, it is done for vulnerable females in which we have rape, incest, minor, disability. So 20 to 24 is done for rape, incest, in case female is a minor, and in case female is having any sort of disability. So that should be kept in mind. Right, friends? Okay, we move forward. So depending on the choices, please mark the answer correctly. Okay, there was a question on rule of halves. What I got as a question from the student was, mark which of them is adequately treated. So friends, all of us know rule of halves is for disease hypertension. And what does this rule say? In the video, hypertension, if you watch under the unit non-communicable diseases, this is a very popular topic asked in your FMG exam as well as NEET PG exam multiple times. So I've told you what is rule of halves. Given any adult population in the world right now, 50% of them have hypertension. So outermost is total population of adults. Second circle, 50% hypertension. Out of that, 50% have symptoms. Out of those, 50% seek treatment, and innermost circle, out of those, only 50% get adequate treatment. This is rule of halves having total 5 circles. I think this time, this diagram on the right was there in the paper. Innermost circle was asked. Thank you, Dr. Aman Gupta. So this is adequately treated. Innermost circle, the 5th circle from the outside. Okay, Dr. Sandeep is asking severe acute malnutrition, mid-arm circumference, then you have to mark less than 11.5 according to WHO criteria. So this was rule of halves. Innermost circle, adequately treated. 50% get adequate treatment. So please go through the video once. Advise your juniors to go through the video once. Okay. Number of deliveries in type A PHC. Okay, friends, what is the answer to this question? I'll wait for your response in the chat box on YouTube. Friends, I told you that subcenter is type A and type B. Type A, no delivery. Type B, delivery facility is available. Primary health center delivery is there. So what is the basis of delivery? What is the basis of differentiation between type A PHC and type B PHC? It is the number of deliveries per month. And this is also a question which is directly from the video. I'm sure you must have seen this, that in type A, we have less than 20 deliveries. So I hope all of you have marked this correct, because in English videos as well as English videos, I have discussed this topic in extensive detail. Type A subcenter, type B subcenter, type A PHC, type B PHC. So this question, there is no excuse for getting it wrong in the exam. Friends, in fact, out of the 18 questions I'm discussing with you right now, at least 17 should have been correct. 16 to 17 based on the videos only if you have gone through them once. Okay, good to see. Okay, one question I have not included, but Dr. Sandeep Parmar has already mentioned, so I will take it up at the end. So friends, just wait. I'll just write it down. Okay, this I will take at the end. Okay, friends, let's move forward. We have other faculties lined up for the discussion. Most common direct cause of maternal mortality. Friends, I have discussed in the video that commonest cause of MMR in India is postpartum hemorrhage. If you have listened to the video, I have mentioned there and then only that most common direct cause is postpartum hemorrhage. Indirect cause is anemia. Overall, PPH is more common than anemia. So PPH. Okay, Dr. Navrang Chaudhary says option was equal to or less than 20. Even that is correct. If less than or equal to 20, more than 20. Type A PHC is less than 20. Type B PHC you can say is more than 20. More number of deliveries, type B. Lesser number of deliveries, type A. 20 is the cutoff. Okay, Dr. Aman is saying indirect was asked. Dr. Aman, if indirect was asked, then it is anemia. Some students are saying PPH was not in the option. So friends, depending on the question, Dr. Navrang is saying this question was not asked. Question was definitely there, friends, because this has been told to me by at least 5-6 different sources. Direct cause of maternal mortality was asked in the exam. Okay, we move forward. Under MTP Act, we want to terminate meningomyelocele fetus at 21 weeks period of gestation. So it was, who do we take for consent? Mother, husband's consent, and we are also looking at 1 doctor's opinion, 2 doctor's opinion. So friends, I shared with you, if it is a high risk, then because it is 20 to 24 weeks, so high risk pregnancy is 20 to 24 weeks. 2 doctors' opinions is required. And please remember, generally in MTP Act, mother's own consent is sufficient until unless she is having some psychiatric issues. They call a term which I don't want to use. And also in case she's a minor, then only guardian's consent is required. So please remember, high risk pregnancy, this is 2 doctors' opinion is required. Mother's consent is generally sufficient for carrying out MTP under Indian Act. So I am sure 100% of you have marked these questions answer correctly. So friends, this Act, MTP Act, I have described under National Health Programs, Policies and Legislations unit in the video. Please go through either English or Hindi video. Urban healthcare system, which of them is not included? PHC, CHC, district hospital or sub-center? Friends, again, I have described in the video on healthcare system in the country that when urban healthcare system was designed, we tried to keep primary, secondary and tertiary level also exactly similar to rural healthcare system. But what was the difference? At primary level, there was no provision for creation of sub-center. I have told you this point categorically that in urban healthcare system, only UPHC, Urban Primary Health Center, also known as Urban Health Center, is there. But there is no provision for creation of sub-center in an urban area. So friends, I am hopeful. I wish if you have seen the video, if you have gone through the notes of Cerebellum, you should have or have to attempt this question correct 100%. Okay, Dr. Aman Gupta, I'm so happy to see you have attempted this answer correctly. Lovely. Okay, so friends, let's move forward. Just to remind you, please advise your juniors to watch videos. Do not only rely upon notes. Videos followed by notes for revision is the key to success in any examination of India. Let's move forward. Okay, there was some question related to vitamin A. Some students mentioned it was 1 to 3 years age. Some students mentioned it was 1 to 6 years age. Friends, whether you go in National Immunization Schedule of India, or you look at treatment of xerophthalmia, or you look at National Anemia Prophylaxis Program, National Nutritional Anemia Prophylaxis Program, which was there earlier. In all of them, what is the golden rule that we have discussed throughout the app? These are screenshots from 2 different videos where I have told you, if age is less than 1 year, 1 lakh international units. If age is more than 1 year, 2 lakh international units. This is for prophylaxis also, treatment also. Less than 1 year, 1 lakh international units. More than 1 year, 2 lakh international units. So depending on the question, even if they asked prophylaxis under the program, even if they asked immunization schedule, even if they asked xerophthalmia treatment, less than 1 year, 1 lakh, more than 1 year, 2 lakh international units should be given, right? Okay, Dr. Yogesh Rathore, thank you, friend. You have mentioned 1 to 6 year in endemic area prophylaxis. So this is correct. In endemic area, more than 1 year, it has to be always 2 lakh international units. Okay, there was a question on correct match for triage. These are the choices I got: red, black, yellow, and green. Friends, all of us know what is triage is. Categorization of victims of disaster. I have told you in the video, it is not based on severity of injury. Rather, it is based on likelihood of survival, right? So friends, I'm sure you have marked this answer correctly, because in the triage video under the disaster management unit, I have told you this with the color coding scheme and the tagging system also. So I'm hopeful that you have read this topic or understood this topic correctly. Red is highest priority, then yellow is high, green is low, black is least. And these are known as emergent, urgent, non-urgent, and expected. So depending on that, yes, you are right, Dr. Yogesh. Green is ambulatory. I have mentioned in the question, in the slide also, if you can see. So in this screenshot, you can see a single slide of this triage topic is sufficient to solve majority of questions which are asked in our exam from triage. And triage comes in our exam every time. I'm sure you have marked this correctly, right? Okay. International Health Agency, which is aiding building toilets in India. Now, friends, this was a question which was asked for the first time ever in any exam of India, but I am sure you have marked this correctly. Let's see how many of you have marked this correctly. Thank you, Dr. जी. सारे नोट, सारे क्वेश्चंस पीएसएम के नोट से ही हैं. नहीं, दोस्त सारे तो नहीं आते. 1 या 2 क्वेश्चन तो बाहर से हर बार आएगा. But I am not worried about those 1 or 2 questions. I am worried that I want that other 16 to 18 questions out of 20 you have to mark correct. Okay. So Dr. Studymore says B. Friends, Dr. Studymore, you are absolutely right. Ford Foundation. Sanitary toilets in India, they are the organization. There are 5 major functions in our country, out of which. So in the international health agencies, Ford Foundation I have mentioned, it is the agency which is aiding in building toilets in the country. Okay, Dr. Kishan, I will forward your suggestion to the team. It's a very valuable suggestion. Okay, there is a question on 6x6x6 strategy under Anemia Mukt Bharat. Friends, I was not able to get choices for this. Can you tell me the choices? I can predict the choices because if this was the question, I know what the choices could have been. So anyone remembers what was the choice for this 6x6x6 strategy in Anemia Mukt Bharat? Quickly, can anyone write? Was this question including? It includes all except, most probably. This should have or could have been the question, that 6x6x6 strategy under Anemia Mukt Bharat include all except, because actually 6, 6 and 6 represent 3 different components of Anemia Mukt Bharat. Okay, no one is telling. So what I will do is, I will tell you the screenshot from the mobile app. If you'll go to the Cerebellum PSM videos, under national programs, there is a separate video on new health programs. In this new health programs, I have covered Anemia Mukt Bharat in extensive detail. So you can see there are 6 beneficiaries, 6 interventions, 6 institutional mechanisms. Okay, Dr. Stylish Star has mentioned. Okay, there was one choice, integration, one choice, coordination, one choice, ministry, treatment. Okay, so it seems they have given beneficiaries different combinations. So what I'll tell you is, I'll tell you the correct answer. It includes 6 beneficiaries, 6 interventions, out of which one is iron folic acid, which is asked also, and 6 institutional mechanisms in the country to reduce prevalence of anemia. I hope if you, otherwise I'm sure that you must have marked this answer correctly, because Anemia Mukt Bharat has been coming in all exam of yours since last 3 years now, continuously. Okay, Dr. Priya Gupta, you are right. Let's move forward. Okay, there was one question on HIV positive woman not on any treatment delivers a baby, initial treatment for the newborn. Friends, if this was the exact question, if this is from the National AIDS Control Program guidelines, then I have mentioned in the video on National AIDS Control Program that when you give triple ARV prophylaxis to mother to prevent HIV transmission in the newborn, then also, otherwise also, newborn should get nevirapine prophylaxis for 6 weeks. So do help me, do let me know if this was the question which was asked exactly, or there was some change in the question's language or something else. Because if HIV positive woman delivers a newborn, she has to start breastfeeding, exclusive, no doubt in India at all, we have discussed. But at the same time, newborn should get nevirapine prophylaxis. After newborn's HIV positive status is tested, and suppose the newborn comes out to be positive, then treatment will start and continue lifelong. Okay, again, this question, I have got no response in the chat box. Friends, please confirm if this question was there or not. I'll just take 5 more minutes. Let's wrap up this session. Okay, question was there. Thank you, Dr. Navrang Chaudhary. Okay, Dr. Stylish Star says this was the exact question. Okay, so nevirapine prophylaxis. Okay, friends, Dr. Yogesh Rathore, one question on 55 kg. It will come, friend. It will come. This question I've got. Was there, there was also a question on low height for age. So if this was such an easy question, answer we know, stunting. Go through the preventive pediatrics video in preventive obs and peds unit in the Cerebellum app PSM videos, English or Hindi. If you go through either of them, it is absolutely same, right? Except the language. That low weight for age is underweight, low weight for height is wasting, low height for age is stunting, if this was asked, right? So this could have been one of the easiest questions. Till now, all questions have been easy, I think, barring Ford Foundation sanitary toilets. All other answers you must have marked correctly in the exam. Okay, friends, this was second new question in the paper. School health in 2018 was combined under. I'm not sure of the language exactly. This is what students told me. School health in 2018 was merged into. So it was, you can say, merged or combined with Ayushman Bharat. Could you please help me complete the other choices? I've told you the answer, that school health was merged with Ayushman Bharat in 2018. If anyone remembers, what were the other choices? I'll just wait for a few seconds. Okay, Dr. Deepra says it was there. Thank you, friend. Yes, all these programs are part of National Health Mission, National Rural Health Mission, but specifically Ayushman Bharat. School health services, in case this older question was asked, this is the responsibility of primary health center. So it depends whether they were asking the school health services were delivered by or are delivered by primary health center, or they asked this school health program was merged with Ayushman Bharat. Yes, in this Rashtriya Bal Swasthya Karyakram also has been merged recently. Okay, next question. Okay, I think this was the question. 55 kilogram woman needs how much proteins? Now, friends, I have covered this in video. There is no chance you have attempted this wrong. I mentioned categorically by writing that it has to be 0.83 grams per kg per day. At the same time, I have not written on the slide, but you watch the video, listen to the video. After this, I categorically spoke that a man and a woman will require 54 and 45 grams. I've discussed in the video in detail that 1 gram per kg per day. This protein requirement is not meant for Indian population. This is for European population. Indian population 0.83 and 54 for males, 45 approximately for females. So either 45 or 46, whichever was given in the choice, 45 is more precise, right? Okay, let's move forward. Well, friends, this you have to confirm. Was there any question related to bleeding or gum bleeding occurring due to which vitamin deficiency? I have covered in the video on nutritional deficiencies under the unit nutrition in PSM videos that gum bleeding is very common. Yes, delayed wound healing is also there. Why delayed wound healing is there? Because impaired collagen synthesis. So you tell me, was there a question on gum bleeding? Friends, please do share. Was there any question on gum bleeding available? Was there a question on gum bleeding in your exam? Okay, Dr. Shaili Star says yes. Okay, thank you. Dr. Ji कह रहे हैं cerebellum है तो मुमकिन है. Definitely, friends, you are there. Therefore, cerebellum is possible. It's all because of you. Thank you so much. Okay, so this question was there. I'm sure you have marked this correctly because this is again a repeat question. Okay, friends, we come to the end of the questions, but one question was shared by a friend in between. There was a question related to bioterrorism. This I have discussed in bioterrorism agents video in international health. We have category A, B, C. Category A include smallpox, bacillus anthracis, anthrax, botulism, plague, tularemia, and viral hemorrhagic fevers. I'm sure question was related to bacillus anthracis. There was a question on zinc deficiency with dermatitis. Okay, that may be from then some other topic. Okay, point source graph was also there. Friends, point source are of two types. Single exposure point source. This graph has sudden rise, sudden fall in number of cases, single peak, and there is a clustering of cases in one incubation period. So this is single exposure point source. Multiple exposure point source will have multiple or secondary peaks. Okay, Dr. Yogesh, if the question was dermatitis, diarrhea, alopecia, wound healing, then this will go into zinc deficiency. What is the zinc deficiency? We have discussed in the video. Acrodermatitis enteropathica. So dermatitis, enteropathica, diarrhea is there, alopecia is there, brittle nails is there, right? Okay, propagative outbreak graph. A student is saying propagative outbreak, slow rise, plateau, slow fall. There is no peak. Fall is also slow, rise is also very slow, like in tuberculosis as well as HIV. We get propagated epidemic, which is seen in person-to-person transmission. So friends, we have already reached till 22 questions or so. In case still any question left, please, you are most welcome to write or share with us on. We have two Telegram channels of Cerebellum. Please go to them and share questions with us. Otherwise, you can directly WhatsApp me the questions on this number. In case any choice was wrong, because I know when we reconstruct questions in such a short frame of time, a single question, so many students are telling us, we do get sometimes wrong language, a bit of wrong choices. It is not intentional. We will keep on rectifying these questions and we'll try to reach the most accurate version of the question and choices before we share with you in the final video in the app. Friends, okay, thank you so much. Now I'm sure Dr. Apoorv Mehra sir, thank you so much, sir. We have a faculty lineup waiting for us, right?
Sir, faculty lineup nahi hai, universe boss hai ab.
Acha, universe boss is there. Hello, Praveen sir, how are you?
यूनिवर्स बॉस आएंगे, सरस्वती माँ के दर्शन कराएंगे और फिर सरस्वती जी को बांटेंगे. द ओनली
सर प्रणाम सर.
आपको
ये अपूर्व सर रैगिंग कंटिन्यू करते हुए मेरी सालों वाली.
और देखिए 2 ब्लैक में बैठे हैं पर ये व्हाइट में आए हैं. शुरुआत से ही बगावती है ये और देवी माँ का आशीर्वाद है इनके ऊपर. इकलौती वेल्थ ऐसी है जो बांटने से बढ़ती है, जिसे कहते हैं नॉलेज.
जी सर.
तो अब प्रवीण त्रिपाठी सर
मैं शेयर करता हूं सर. जी
जीव कहा गया है, इसीलिए दिमाग के गेम से खेलते हैं, साइकेट्रिस्ट हैं और अब उनकी तरफ जा रहे हैं. ये देखिए सर, इन्होंने इकलौता फॉर्मेट सेरेबेलम की स्लाइड्स का कैरी किया है. बहुत ही अनुशासन से जीवन बिताते हैं. रविवार रात को भी अपने स्टूडेंट्स के लिए जाग के सबको जगा रहे हैं. So all the best, Dr. Praveen sir. Enjoy yourself.
Thank you, Vivek sir. Thank you, sir. All right. All right. Good evening, students. So the psychiatric questions were a bit difficult this time. 2-3 questions were actually quite difficult. So no worries. We'll go through those questions, and without wasting too much of your time, I'll come straight to the point. All right. So first question. Now this one was a pretty straightforward question. This question has been asked multiple times. And I think all of you must have gotten this question correct. Female patients presents 5 days after the delivery, and then there are certain symptoms. I hope my voice is clear. I hope my voice is clear. Can you give me a thumbs up? Apoorv sir, आवाज आ रही है मेरी साफ साफ?
Yes sir.
अच्छा ठीक है, great, ठीक है. So
absolutely.
Thank you, Vivek sir. Thank you, sir. So female patient presents to you 5 days after delivery, and then there are some symptoms like sadness of mood, irritability, restlessness, and reduced sleep, right? And they have asked the diagnosis. This question has been asked multiple times. The answer is postpartum blues. Until unless we have some more severe symptoms like suicidal thoughts, psychomotor retardation, excessive guilt, we usually do not answer it as postpartum depression. So first question, very straightforward, postpartum blues. And I think most of you must have gotten it correct. Great. Right. I can see in the YouTube comment section, most of you got it right. It's a repeat question. Every year, NEET, PG, INI, CT, FMG, everybody gives this question. And it's like aata hi aata hai har saal. All right. This was a difficult question. Capgras syndrome. So we keep on talking about Capgras syndrome, but this time they asked, it is commonly seen in which type of dementia? right? So Capgras syndrome, now this is a factual question, and it can be seen in patients with both Alzheimer's disease, and it can also be seen in dementia with Lewy body, DLB, but it is more common in patients who have dementia with Lewy body. So this was a difficult question, factual question. Even if you got it incorrect, don't beat yourself up. It was a difficult question. My bet is 95% of the students would not know the answer, right? So ye dementia with Lewy body. Tahir is saying one more question, naloxone treatment for poisoning. Tahir, was it naloxone for opioid overdosage or was it flumazenil for benzodiazepine overdosage? I'll come to that question. अभी आऊंगा उस पे, but ये question अगर गलत हो गया है तो दिल छोटा मत करिए. Don't get too disturbed by it. It was a difficult question. 95% को नहीं आता होगा. Alright, ये question तो 100% तो नहीं बोलूंगा, 99% लोगों को नहीं आता होगा. It was a very difficult question and I'm surprised why are they giving you questions like this in the exam. But nonetheless, a patient is showing stubbornness and frugality. According to the psychosexual stages of development, the fixation is in which stage? Now, things like stubbornness, frugality, they are usually seen in patients who have fixation in anal stage. Now, this whole theory of psychosexual stages of development by Sigmund Freud is no longer followed. It's not even, considered correct, but for some reason, some examiners continue asking questions from that topic. Again, if you did not know this answer, it's not your fault, right? The answer is anal stage. Just remember this question now because it has become a PYQ. It has now become a PYQ. We'll just remember stubbornness, frugality, part of anal stage. But please remember, you cannot remember all these stages and all the things which are a part of these stages. It's impossible. So don't try to, don't feel bad if you did not know the answer. 99% of students would not have known the answer. ठीक है, टेंशन नहीं लेने का. Urethral stage, genital stage, ठीक है, कोई बात नहीं. Answer इसका anal stage है. Next question. All right, I think this was a simple question. And can you correct the language of this question? A patient presented with complaints of sudden and irresistible urges to take an action. This is characteristic of which symptom? So many students told me that the way we had given, in the notes in Cerebellum, they had asked the exact same line. So was it the exact same line, what I have mentioned here? Can someone tell me? Can someone tell me, please, what was the language of the question? Hanji, come on, please tell me. Monica, can you help me with the language of the question? It's same. Okay, great. So we have done this question even in the Mission 200 program that we were doing. And if you follow the lectures, we have done this question. This is a characteristic definition of impulse, sudden irresistible urge, right? In fact, we talked about this question even when we were talking about schizophrenia, made impulses. So I think you must have gotten the question correct. Great. So most of you got it correct, right? The answer is option A, impulse. Straightforward question, sudden urge to do some action, impulse. All right. So again, students were telling me that this also came exactly in the way it was put in the notes or in the Mission 200 program. So can somebody correct me? What are these the options? All of the following are features of pseudo hallucinations except. So students told me vivid was there. Students told me objective space was there. Can you confirm whether option A or B were there or not? हाँ जी, बताइए. What is the answer, students? यही था? चलो, great. So all of the following are features of pseudo hallucinations except. So we know that the difference between hallucinations and pseudo hallucinations is hallucinations occur in objective space, pseudo hallucinations occur in subjective space within your mind, right? So they have asked all of the following are features of pseudo hallucinations except, and they have said they are perceived in objective space. This is the wrong statement. Pseudo hallucinations are perceived in the subjective space. हम कई बार कहते हैं मन की आंखों से देखना, right? So B was the answer. I can see many of you got it correct. Great. Nice. ठीक है. चलिए. Again, I think something was voluntary, na? हाँ. So I have written it here, voluntary wala. They are not under the control of the patient, which means they are not under the voluntary control. So voluntary, if it was mentioned, I'll just write it down so that, you know, when I create the final questions, I have the correct option. Close eyes and say Deepika Padukone. Deepika Padukone ko yaad rakhoge, so you will never make a mistake on hallucinations question. Okay. Again, lithium side effect, a question which comes almost every year, whether it is FMG, INI-CT or NEET PG examination. So what are the side effects of lithium and which one is not commonly seen? Tremors, most common side effect. Another question, what is the drug of choice for lithium-induced tremors? Beta blockers like propranolol. Hypothyroidism can happen, we know that. Diabetes insipidus, polyuria can happen. Tardive dyskinesia is not a common side effect of lithium. It is more commonly seen with antipsychotics. So the answer for question number 7 is A, tardive dyskinesia. ठीक है जी? Simple question. So correct me if I'm wrong here. Treatment of benzodiazepine overdosage was asked in the exam. Can you help me, students, with this question? Anji, was it treatment of benzodiazepine overdosage or was it treatment of opioid overdosage? For in which case the answer would be naloxone. Over both questions asked. Opioid पे भी question आया था क्या? Did they ask a question on opioid overdosage too? Yes, yes. मुझे समझ नहीं आ रहा आप किस चीज के लिए yes लिख रहे हैं. Was a question also asked on opioid overdosage? Acha, naloxone was in the options. Okay. Okay, the question was on benzodiazepine overdosage, but naloxone was in the options. All right, fair enough. In that case, we know without any doubt the answer was flumazenil. Wonderful. I think you must have gotten this question correct. Simple question. Now there is some confusion on this question even in the WhatsApp group of psychiatry faculties. So we have a WhatsApp group of all the faculties of psychiatry. You know, so we were discussing what exactly was the language of this question. Was it key feature of depression, most common symptom of depression, most specific symptom of depression? Can somebody help me with this? What was the exact language of the question? Was it key feature of depression or most specific symptom of depression? Bataiye please. Was it key feature or most specific? Was it key feature of depression or most specific symptom of depression? Key feature था. Stylish star ने बोला key feature था. Guys, was it key feature? Feature, key feature. Very good. Characteristic feature. So key feature, characteristic feature आ गया key feature. So key feature मान लेते हैं. So if you remember when we started talking about the mood disorders, the first line I said was mood disorders are so called because they are disorders of mood, right? So the answer would become low mood. The most important or the basic feature of depression is it is characterized by low mood. It's a mood disorder. So we'll go with the answer of low mood. Okay, so answer becomes option B. And was this the image in the exam? I think ये anatomy वाले सभी पढ़ाएंगे, but was this the image in the exam? Was this the image in the exam, students? Image na? So it's a repeat question. 2 years back in the FMG exam, they asked the same question. They gave you a similar figure and then they asked you which specialty would you refer this patient to. And at that time, the answer was psychiatrist. In fact, in the Mission 200 program, when we were discussing the PYQs, I did show you the image. So the answer is trichobezoar, right? So these were the questions. Just one question, image alag thi, it was darker. Koi baat nahi. Image agar alag thi bhi to bhi, I think you could have easily identified it. Somebody saying alcohol toxicity. कुछ alcohol toxicity पे भी question था. I think the question was कि किसी ने spurious sources से alcohol लिया है, and now they are developing some symptoms. I think the question was on methanol toxicity. Was it a question on methanol poisoning? And was the answer fomepizole या ethanol? ऐसा कुछ था उसमें? I think Gobind sir will take care of that question. Sir ने बना रखा है उसको. योगेश is saying history of liquor था, methanol toxicity का question था ना. ठीक है, methanol toxicity फिर psychiatry में नहीं आएगा. Gobind sir will take care of it. So that's about it. 8 questions, and again I would just repeat, if you did not get the question 2 and the question 3 correct, it's perfectly fine. It's not your mistake. You are not supposed to get that question correct. As I just said, 95 or 99% of students would have struggled with that question. तो वो नहीं भी आता था तो भी कोई टेंशन वाली बात नहीं है. So this is it, students. And विवेक सर कई बार बोल रहे थे कि हमारा वो ग्रुप है this thing for on Telegram, and सर ने नाम नहीं बताया एक बार भी. So the name is Cerebellum Community Official, right? So we aim to create a community where we can discuss, all the faculties come and discuss, and we can, share all the issues that we are facing. All right, guys, that's it from my side. Apur sir, I'm done here.
Thank you, Universe Boss.
Thank you.
Now let's call the boss.
हाँ,
Goga bhai.
गोगा भाई is coming. चलिए. Stop sharing. Right. गोविंद सर प्रणाम.
हाय अपूर्व.
आप देख सकते हैं गोगा भाई ने पीछे डॉल्स रखी हुई हैं सुंदर सुंदर, कोने पे राइट कॉर्नर पे, एक्सट्रीम कॉर्नर पे, जहां से गोगा भाई पीछे भी छक्के मारते हैं, तो वहां से भी प्यारी प्यारी डॉल्स आपको दिखा रहे हैं. वो
डॉल्स सर कोई वो तो नहीं है.
बताना चाहते हैं कि फार्मा जो है वो खेल खिलौने का काम है जब गोगा भाई पढ़ाते हैं.
हाँ, ये बात.
और आप देखिए गोगा भाई ने संडे इवनिंग बिल्कुल सिंपल बैठे हुए हैं, शांति से, कोई पार्टी नहीं कर रहे ताकि वो अपने स्टूडेंट्स को पढ़ा पाए.
अच्छा, एक इंपॉर्टेंट एमसीक्यू मेरी तरफ से है. डू यू गाइस लाइक जीआरजी नेम मोर और गोगा नेम मोर? अपूर सर गोगा कहते हैं, मैं जीआरजी कहता हूँ. वोटिंग हो जाए जल्दी से. यू लाइक जीआरजी मोर और गोगा मोर?
बिकॉज माय वाइफ आल्सो सेज के तुम गोगा को क्यों प्रमोट कर रहे हो, अच्छा नहीं लगता.
जीआरजी अच्छा लगता है. अपूर सर नॉट डन.
देखो घर में और दोस्ती में जीआरजी रख लेते हैं, पर स्टूडेंट्स ने नाम गोगा दिया है तो देख लेते हैं.
देख लेते हैं, अभी बच्चे बताएंगे. जीआरजी या गोगा चूज करें.
चलो, ऑल द वेरी बेस्ट भाई. हैव अ ग्रेट टाइम.
Thank you
very much.
Praveen. Let me share my screen.
जी सर. बच्चे तो सिर्फ गोगा ही कह रहे हैं, मैं हार गया लगता है.
दोनों में तुम जीतोगे भाई, जो भी बोलेंगे तुम जीतोगे.
हाँ, यूनिवर्स बॉस हैं तो गलत हो ही नहीं सकते.
All right, all the best students. Govind sir, thank you. Thank you, Apur sir.
Thank you everyone. Now we will be discussing some questions. I think this is the first time in around 20 years of my teaching to FMG students that I have not got enough questions of pharmacology. Normally I used to get around 25-26 questions, and definitely I will get in few days, but today I am not able to get too many questions. But jitne bhi mere ko questions mile hain, we will discuss, and then you can let me know if you remember any more questions from pharmacology. Okay, so starting with the first question. This was, I think, Dr. Praveen was talking regarding methanol poisoning. Clear? So one option was naloxone. In this question it was naloxone. यार एक और क्वेश्चन था naloxone वाला ना. I think the option was in that. चलो इसमें भी पहले क्वेश्चन देख लें. This was the question. A person bought 2 bottles from a liquor shop and later presented with drowsiness, blurred vision and ataxia. What is the antidote? Is it the right question? Just let me know. पहले क्वेश्चन बता दो क्या सही है. आंसर्स पे हम आ जाएंगे. So Rajitha was saying fomepizole. Fomepizole was in the option. If fomepizole was in the option, that will be the answer. Okay. So ethyl alcohol and fomepizole both can be used, but antidote which is preferred is fomepizole for methanol poisoning. Naloxone was in both questions. Okay. So the D option is naloxone. So this question is complete. So ये पहला क्वेश्चन कंप्लीट हो गया. आई थिंक डाइजिपाम गिवन इन द ऑप्शंस. इसी में ऑप्शन में था डाइजिपाम. Mayuri saying diazepam was in the options. हाँ सर, fomepizole was not in the option. Fomepizole was not in the option. Okay, fomepizole की जगह diazepam होगा, I think. So answer will be ethyl alcohol in that case. ठीक है. Ethyl alcohol was given, fomepizole was not there. Got it. Guys, remember this. This may be an old question because nowadays fomepizole is preferred antidote. Ethyl alcohol is no longer used. But questions ये I think कई questions पुराने उठा के चले आ रहे हैं, तो इसलिए ये question बना दिया गया है. Ethyl alcohol can be used, but drug of choice is fomepizole. Okay, so I think ये question हमारा बिल्कुल complete हो गया. Next पे चलते हैं. 4 friends are planning a trip to Ladakh. ये क्वेश्चन ठीक है. ड्यूरिंग दिस स्टे वन ऑफ देम बिगन एक्सपीरियंसिंग सिम्पटम्स ऑफ हेडेक, नॉजिया, डिजीनेस एंड फटीग. व्हिच द फॉलोइंग इज मोस्ट अप्रोप्रिएट ट्रीटमेंट. सो दिस वाज द क्वेश्चन. माउंटेन सिकनेस वाला इसी तरीके का क्वेश्चन था. प्लीज लेट मी नो. यस, डायजेपम वाज देयर. हो गया यार. फॉर्मेपिजोल, बेंजोडाइजेपिन गिवन. इन अदर क्वेश्चन फॉर्मेपिजोल, बेंजोडाइजेपिन गिवन. डी आंसर पे बाद में आएंगे गाइस. फर्स्ट लेट मी नो, इज द क्वेश्चन राइट? क्वेश्चन सही है, ऑप्शन सही है, तो आंसर तो मैं बता ही दूंगा. Yes, okay. So question and options are right. So answer is acetazolamide. I told several times in mountain sickness. देखो लद्दाख में गए हैं, लद्दाख में बहुत ज्यादा हाइट पे है. There will be low partial pressure of oxygen at that height. So that can lead to mountain sickness. These are the symptoms: headache, nausea, vomiting, ये सब हो जाता है. Plus in severe cases there will be dyspnea also. And a drug of choice for treatment as well as prophylaxis is acetazolamide. And what is the best treatment? I think all of you know what is the best treatment for mountain sickness. Best treatment is, yes, it is to come down. भैया नीचे आ जाओ, वहां कर क्या रहे हो. ठीक है. तो जब भी किसी को माउंटेन सिकनेस होती है तो इमीडिएटली हम उसको एडवाइज करते हैं कि भैया नीचे उतर आओ. डिसेंट डाउन इज द बेस्ट ट्रीटमेंट फॉर माउंटेन सिकनेस. ठीक है. चलिए नेक्स्ट क्वेश्चन पे आते हैं. Which of the following drugs undergo Hoffman's elimination? ये क्वेश्चन था. And please add on the options. Decent is very good. Friendly doc is right. They asked prophylaxis about Ladakh trip. Okay, have they asked prophylaxis? If they have asked prophylaxis, I will correct the question, but the answer will remain same. Drug of choice for treatment as well as prophylaxis is acetazolamide. Acetazolamide is not in the option. Bushra Ali is saying not in the option, but many students are saying it was. Please let me know whether acetazolamide was there or not. Bushra Ali understood prophylaxis is asked, but acetazolamide is not in the option. Everyone was saying acetazolamide was in the options. Let me know this. Acetazolamide options में था या नहीं था? So Siddharth and Tushar has moved to next question, but I think first we'll complete this question. It was in the options. Okay. Acetazolamide होगा यार, उसके बिना काम चल ही नहीं सकता. So whether we want to prevent or we want to treat, acetazolamide is a drug of choice. So answer is acetazolamide to this question. So coming to this question, this answer you all know. 4 friends भी नहीं थे. Okay. तो किसी ने मेरे को पूरा ही गलत क्वेश्चन पर चेप दिया. कोई बात नहीं. You understand the crux? That means if it is mountain sickness, it is acetazolamide. Okay. चलिए, please give me more options in this question. Direct question था ये. Hoffman's elimination, was it the direct question? Here another option was a diazepam. Naseem, for which question you are saying diazepam? I think there is a little lag between the YouTube comments and my video. So I have to wait a little longer. Yes, direct question tha sir. Okay. So everyone saying direct question tha. So can you remember any more options? Answer we all know it is cis atracurium. Answer is cis atracurium. So can you tell me more options in this? Hoffman's degradation was the word. Elimination, degradation, answer is same. Panchronium is another option. Thank you. Degradation. Okay. सो सर एस्ट्राजोलामाइड के डायरेक्ट वन लाइनर था, लेकिन ये क्लिनिकल केस अलग था 4 फ्रेंड्स का. ओके, बुशरली टेल मी दी 4 फ्रेंड्स वट एवर दे वर आस्किंग, वी विल ऐड दैट. तो ये पेनकुरोनियम पहले हम ऐड कर देते हैं, पेनकुरोनियम. ठीक है, अच्छा विक्रोनियम भी था. Cisatracurium hence can be used in renal failure. Yes, you are absolutely right. So vicronium, pancuronium, mevacurium. So हो गया, मतलब this question is also complete. So okay. So answer to this is Cisatracurium. Cisatracurium. Okay. Now this was the question. Benzodiazepine antidote. Was this the direct question or a clinical history based question? So answer we all know. Flunitrazepam is the answer. Flunitrazepam. And one of the option was naloxone as I was listening. So was this the direct question? Which of the following is benzodiazepine antidote? Or was it a history-based question, something like that? मेरे को थोड़ा time लग रहा है guys, because you people did not do justice with me and did not give me questions. But it was direct question. Okay. So any other option, maybe their answer is flunitrazepam. तो इसके नाम में लिखा है benzodiazepine, के नाम में लिखा है पीना है और पीने से मजे आते हैं, and those मजे will become. flunitrazepam नहीं है भाई, flumazanil है. flumazanil is the answer. flumazanil. तो जो मजे हैं पीने के वो नील हो जाएंगे, पीने के मजे नील हो जाएंगे. That is benzodiazepine antidote. ठीक. So I think this is the easy question. This I think Dr. Praveen also discussed the same question. Flumazanil is the answer. Yes, Sachin, Siddharth, flumazanil is the answer. Sorry, I mistyped that question option. Sir, bidaquine mechanism of bidaquilin ka. Okay, let me add this question. Later on, I will forget otherwise. So bidaquilin mechanism of action. Bidaquilin. Okay, so we'll come to that question later on. अभी हम ये benzodiazepine कर लिया. Question था drug of choice for cervical cancer. Betaquilin mechanism of action I have added that we will discuss, Rajashri. पहले जो मेरे पास है, I think we can discuss that. Then we can add on more questions, है ना? Is okay? चलिए, all of the following adverse effect can be seen after 1 year of using lithium therapy except. I think Dr. Praveen has already discussed this. Tremors are the most common side effect of lithium therapy. Hypothyroidism can occur with lithium. Diabetes insipidus is another. And tardive dyskinesia is seen with antipsychotic drugs, not with lithium. I hope this everyone knows. है ना? Child with TB pleural effusion. Idiopathic, please let me know after I discuss 7-8 questions which I have, and then we will keep on adding. Okay, चलिए. Next question is cheese reaction. इसका question का बता दो मेरे को. What was the type of question? Cheese reaction पे क्या question आया था? Was it a history of given? कौन cheese reaction करता है, ये question था. और the question was what is the treatment of cheese reaction? Yes, Rohit, Sachin, you are right. It is tardive dyskinesia. Now please let me know about this question a little bit. Cheese reaction पे क्या question आया था? Was there some question on cheese reaction? कौन करता है? कौन करता है means the drug is asked or the food is asked. Wine consumption दिया था. TCA was in the option. Okay. Okay. Which drug the patient was taking that can lead to cheese reaction? This type of question was there. Okay. Tyramine is product responsible and treatment is. Okay. So a patient on some psychiatric medication developed sudden hypertensive episode after taking wine. which of the following drug the person must be? I hope this is the question. ठीक बना दिया क्वेश्चन मैंने. तो प्रवीण सर ने ये भी डिस्कस किया था रे, मुझे मेरे से मिस हो गया. So answer was Mao inhibitors, I think. Mao inhibitors was in the options. TCA, SSRI, something options will be like this. Wine consumption mentioned tha, then drug was asked. Okay, I hope I've made fairly good question. Otherwise, अगर Dr. Praveen में discuss कर लिया तो we will not waste too much time on this. So should we go to next question? Yes. Okay. So this was the question on iron poisoning. Wine drinking, high fever after antidepressant. Trazodone was in the options. Okay. Trazodone was in the options. Trazodone. Okay. Good. Thank you. Thank you, Bushra. So coming to this question. Was there a question like this? Iron overdose? Yes, the answer is desferrioxamine. If this was the question, this type of question was there in the exam. Guys, this type of question was there. Answer is correct, desferrioxamine. Yes. Abdullah, amitriptyline was in the last question. Okay. So I think this is desferrioxamine. Iron overload, everyone knows. This is the repeat question. Many times this had been asked. So we'll move to next question. Was there a question like this? Which of the following drugs can cause thymine-less death of cells? So Abdullah is saying yes, that means amitriptyline. So instead of TCA, there may be amitriptyline. Wine wale question, I got it. It was there. Okay, so can anyone tell more options in this question? जिसने जो क्वेश्चन मार्क किया है वो बता दो. थाइमिनलेस डेथ ऑफ सेल्स में सबने कुछ ना कुछ तो तुक्का लगाया होगा ना. So 5-fluorouracil is the answer. Please let me know the other options. Pharma, all questions note से. Thank you, Dr. G. But every question obviously do not come. एक आध क्वेश्चन तो बाहर से आता ही है. And we are not worried about that one question. Amitriptyline था सर. सिद्धार्थ got it. Amitriptyline instead of TCA होगा ना, तो इसकी जगह amitriptyline कर देते हैं. Okay. Amitriptyline. Okay. Now it's okay. Pyrimidine. Chemo drug of choice in cervical carcinoma. Okay. We will come to that question. पहले हम ये question कर लें complete. 5-fluorouracil वाला. Pyrimidine. Pyrimidine क्या था यार? Pyrimidine तो ऑप्शन में नहीं होगा ना, कोई एनालॉग पूछा होगा या समथिंग लाइक दैट. कहीं 6-mercaptopurine था क्या ऑप्शन में? 6-mercaptopurine. Group pyrimidine analog. Yes, answer is pyrimidine analog, 5-fluorouracil. But what are the options? चलो basically I will tell sir, but oral drug of choice था. किसके लिए oral drug of choice था यार? Rajashri, please, I will come to that question. Please complete. Let me complete these questions. 2-3 questions are left only. Okay. So 5-fluorouracil, basically देखो, this question is easy. You need to remember that DNA और RNA में क्या difference होता है? DNA contains adenine, guanine, cytosine, thymine, whereas RNA contains uracil instead of thymine. So when we give 5-fluorouracil, it is metabolized to form thymine, 5-fluorothymine, and that will replace all the thymine present in the DNA. तो जब thymine होगा नहीं DNA में, तो DNA will not form. That is called as thymine-less death of cells. Okay, thymine-less death of cells हो जाएगा. Methotrexate was option here. Okay, good. Methotrexate. Okay. ठीक है, चलिए नेक्स्ट क्वेश्चन पे आते हैं. आंसर इज 5 फ्लोरोयूरासिल टू दिस क्वेश्चन. I think Dr. Vivek discussed this question. An HIV positive female which is not taking any antiretroviral drugs delivered a baby. What should be the initial treatment for the newborn? Option DEFA Cirox was asked, multiple transfusion history and drug of choice for oral. Okay, you are asking in iron. So we are moving here and there. So the question was oral antidote. Question was oral antidote. Option was DEFA Cirox or Deferipiron, we can say. Deferipiron. Okay. So guys, you agree with this question? तो यहाँ पे नेविरापिन के साथ जिडोवुडिन भी था. ओके, even if it is जिडोवुडिन, now nevirapine is preferred. Zidovudin was used earlier, now nevirapine is preferred. And in this question, cyclophosphamide was in the option. Okay, cyclophosphamide. Okay, with the duration is asked. तो सब में duration लिखा था. It is for 6 weeks. Or 6 months. Okay, so the 2 will be 6 weeks, 2 will be 6 months. 6 weeks or got this question completely. So nevirapine 6 weeks, zidovudin 6 weeks, nevirapine 6 months, zidovudin 6 months. So it is nevirapine 6 weeks. Okay, nevirapine 6 weeks is the answer. 6 weeks, 6 months. Okay, got it. This question we have got. So yoga. Now in this question, if they ask oral antidote, then answer will be Deferipiron. If they ask acute condition, drug of choice, answer will be Desferrioxamine. So Desferrioxamine is IV. Sir, in option nevirapine plus zidovudin both were there एक साथ. ठीक है, even if they were there, हमें सिर्फ nevirapine देना है. Nevirapine plus zidovudin है तो भी answer will be, even if both are in the option, answer will be only nevirapine. ठीक है, अगर ये है तो भी आंसर विल बी nevirapine only nevirapine we will use. Was there any question on nevirapine depression treatment? Mayur Singh, combined थे 2 drugs. Yes, we have made it combined, but we will give only nevirapine. अगर only nevirapine is in the options, that will be preferred. सिर्फ nevirapine नहीं था सर. Okay, so if nevirapine only was not there, then nevirapine plus zidovudin. Okay, ये सही है. zidovudin with nevirapine 6 months ऐसे ऑप्शन थे सारे. Okay, so सारे ऑप्शंस में कॉम्बिनेशन था nevirapine plus nevirapine plus zidovudin 6 weeks. इसको 6 months कर देते हैं. And there were any other options like this? सिर्फ nevirapine नहीं था. If सिर्फ nevirapine नहीं था, are you guys sure सिर्फ nevirapine नहीं था? Then answer will be nevirapine plus zidovudin 6 weeks. But I don't think सिर्फ nevirapine नहीं था. अगर ऐसा था तो the question is quite wrong because we are using only nevirapine. Sir, there was also something about methanol poisoning and an option ethyl that we have already discussed. Priya, that was the first question we discussed. Sir, sorry, but बहुत lag है in videos and chat box, इसलिए chat is coming late. Yes, I understand. I think it is because of difference between Zoom and the YouTube. अगर only nevirapine में duration नहीं दिया था, हाँ सर, only nevirapine था तो आंसर will be only nevirapine. देखो कॉन्सेप्ट समझ लो. अब एग्जाम क्वेश्चन तो हो चुका है ना. एग्जाम is already done. So you understand the concept that if only nevirapine is in the option, that will be the answer. अगर nevirapine अकेला था तो वो आंसर आएगा. And if nevirapine only was not there, then give combination of nevirapine plus zidovudine for 6 weeks. Nevirapine 6 weeks will be the answer if it is in the options. ठीक है? Coming to next question. Depression की treatment पे कोई question था? नेविरापिन था ऑप्शन में, लेकिन वो विदाउट ऑप्शन ड्यूरेशन था. ओके, दैट विल बी एब्सोल्युटली राइट. अगर ऑप्शन में ड्यूरेशन नहीं दिया तो डजंट मैटर, ये कर लो. आंसर इज नेविरापिन. अगर ऑप्शन ड्यूरेशन दिया तो नेविरापिन विद 6 वीक्स इज द आंसर. ओके, नाउ कमिंग टू डिप्रेशन ट्रीटमेंट. व्हाट वाज द क्वेश्चन ऑन डिप्रेशन ट्रीटमेंट? नेविरापिन ओनली था सर. ठीक है आदित्य, understood. Everyone is saying nevirapine only tha, so that will be the answer. Then nevirapine will be the answer. Combination is not usually preferred. We use only nevirapine. अगर nevirapine ऑप्शन में ना हो तो जिडोविडिन देंगे. ठीक है, और कॉम्बिनेशन आजकल नहीं देते हैं, बहुत पहले देते थे. प्लीज लेट मी नो दिस क्वेश्चन. अमित, even if duration था, I have told you, अगर 6 वीक है तो that will be the right. Nevirapine 6 वीक is the right answer. So I think we should move forward. ठीक है ना, ऐसा ना ब्रेकअप हो जाता है तो उसके बाद उसको पकड़ के नहीं रखते. We should move forward. So I think we should move forward on this question also, है ना. तो डिप्रेशन की ट्रीटमेंट पे क्या क्वेश्चन था गाइस? Anyone remember? Duration था. Why saying no? It doesn't matter. I have already discussed them. So the question was all are symptoms of BPH. In option there was class name of drugs for BPH. Symptoms of BPH में class names. Okay, so I will add the questions, then we can remember later on. BPH में question था. Then someone was saying question was on CMV. CMV drug of choice पे question था. Six weeks था. Okay, ये सही है, ये सही है. Is it stuck? I don't know whether my video is stuck or not. I think I'm going right. डिप्रेशन ट्रीटमेंट वाले क्वेश्चन को किसी को ऑप्शन याद नहीं है, कुछ भी याद नहीं है? कैन वी मूव फॉरवर्ड? वी कैन स्किप दिस क्वेश्चन गाइस. सीएमवी रेटिनाइटिस ड्रग थी जेनसाइक्लोविर. ओके, ये तो फिर डायरेक्ट क्वेश्चन हो गया. ड्रग ऑफ चॉइस फॉर सीएमवी रेटिनाइटिस, है ना. ड्रग ऑफ चॉइस फॉर सीएमवी रेटिनाइटिस. इसमें ऑप्शंस होंगी ए साइक्लोविर, जेनसाइक्लोविर. ठीक है, सो ए साइक्लोविर, जेनसाइक्लोविर वगैरह ऑप्शंस होंगी. जेनसाइक्लोविर इज ड्रग ऑफ चॉइस. ओके, बीपीएच में क्वेश्चन क्या था? पेशेंट प्रेजेंट विद सिम्टम्स ऑफ बीपीएच. सिम्टम्स ऑफ बीपीएच. व्हाट वाज द क्वेश्चन आस्क्ड? ऑप्शन में फिनास्टेराइड होगा, प्राजोसिन होगा, टैमसुलोसिन होगा. What was the question asked? सर 10 बज गए, अभी तो सिर्फ इंग्लिश. आई एम टॉकिंग इन इंग्लिश ओनली गाइस. So question was which of the following drug is used for immediate relief of symptoms? Which of the following drug is preferred for immediate relief of symptoms? That was the question. 5-alpha reductase inhibition था. अच्छा, finasteride was not on the option. Option was 5-alpha reductase inhibitor. 5-alpha reductase inhibitor. Okay. Residual urine दिया था. Aldosterone was option. Aldosterone antagonist में भी थी option. Aldosterone antagonist. Okay. Symptoms BPH, residual urine is one of them. Residual urine. Okay, got it. Purine related. 5-alpha reductase. Purine related drug था. Purine related means tamsulosin not in the option. 100% remember in option 5-alpha reductase was in option. भाई दे तो दिया 5-alpha reductase. Medici I have given. Instead of tamsulosin there may be alpha-1 blocker. Alpha-1 blocker. Option may be like this, ना? ऐसा था क्वेश्चन. क्वेश्चन में था एल्डरली मेल हैज 130 MP रेजिडुअल यूरिन इन्वेस्टिगेशन। ओके, एल्डरली मेल कर दे, सिम्टम्स में एल्डरली मेल हो जाएगा, एल्डरली मेल विद urinary hesitancy and retention of urine comes to hospital. Ultrasound shows residual urine of 130 ml. कर दिया अब क्वेश्चन मैंने? Is it right now? One reaction process was explained in option to choose was competitive, non-competitive, and non. Alpha also not given, only 5 alpha reductase was the answer. Jogesh, if you have marked 5 alpha reductase, maybe that is the correct answer. But please let me know the other options if you are saying. Sir, lithium toxicity से भी question था, वो हो गया lithium वाला Amit. Amit, we have already covered lithium toxicity question. So can you please let me know what is this 5 alpha reductase inhibitor में options क्या थे और and what was the question? It was immediate preferred immediate relief of symptoms, or was there which drug is used to decrease size of prostate? ये बता दो प्लीज मुझे, साइज ऑफ प्रोस्टेट पे क्वेश्चन था या इमीडिएट रिलीफ ऑफ सिम्टम्स पे था? इफ द क्वेश्चन वाज ऑन इमीडिएट रिलीफ ऑफ सिम्टम्स, आंसर विल बी अल्फा 1 ब्लॉकर या अल्फा 1 एड्रेनर्जिक एंटागोनिस्ट. इफ द क्वेश्चन इज ऑन डिक्रीज इन साइज ऑफ प्रोस्टेट, देन 5 अल्फा रिडक्टेज इनहिबिटर विल बी द आंसर. लेट मी नो. प्लीज लेट मी नो. इमीडिएट रिलीफ था ना, तो 5 अल्फा मतलब अल्फा 1 ब्लॉकर मस्ट बी इन द ऑप्शंस ना. 5 अल्फा रिडक्टेज इनहिबिटर्स कैन नॉट बी यूज्ड फॉर इमीडिएट रिलीफ ऑफ सिम्टम्स. रिलीफ के लिए नहीं यूज कर सकते उनको, दे आर यूज्ड लॉन्ग टर्म. 5 alpha, CCB, aldosterone, AC inhibitors. Okay, these were the 4 options. Okay, 5 alpha reductase inhibitors, calcium channel blockers, aldosterone antagonist, AC inhibitors. These are the options. So which of the following drug is used in the treatment? This was the question. Used in the treatment of this patient. So I hope this is the sir relief ही था. अगर relief option, reduce size पूछने का aim था question का. Okay, so I think this is the fairly good question now. You guys agree? Now you guys agree regarding the question? सर अल्फा ब्लॉकर भी था, उससे पहले कुछ और लिखा था सर. ड्रग ऑफ चॉइस इन पीपीएच था, मिजोप्रोस्टन कार्बोप्रोस्ट वाज इन द ऑप्शंस. ओके, ड्रग ऑफ चॉइस फॉर पीपीएच वाज द अनदर क्वेश्चन. I will add here. Drug of choice for PPH. Yeah, misoprostol, कार्बोप्रोस्ट. ऑक्सीटोसिन था ऑप्शन में, नॉट प्राजोसिन. बीटा ब्लॉकर था, नॉट प्राजोसिन. ओके, अगर प्राजोसिन नहीं था तो वो काम ही खत्म हो गया ना यार. तो दैट मींस दे वर वांटिंग टू आस्क अबाउट 5 अल्फा रिडक्टेज इनहिबिटर्स, है ना. तो चलो कमिंग टू दिस क्वेश्चन. मिसोप्रोस्टॉल, कार्बोप्रोस्ट, ऑक्सीटोसिन. ऑक्सीटोसिन था ऑप्शन में इसमें. गाइस, वाज ऑक्सीटोसिन प्रेजेंट इन द ऑप्शन? Which drug used to PPH? Already used some drug. No oxytocin. नो ऑक्सीटोसिन, ऑक्सीटोसिन नहीं था। ओके, ऑक्सीटोसिन नहीं था, तो ऑक्सीटोसिन नहीं था तो इनमें मिसोप्रोस्टल बनता, बट गाइनी मैम विल मेक इट क्लियर. So you tell them the dinoprost was in the option. Okay, dinoprost with the duration था. So I think this question will be better covered by gynae people. Sir, question was कि अगर ergometrin से PPH stop नहीं हुआ, what's next step? Okay, okay. A female with PPH was treated with ergometrin, but it was not able to stop PPH. ठीक है ये क्वेश्चन. ऑक्सीटोसिन हटा दिया भाई मैंने. So I feel misoprostol should be the answer, but gynae people will correct this. ठीक है ना, इसको मेरे ख्याल से आगे चलते हैं. ड्रग ऑफ चॉइस फॉर CMV retinitis में anyone remember any more options? Please let me know. Direct question था क्या? Okay, the question was which prostaglandin drug was used in PPH. फिर तो ये मेरा क्वेश्चन हो गया है ना. ओके, एग्रोन कर चुके हैं. लाइन ऑफ द ट्रीट. Okay, okay, okay. Got it, got it. This question I have completed. I think I am taking too much time. मैं आप लोगों का टाइम भी वेस्ट कर रहा हूँ, बाकी फैकल्टी का टाइम भी वेस्ट कर रहा हूँ. So I think अब जल्दी जल्दी करते हैं बस, है ना. So answer to this is misoprostol. This is misoprostol. Okay. Now coming to drug of choice for CMV retinitis. जो आया वही फिर से आएगा. Yes, Tarun. Mostly this is the right thing. So please let me know about this. Drug of choice for CMV retinitis. Acyclovir, Jancyclovir, Priya, I have already added these two options. If anyone remember any more, please let me know. Answer is Jancyclovir only. ठीक है, बाकी कोई भी ऑप्शन हो फर्क नहीं पड़ता. आंसर इज Jancyclovir. I think we can move forward, है ना. Jancyclovir is the answer. Same question with image. There were two questions, stylish star, or this is the only question. In depression, lack of sleep was option for psychiatry. Sai Praveen, very good. You have remembered it very quickly, है ना. Psychiatry has been done just 45 minutes before, है ना. So let's wind up pathology discussion pending. Sorry, Dr. Sparsh, I will finish quickly. Okay. So image was also there for CMV retinitis. Image was there. Okay. Tenofovir was another option. Tenofovir. Valacyclovir is another option. Valacyclovir. Okay. So now moving to next question. And this we have discussed. Bedaquiline mechanism of action was asked. Mechanism of action was the direct question. Mycobacterial ATP synthesis inhibition was option. Mycolic acid synthesis must have been other. Cotrimoxazole was also in the options. ठीक, I will add that. Ruchi, I will add that cotrimoxazole. So ATP synthesis, mycolic acid inhibition, these were the options. Okay, so that was the direct question. They are saying bedaquiline ATP sensitive inhibition is the answer. Mycolic acid, obviously, that must be in the options. Okay. Chaliye, next question. Depression treatment, no one is able to remember. Nevirapine I have discussed. Bedaquiline, this we have discussed. PPH discussed. So I think most of the questions I have discussed. If anyone remembers more, please let me write my number here. Please forward me on this number. Please WhatsApp me on this number if you remember any more questions. Acyclovir purpose present. ठीक है प्रिया, it's okay. Acyclovir is not the answer. है या नहीं है फर्क नहीं पड़ता. That is not the answer. Answer is Gencyclovir. Okay. So if any more questions you remember, please answer मत करो यार. चलने दो एक बार. So quickly I am revising the questions. Recall देख के लग रहा पास हो जाऊंगा. So quickly I am revising you the questions and answers. अपने अपने जल्दी ठीक कर लो कितने questions हो गए. ठीक है. Methanol poisoning में आंसर इथाइल अल्कोहल. मिथेनॉल में इथाइल अल्कोहल है. जो लद्दाख वाला था माउंटेन सिकनेस इज एस्ट्राजोलामाइड. 2 क्वेश्चंस ठीक करा दिए मैंने. हॉफमैन से सेट्राक्यूरियम सबका ठीक होगा. 3 क्वेश्चंस आर एब्सोल्युटली राइट. ठीक है. बेंजोडाइजेपिन का एंटीडोट फ्लूमाजेनिल, ये सबको पता है. दिस इज आल्सो अगेन राइट. 4 क्वेश्चंस आर एब्सोल्युटली राइट. लिथियम का क्या साइड इफेक्ट नहीं है. टार्डिव डिस्काइनेसिया, दिस ऑल मस्ट हैव करेक्टेड. 5 दिस ऑल मस्ट बी चीज रिएक्शन विद माओ इनहिबिटर्स. 6 देन आयरन ओवरडोज, ओरल और इंजेक्टेबल एंटीडोट, ये भी सही होना चाहिए आपका. थाइमिनलेस डेथ ऑफ सेल्स इज 5 फ्लोरोयूरासिल. एचआईवी पॉजिटिव वाले में नेविरापिन देना है. डिप्रेशन का किसी को पता ही नहीं. बिडाकोलिन इज एटीपी सेंसिटिव इनहिबिटर. देन 5 अल्फा रिडक्टेज इनहिबिटर फॉर बीपीएच. सीएमवी रेटिनाइटिस जेनसाइक्लोविर. and which prostaglandin is used in PPH? It is misoprostol. Okay, I got only this much question. So you send me more questions, I will add them, and in our final discussion, these will be added. Okay, so I think this is all regarding pharmacology. And extremely sorry, Dr. Sparsh, Dr. Apoov, I have taken a lot of time, much more than I was allotted. And please now.
So I'll request Goga bhai, thank you very much for fantastic session. And we have now. Do we have Sparsh sir now?
Yes, sir.
Okay, over to Sparsh sir for his session. All the very best.
Thank you so much, sir, for the kind words. I will not take too much of your time here. I hope I am audible and visible properly. Could just get some hang of the questions. Let me just have a look at those questions and kindly just correct me. So one question was regarding celiac sprue that we had, and what I could get from a lot of people was that the options were a bit confusing. I hope I have written the right options. The question was all of the following, which of the following can be given safely, or all of the following can be given except type, something of that sort, right? So the basic funda of this question was that wheat, obviously, as we understand, cannot be given. And then there are variants or the substances which are being derived from wheat. So wheat से हम क्या क्या निकालते हैं यार? Wheat से निकालते हैं मैदा, उसी से हम निकालते हैं सूजी. तो even they cannot be given, even though they contain relatively less amount of gluten in comparison to the whole wheat, right? So with the given options that I am presenting in front of you, the safest for a patient having celiac sprue happens to be something like rice. Was that the question? The another question which was given in the exam, maida was not there. Semolina is suji, yeah. Semolina is suji. It's almost like हम भिंडी बोलेंगे ना यार, तो उसको ओकरा बोल दिया एग्जाम में. थोड़ा सा वैसा वाला स्मार्ट काम कर दिया. ठीक है. Then there was a question on which of the layer is absent. I know this is an applied anatomy question, but I could just recall whatever was there. Okay. Esophagus में absent layer. I don't know whether it was a histology based question or whether it was something which was no. Even dalia for that matter यार is going to be derived. So wheat dalia भी होता है actually. If that was an option, तो कौन सी option नहीं थे फिर? If you can just let me know. Rice was an option. तो safely तो rice ही होगा ना यार. देखो दलिया जो है वो भी that is also going to be derived from part of the wheat. What to give in celiac sprue ना, तो rice ही दोगे आप इसमें. हाँ जी. तो मैदा, दलिया, सूजी ये आप नहीं दे सकते because of the simple fact they are all wheat derivatives. Then we had a question. I don't know if there was a description or there was a lady who was having the habit of eating her hair. So and then this was again a question which had trichobezoar. Okay, so this was a histo question. Why I'm just making a mention of all these points is because this can help us make a better recall video for you as and when we are able to launch a complete one on the app for you. Okay, so this was a histo. Oats. यार अब oats भी था option में. Option ही 4 होती हैं यार. I am not able to understand कि अच्छा oats था semolina. Oats semolina था. Okay. Except था ना? Except. All layers are present except था. Okay. So the answer is obviously clear to us, na? The answer happens to be cirrhosis. That is what we discussed in the first part. Okay. Then there's a question describing the clinical symptoms of a patient which were relieved. The patient was said to be having a bone tumor and the patient was having a relief on administration of salicylates or aspirin. Okay, image was there. I'm just highlighting what was the exact question. Okay, semolina was there, oats was there. Okay, aspirin and bone tumor, the relief was there. So obviously we understand that salicylates giving improvement or the symptoms like pain in a patient, especially night pain, is going to be taken care of in a tumor like osteochondroma. In case Apoor sir has not discussed this, then this is what I got as a brief. Otherwise, you can just let me know in the chat box quickly. Then we got which of the following conditions is going to be diagnosed with the help of Duke's criteria. And I presume it was Duke's criteria only because that's the criteria that we are using for making a diagnosis of infective endocarditis. Duke's staging is something that we are using for colon cancer. We have talked about that earlier as well. There was another question on infective endocarditis. I think it was a micro question likely to be taken up, wherein the organism was asked in a patient having a prosthetic valve endocarditis. One question on iron deficiency anemia. I just request the faculty to just give me 5 more minutes of time. Actually had a session earlier and therefore just wish to wind this up. Iron deficiency anemia. There was a question on antidote of iron poisoning. Then there was somebody who told me, sir, iron deficiency anemia ka diagnosis question tha. Okay, Duke's criteria was there. I don't know. There is some lag in the chat. So if you can just let me know. Was there a clinical history which was given in the question? Iron deficiency, or was it the serum profiles? I mean, just like the one we talk about so frequently, serum ferritin, transferrin, saturation, and then no, it was not. Okay, so what was it like? Iron deficiency anemia? Just give me some kind of a brief so that at least the recalls could be made in a very proper way. I presume some lag in the chat. Otherwise, we can just move. So Marjolin's ulcer was there. Okay, this was there. Marjolin's ulcer. Was it a description of a question where the patient was having a presence of a long-standing venous ulcer, or the patient was having some kind of a burn injury and subsequently the patient was having a development of. Okay, so serum profile was there. So that was a classical one, no? Total iron binding capacity happens to be increased, and then serum ferritin is going to be reduced, and transferrin saturation is going to be reduced. HBV 70, okay. Okay, MCV less 70. Patient having anemia, okay. Okay, this happens to be a different question, I presume. But if the question did make a mention of increased hepcidin, were there two different questions? Because if the question then makes a mention of increased hepcidin and microcytic anemia, then I would obviously go in favor of something like anemia of chronic disease. Okay, I'll just make a mention. 60-year plus patient, microcytic anemia. Parameters of microcytic anemia and what's the cause? Okay, so there was a history of burns. And was this an image-based question or was it a theory-based question? Because when it's a theory-based question, we do make it a mention of in our discussion where we talk about something like the basal cell carcinoma and it is called as a rodent ulcer and the tear ulcer stuff. Image was given. Okay, so then that becomes a surgery question. I mean, if it is an image-based question. Then some question on non-caseating granuloma was there. So was it an all except question? Because non-caseating granulomas can be seen because of foreign bodies, can be, as will be seen in a patient having inflammatory bowel disease like Crohn's. In a respiratory disease, I would say one of the examples can be something like sarcoidosis. Okay, one more question that I'm getting over here. Thank you so much. PT, BT, APTT normal. Okay, all these happen to be normal. And then the patient is having bruise and bleeding. Okay. Bruises and bleeding are present. Anything apart from this which has given? Sarcoidosis was an option. Okay, TB and vaginous was there. Sarcoidosis was an option. TB, vaginous. They said find the diagnosis. No exception. So was the question pertaining to a non-caseating granuloma is going to be seen in which of the following conditions? Was that the question? No exceptions? High platelet. I hope we are talking about the same question. High platelets present. Is it a separate question? Vitamin K deficiency? Okay. Von Willebrand disease. यार नाराज मत हो मेरे से यार, ये क्या बोल रहे हो? सार्कोइडोसिस और टीबी लिखा, आपने तो लिखा यार, किसी ने लिखा, वो स्टाइलिश स्टार ने लिखा कि टीबी और वेजिनस था ऑप्शन के अंदर। अगर ये इंक्रीज हेप्सिडिन वाला था तो भाई फिर तो समझ आ ही गया ना आपको, ये वाला तो फिर तो क्लियर हो गया आपको कि ये एओसीडी है। ठीक है, सेम क्वेश्चन के अंदर प्लेटलेट थे 5 लाख। ओके, नो ब्लीडिंग इन जॉइंट, ब्रूजिंग, पीटी एपीटीटी नॉर्मल था। अच्छा अच्छा, तो बीटी किसने ऐड करा दिया मेरे भाई, ऐसे मत करो ना। अच्छा, ये सब नॉर्मल था उसका, प्लेटलेट उसका हाई था। टीबी वाला दूसरा क्वेश्चन था। बीडब्ल्यूडी, हीमोफीलिया ए रॉयल डिजीज, हीमोफीलिया बी क्रिसमस डिजीज और विटामिन के डेफिशिएंसी। ठीक है, नो नी स्वेलिंग। ठीक है भाई, ठीक है। एक क्वेश्चन ये था, एकलेजिया कार्डिया वाला क्वेश्चन बता दो बस मुझे। देन देयर इज अ क्वेश्चन ऑन पेडिग्री एनालिसिस। एकलेजिया वाला क्वेश्चन था वो क्लासिकल क्लिनिकल हिस्ट्री थी। I hope I have written the right questions. Paper 2 वाले question people were able to recall a bit more comfortably. Okay, vitamin K deficiency question था when the patient female was pregnant 5 years back after delivery, she had massive bleeding. Same thing happened when she had a small surgery. Hemophilia C भी था, hemophilia A B C था और okay, so this is a new question coming up. Halitosis, अच्छा उसी question, एक मिनट यार। Halitosis, regurgitation, dysphagia, regurgitation at night। ठीक है जी। एक था प्राइमरी फ्यूजन लिम्फोमा, दिस इज अ गुड रिकॉल। EBV, HBV, HHV8, ओके ठीक है जी। Then there was a question on pedigree analysis. I mean the classical one, autosomal dominant, autosomal recessive, XLD, XLR. Eclasia के साथ options जो थे, Pulsion diverticulum, okay. Lung capitis is also present. Esophageal cancer, okay. There's a question which was a repeat from, I believe, the PG exam question, which was a patient who had a history of administration of penicillin and then he had a development of hemolytic anemia. So it was not a classical penicillin-induced type 1 hypersensitivity reaction. It was a penicillin-induced hemolytic anemia. So when there is a drug-induced hemolytic anemia, that is associated with formation of antibodies against the drug or the modified antigen. And therefore, this is going to be an example of a type 2 hypersensitivity reaction. I hope you got it right. Lower lobe consolidation, okay. ठीक है जी। Patient had a suprarenal mass and this patient also had a presentation with episodic headache, palpitations, and sweating. And options were with respect to something like either he is suffering from some kind of a stress, or he is having temporal arthritis, that is GCA, or he is having the presence of migraine, or he's having pheochromocytoma. So the combination of episodic headache in association with something like palpitation, sweating was a cue in the question. Pheochromocytoma with nuclear image. Nuclear imaging. What was so special about that nuclear imaging thing here? Direct image of lung cilia. Okay. But I believe there was a question which was asked in the exam, which was talking about the presence of infertility, and then there was a presence of bronchiectasis as well. Was that the same question which was having the image of lung cilia, or was it a different question? Infertility and the presence of bronchiectasis, and the patient was having situs inversus or something. Carter-Jenner syndrome or image दिया था. Okay, got it. हाँ जी, हाँ जी. Carter-Jenner syndrome symptoms. Image, microtubules. अच्छा, वो डाइनी नाम वाला concept, right? They asked investigational choice for pheochromocytoma. Can you just confirm? Somebody told me that there is a question which you had the question was related to making the diagnosis. अच्छा, nuclear imaging तो separate question हो गया यार, इसमें नहीं है ना. So that would be, I think, Zainab ma'am's question. So I'll just put a star on this notepad. Okay. Okay, and then was there a question in the exam which was talking about an elderly male having a presentation in the form of a backache and difficulty in breathing? The patient was having elevated serum calcium levels, and on radiological investigations, he had presence of multiple lytic lesions on the X-ray. In his bone marrow aspiration, there was presence of increased number of plasma cells. Some people said there was an image given for this, and some people said yes, no image was given. But then elderly individual backache, hypercalcemia, lytic lesions would go all in favor of multiple myeloma. Was that the question? Yeah. So there have been almost like 16 of them as of now, but not a bad number considering the fact that all of you have actually given your best, and then, okay, there was no image. That's an important thing, because somebody actually gave me a screenshot from one of our notes and said, sir, yehi image tha. So even we were too happy. No image, only history. Okay, I mentioned it, no image. Okay, loss of E-cadherin question. No, that is a good one. Loss of E-cadherin would be a feature that you would be associating with development of something like a lobular breast cancer. I hope that was a question. Breast cancer, if they have asked the subtype. So this would be a classical feature of something like a lobular breast cancer. Were there other options like ductular or the mucinous and the medullary, something of that sort? Okay, another question. Child with more than 20 HP hematuria. Child with hematuria. Okay, and the likely diagnosis. So options are PSGN and the option is MCD. But then a child having a hematuria going in favor of something like glomerulonephritis. Okay, in the previous question, it was lobular. HER2. Indian file pattern was also there. फिर तो यार directly हो गया ना question. Indian file pattern also, image is also given. This is a good one. HER2 image. Anaplastic. Amyloidosis था. Okay. ये तो फिर मतलब आसान वाले questions, there is sometimes a bias. I think amyloidosis, hemodialysis. So this was easy, no? And then was standard options A, beta 2, puffy and urine cast. अच्छा, ये question भी था, direct etiology पे था. What causes PSGN and rheumatic heart disease? मतलब micro वाला question. अच्छा. Puffy, childish puffy. So the summary is that what we are getting in the exams is exactly of what we are having a discussion. No, and it was more of a clinical picture based question rather than a one-liner. So puffy child, and then he's having a presence of periorbital edema and having the presence of increased number of RBC cast, hematuria, and then what is the likely diagnosis? Something of that sort, right? Emphysematous pyelonephritis नहीं यार, वो रेडियोलॉजी और सर्जरी वाले सर के लिए कर देते हैं हम फिलहाल के लिए. Okay. So I think good number of questions, guys. If you just have a look at it, so you have one question from multiple myeloma, you have another question for pheochromocytoma, type 2 hypersensitivity reaction question, a pedigree analysis question, eclasia cardia question, 5 of them over here. 6 questions from something like sarcoidosis, another one from Marjolin's ulcer, 8 questions from iron deficiency anemia from making a diagnosis. 9th is for Duke's criteria, 10th is for osteoid osteoma, 11th is for layer absent in esophagus, 12th happens to be from celiac sprue, 13th happens to be from PSGN, RSD. Okay, that would be micro question, but then PSGN. 14th one is going to be lobular cancer. 15th one is Cartagena syndrome. 16th one is going to be primary fusion lymphoma. 17th is, okay, that was a history one, amyloidosis based question. And then I'm getting a question from a lot of people, TNF alpha wala. Irreversible injury ka feature. Okay. Nuclear shrinkage. I am just highlighting the ones which are more relevant with respect to what you are recalling as of now. Can you just let me know interleukin 1, interleukin 6, TNF alpha? That would actually increase the number into around 20. What was this question about? Was the question about asking the cytokines or the chemicals contributing to the development of systemic effects of inflammation? Or was it something else? अच्छा ध्यान से minor criteria for infective endocarditis. Okay. जिसमें आपके वो वैस्कुलर फिनोमेना, इम्यूनोलॉजिकल फिनोमेना, वो वाला कंपोनेंट कह रहे हो आप माइनर क्राइटेरिया में. ओके, इसमें माइलिन फिगर्स, दिस इज गुड. मेम्ब्रेन ब्लेब्स, पार्डन माय बैड हैंडराइटिंग एट दिस टाइम यार. हाँ जी, मेडिसिन में I'm listening here. How many minor criteria for infective endocarditis? 0 to 3 options were given. Okay. Which one of them is present? Which amongst us is present in liver? Okay, and then there was another option called as TGF beta. So it is understandable, and answer would be TGF beta because this one is going to be associated with fibrosis, and fibrosis is likely to take place only after the process of inflammation is going to be reduced. They gave symptoms of infective endocarditis and they asked to calculate the minor criteria. Okay, so it was a clinical question. Okay. Clinical question and count the minor criteria from 0 to 3. Okay. Got it. ठीक है, ठीक है, ठीक है फहीम सर. डॉक्टर ट्रैवलिंग, डॉक्टर मेडिसी, डॉक्टर दिशा, डॉक्टर रोहित, थैंक यू सो मच फॉर दैट. रूमेटिक का था मोस्ट कॉमन कार्डाइटिस. ओके, मोस्ट कॉमन क्लिनिकल मैनिफेस्टेशन ऑफ रूमेटिक हार्ट डिजीज वैसे था. आई गॉट इट. सबक्यूटेनियस नोड्यूल्स, एरिथेमा मार्जिनेटम. ओके, कोरिया. ठीक है, ठीक है जी. No, personally, I can be greedy, but then I'm more than happy with these 20 plus recalls here, and I'll try to frame all those questions with you, just in case you happen to have some more information about this. You might as well share it on Govind sir's number as well, or might as well share it in our Telegram group as well. The group is open for everybody, the Cerebellum Academy channel. And then, of course, we are likely to be, what was the answer? Yellow incineration with burial. I think we've gone into now the forensic questions. So thank you so much for the time being taken from the other faculties. Apur sir, we will just shift to the next faculty.
So I think Dr. Pooja,
Yes, sir.
you are ready?
Yes, sir. I'm ready, sir,
morning.
to ask.
Good morning.
Good morning, sir.
Over to you. All the very
Yes,
best.
sir. Thank you, sir. Hi, guys. I hope I'm audible and visible properly. So today we are going to discuss the physiology questions. I got only 7 to 8 questions. Please help me to recall also. So this was the first question. Serosa layer is absent in. So we all know the answer of this. Yes, this was the question. So there is some lag. Please tell me in the chat. Just a minute. So first question was, yes, bladder plasticity will come on that, Rohit. What is GB? Okay, so first question was this, guys. Serosa layer is absent and we all know serosa layer is absent in esophagus. We discussed that in the GIT per se. Yes, thank you, Priya. So in all other places, we do have serosa, but we don't have serosa as well as we don't have the pacemakers also in the esophagus as well as in the proximal part of the stomach. But on the stomach, we do have serosa layer, right? Yes, absent in or all except, right? Wolf Parkinson PR. Okay, I'll add that, Priya, thank you. The second question was this one. Please tell me, Priya. Medicine. Wolf Parkinson White syndrome में क्या था? PR interval is increased, like that, something like that. My voice is not clear. Let me check. अभी ठीक है, Priya? I am able to hear it properly there. Plasticity wala
Yeah,
graph?
your voice is absolutely fine. Keep going. Your voice is absolutely okay.
So
Keep
thyroid
going.
hormone acts via which type of receptor? So we know the mnemonic that I gave you in the class was NucTAD, right? NucTAD was, what was the NucTAD? The NucTAD T for thyroid hormone, and the A and D was the vitamin A and vitamin D, right? And nuc was the nuclear receptor. So it is going to act via nuclear receptor. Changes in WPW. Okay. Urinary bladder, we are coming on to it. Fine. So third question, guys. Prolonged PR. Okay. High altitude case was given. It was given, and they have asked what is not seen or which one of the following is seen except. Right? Yes, Abhi, you're absolutely right. So I guess there is some lag. So is this the question type? What I got from the recall was this one, that high altitude case was given, and they asked ki kya nahi dikhega? What will not be seen? So yes, what do you mean by myoglobin? There is a type of globin which is present, which is going to bind to the oxygen, same as you have in the blood, that is hemoglobin. In the muscle, you have myoglobin. So all this will increase polycythemia. That means increase in the RBC number will be seen, so as to provide more and more oxygen to the tissue. But hypoventilation will not be there. Barometric pressure will be decreased, and that's why we'll be not seeing the hypoventilation. So hypoventilation is going to be the answer. Yes, similar. Okay, Disha, thank you. Rohit, medicine, what angiogenesis was in the option? Medicine, angiogenesis will be also seen. Okay, let's move on to the next question. If you have something which is You can remember acetazolamide wala question was done in the pharma. I'm talking about physio now. Okay. Long T QRS prolong. Okay, we'll discuss that. Two medical students are planning for a trip, studying regarding the effects of, all right, high altitude, fine. Heterotrimeric G protein. Okay, heterotrimeric G protein is? Heterotrimeric G protein. उसपे क्या question था, Rajashri? Okay, which one of the following has GLUT2? Please tell me the answers and help me to recall the options also. All right, so we all know that SGLT1 will be seen in the intestine and SGLT2 will be seen in the kidney. What mnemonic we said that we do have two kidneys and we only have one intestine, right? So that's why SGLT1 will be, this is a repeat question. SGLT1 will be seen in the small intestine, but they have asked SGLT2. Okay, I'll add on to that. Angiogenesis, fine to hear. Okay. It was more descriptive. Okay, what was the question? Dr. Doe, you can help me out with that if you can recall. But the concept was this, right? Okay. Direct nahi tha, I agree, Disha. Direct question was not there, but the recall was very difficult because the preclinicals, paraclinical, the subject, they were happening in the morning session, and that's why there was a bit difficulty to get the recall question, which happened to be, done in the first session itself. So this was the graph given, guys. This was the graph given, and they have asked. Yes, concepts are same, right? E. coli. All right, all right. Intestinal epithelium absorption, what was it? Okay, in adjacent graph, phase 1B, they have asked. This was the question there. Is this how they asked the question? 1B, which is the plateau phase, and we know this is the cystometrogram, right? And the Laplace law will be applicable over here. We can call it as adaptability, or we can call it as plasticity. In the smooth muscle, we do have plasticity, and that's why the storage of urine is possible as soon as the tension is increased. The Laplace law says that 2T by R, that means the radius is increased, but the tension is increased, so that the pressure will remain the same. So pressure won't change over here, right? Pressure will be constant. So this is plasticity. Same graph phase, yes. So they have asked 1B, so it is going to be the plasticity. Can you remember any contractility was the option? Okay, C was the contractility. I'll add that. Fine. Okay, Aaron, you can just tell me what was the language of the question. The concept was same. I told you कि थोड़ा सा problem हो गया because first session में जो questions हुए थे आपके वो recall अच्छे से नहीं हो पाए, right? They said increase, not decrease. In which question they said increase and not decrease? G protein related question. Okay, what was it? G protein related question. All right, this kind of diagram was given, whereas in the Leydig cell and Sertoli cells was shown, and they asked to identify the hormones. Was this question there? The same graph? All right. So the answer will be inhibin and testosterone. Guys, help me to recall here. It was increasing to 80. Okay. DNA and test. Fine, the Leydig and B was there. Okay, yes, the same picture. Thank you, Disha. So the answer is going to be inhibin and testosterone. The A is inhibin, which is released by the Sertoli, and we all already know that Leydig is going to secrete the testosterone, right? So we remember that in the mnemonic, dig se हमने G को replace किया था CK से, right? And that's how I told you to remember that Leydig cells, they are going to secrete the testosterone, right? Okay, different combination, right? So this is the diagram they have given you. Okay, this is given in the Guyton itself. So Guyton se direct diagram आया हुआ है. Fine. Okay, let's move on to the next question. IV irritant was given and something like that. So they have asked you to identify the reflex. So we know that irritating reflex, something bizarre reflex. So that's why we call it as basal-gyrus, right? And I told you is coming. That means everything will decrease. When we want to shut down everything, we ask like that, right? So they have different combination of hormone. Okay. Any Disha, can you remember any option in that? Leydig cell है तो पक्का testosterone वाला आंसर ही होगा. I'm sure about it. Hello Aditi, do you remember any question, बच्चे? All right, so any IV irritant was given, bradycardia, hypotension and apnea. That means I told you whenever the IV irritants are given, that is going to be bizarre, that is basal-gyrus. Okay, no issues. So this is the basal-gyrus reflex. Whenever we give alkaloids, veratridine, capsaicin, serotonin, or any IV irritant for that matter, we know there are ventricular chemoreceptors which are going to get stimulated, and that will decrease the heart rate, BP, and apnea. Fine. There was a case on the cardiac tamponade. I got this question. Cardiac tamponade. Stress. What was the question on stress receptor, bache? Bushra? In the carotid sinus. Carotid sinus. Okay. Carotid sinus and aortic sinus, they do have baroreceptors. I told you B never goes with B. That means in the carotid body and aortic arch, we do have chemo. On the other hand, carotid sinus and aortic arch, we do have baroreceptors, which are stress receptor. Was this the question? Yes, they are stress receptors. They are mechanoreceptors and stress receptor. Yes, I just got this option of why descent was blunted. Yes, medicine, thank you. The cardiac tamponade was there. Do you remember any other options, bache? Why absent? Okay, why blunted or absent? Okay, most of you are saying that they were absent was written. Okay, muffled heart sound. Okay, in the same question, bache, muffled heart sound. Absent by descent. All right. There was any question on action potential? Action potential of kidney ka graph? Except that cystometrogram. Congested vein, which of the following is seen? Okay, fine. So case was given of the cardiac tamponade. Okay, I'll add that. Fine. Increased JDP. Okay. Fine. The last question I got is Wolff-Parkinson-White syndrome. Wolff-Parkinson-White syndrome, we do have bundle of Kent. And via the bundle of Kent, there is a re-entry phenomena which is going to take place in the ECG, right? And because of that, what happens is P wave, but the PR interval is shortened, right? And the Q start very early or R start very early, right? And that's why there is a delta wave which is seen. So PR interval is shortened, right? shortened, and QRS is wide enough. What was the question which is asked in the Wolff-Parkinson-White? Heterotrimeric was there, right? Physiological changes in pregnancy. Okay, fine. 1B, we have done that, Bushra. Chalo, okay. If you have Valsalva maneuver. Okay. Widening of QRS was the option. Okay, fine. So delta wave, widening of QRS and shortening of this PR interval will be seen. Fine. So if you have any other questions, please do share them on the Telegram group or in the, you can do the personal message also on the WhatsApp. There is a group on the WhatsApp also. So I have got till now these questions, and I'm sure that you guys will help me to recall some more, right? So that is all from my side. Okay. All the best for the results, guys.
Thank you, Dr. Pooja.
Thank you, sir.
So next in sequence will be micro, anat, and gynae in this order. So over to you, Dr. Priyanka, ma'am.
Hello,
Dr.
hello
Pooja
everyone.
can stop sharing the screen.
Yes, I'm sharing my screen, sir. Just a minute.
We'll just, yeah. Over to you, Priyanka. How are you doing? All good?
Good, sir. Good, sir. Yes, sir. Good.
All the best. God bless you. All the very best. And next in sequence will be anatomy, gynae, and derma in this order. Thank you very much.
Thank you so much, sir, for the introduction. Thank you. So I hope the exam went well. Let's discuss microbiology questions quickly. The microbiology questions were a little bit descriptive, right? So the complete description is not yet recalled, but we will help to reach on the answers. Okay. So the first question, it was easy question. The question was on Giardia lamblia. I guess you get 4 parasites in the options, right? And you get the clues in the question. 4 clues were given to you. All 4 were very important clues that all were pointing towards the Giardia lamblia. Like the biggest clue given to you is the falling leaf mortality, right? 4 pairs of the flagella were there. You can see the 4 pairs of the flagella. Tennis racket shape was also given, and feco-oral transmission. They all transmit, they all give clue towards the Giardia lamblia. I guess this question was the easiest question in microbiology, right? Everyone have done it correctly. And what were the other options? You have to tell me that. But I guess the correct option, everyone have marked Giardia lamblia based on this, right? I guess this is the question and these were the options. Am I right? Is it the case? Is it the case? It was not an image-based question, right? It was a theoretical question. Yes, the correct answer in this question was Giardia lamblia. Okay. They have mentioned leaf-like structure. Yes, so it is the Giardia lamblia typically have falling leaf mortality, and the shape you can say the leaf-like also. The shape you can say teardrop also. Okay. So the next question, prosthetic wall implantation. Here you have to help me. Whether they mention 6 months or they mention after 12 months. I'm asking you, is it after 6 months? Because the answer will differ. Is it after 6 months or after 12 months? We are talking about the endocarditis. So what was given in the question? You have to write down in the comments. Exactly 6 months or 12 months. So we divide endocarditis into 2 categories, early and late. So there are 3 types of endocarditis: native wall, prosthetic wall, and IV drug user. I guess in your question, prosthetic wall they have asked. Okay, in the prosthetic wall, there are 2 types of prosthetic wall. Less than 1 year, within 1 year, after surgery, if it is happening, it's early prosthetic wall endocarditis. If after 1 year, the surgery it is occurring, it's late. So if they are asking you at 6 months, they are asking you the causes of the early prosthetic wall endocarditis. And after 12 months, it will be late. That's why I'm asking you very clearly. They don't have mentioned any time. They must mention the time now. So what were the options? So if they don't mention the time, go with the option. So within 1 year, the answer is Staphylococcus epidermidis. That is one of the cones. Coagulative negative Staphylococcus. And if it is after 1 year, the best option to go is the Streptococcus viridans. So what was given in the options? Okay. One option was pseudo. We will not go with pseudo. I know that. Okay. So yes, what were the other options? You have to come. So if it is after 6 months now, if it is after 6 months, go with the option with staph epidermidis. And if it is after 12 years, go with the Streptococcus viridans. So you have to look for the time. Time is also always mentioned. Whenever they ask for prosthetic wall endocarditis, the time must be mentioned. So what was the time? How much months were mentioned? Can you tell me? Streptococcus was not in the option. So the best to go with the staph epidermidis. If staph epidermidis was there in the option, if the time is not mentioned and they are giving only one option, go with the staph. Staph epidermidis will be the correct option in that case. Okay, so coming on the next question. The next question, it was on a fungus. They have mentioned you the micro and the macroconidia, the structure for that, right? They mentioned you pencil-shaped macroconidia and teardrop-shaped microconidia. And the options were trichophyton, microsporidium, and epidermophyton. Was there a question on this? There was a question on this. So you should understand. So correct answer here is the trichophyton, because the macros, let me show you the macro and microconidia of trichophyton. So this is trichophyton. See the macroconidia. Can you see these are pencil shaped? Either you say pencil shaped or you say cigar shaped, one and the same thing. And see the microconidia. So these are either circular or little bit towards the teardrop like. So you can say it's little bit pyriform or teardrop. So macro, micro, both the conidia are there. Both the conidia are matching with the trichophyton. So in such case, trichophyton will be the correct answer. What were the other options? Can you help me with other options? And is there any other clue given to you? It was a clinical scenario based question. So what was the clinical scenario given to you? The biggest clue given was the pencil shaped macroconidia and teardrop shaped microconidia. The clinch in the question was this only. But you were given a clinical question based on that. So what was that clinical question? They have mentioned pencil shape now. So based on the pencil shape, the answer will be trichophyton. What were the other option? What was the clinical history given to you? I'm asking that. Yes. So correct, based on that, the correct answer here is the trichophyton only. Trichophyton only. Got it? Not my, you may be having one of the option as microsporum and one of the option as epidermophyton. But microsporum will not be the answer, because here the macroconidia is spiny. It's spiny, you know, with pointed margins. It was not mentioned, and macroconidia are not at all there. They are very rare. And the answer is not epidermophytum also, because here the macroconidia is again club shaped. Pencil shaped is only one. So correct answer will be trichophyton only. Okay, according to me. The next question, there is a farmer who is having injury in the eye with the vegetative matter. Was there a question on the farmer having injury in the eye, vegetative matter, and following that the farmer developed ulcer in the eye? So they are asking the fungus, is it mucor or aspergillus? Was there a question on this? So you have to look for, you have to tell me what they mentioned in the question. Does it having septate hyphae or aseptate hyphae? Septate or aseptate hyphae will differ the mucor and aspergillosis. You can see the hyphae, both of them. The mucor have aseptate hyphae. You can see mucor. On the contrary, the aspergillus have septate hyphae. This is having septate hyphae. So what was mentioned in the question? So one student told it was septate hyphae. So based on that, the answer will be aspergillosis. So was it the same question with the farmer history having trauma in the eye with the vegetative matter? And these were the options. What were the other two options apart from mucor and aspergillus? And was the question contain septate hyphae? Am I right? Yes. So septate hyphae, the answer is definitely going to be aspergillosis, because mucor don't have septate hyphae. Here you have septate hyphae and you can see the narrow angle branching. Appreciate the 45-degree branching here. So here branching is also very wide. Here narrow angle branching is there and septate hyphae is there. In aspergillus, in contrast to mucor, where branching is wide. Have they mentioned about the branching also? Although the septate hyphae is the biggest clue given to you. Okay, based on that, you can straightforward go with the aspergillosis. Okay, so yes, one of the option was fusiform. Got it? Okay. So coming on the next question, one question was on penicillin allergy. So if they simply give you penicillin allergy, now the answer, all allergies come under type 1 hypersensitivity. The answer would be type 1 hypersensitivity. But here they have given you penicillin, the patient is on penicillin. After that, the patient developed hemolytic anemia. It's not simple penicillic allergy. No, it's the patient developed immune hemolytic anemia. So they ask you the type of hypersensitivity. Was there a question on that? Type 1, 2, 3, 4. I'm asking you. Yes. Was there a question on that? Type 1, 2, 3, 4 hypersensitivity, penicillin allergy leading to hemolytic anemia after taking penicillin. So here, if they mention anemia, it will be type 2 hypersensitivity, because all transfusion reaction will come under type 2 hypersensitivity. Okay. Yes. So you see, always I tell you these mnemonic of the hypersensitivities, type 1, 2, 3, 4. You have to learn these 4 mnemonic. Always you get questions on that. Okay, in type 2 hypersensitivity, I always tell you the mnemonic, my blood group is Rh positive. Among that, the blood is blood transfusion reaction. Among that, all the anemias will come. All the immune hemolytic anemias will also come in the blood transfusion reaction. So here type 2 hypersensitivity will be the correct answer. Got it? Type 2 hypersensitivity. Yes, leprosy was also there. That is my next question. So lepramin reaction is which hypersensitivity? So it is type 4. In that case, the answer will be type 4. This is another question. So 2 questions you got on hypersensitivity, I guess. Right. So here I always give you the mnemonic. John gave tulip popcorn to Hershey. So John gave tulip, T and L. So tuberculin and lepramin. These are the 2 reactions. Both of them will come under type 4. So lepramin reaction also type 4 hypersensitivity. This one, penicillin 1 is type 2 hypersensitivity. So for penicillin wala question, the answer is type 2 hypersensitivity. For lepramin, it's type 4 hypersensitivity. Both were based on the mnemonics, the examples, which I taught you several times. Okay, coming on the next question. The next question is on PSGN, post-streptococcal glomerulonephritis, and pneumonia also, I guess it is mentioned. So tell me a bacteria which cause the 2 things, the post-streptococcal glomerulonephritis and pneumonia. So the answer is group A streptococcus, that is Streptococcus pyogenes. Was there is a question there? Was there is a question on that, on PSGN and pneumonia, the bacteria causing PSGN and pneumonia? What was the exact question? It was a clinical scenario based question. Huh? So there is an overlap. Maybe the question may be from patho or micro. What exactly they asked, you have to tell me. So it is group A streptococcus. Group A streptococcus causes two of the non-suppurative infection, that is acute rheumatic heart disease and PSGN. So PSGN is caused by group A streptococcus. The answer is group A streptococcus. Okay, it is causing PSGN, post-streptococcal glomerulonephritis, in which the person have the tonsillitis, and after having tonsillitis by group A streptococcus, that is gas bacteria we call it, group A streptococcus, the gas bacteria go in the blood. After going in the blood, the bacteria goes in the kidney. Okay, after going in the kidney, the bacteria get deposited over the podocyte of the kidney. Okay, the podocyte, and after that the antibody also form and go and deposit, and it will damage the filtration barrier, leading to nephritic syndrome. Such a glomerulonephritis is post-streptococcal glomerulonephritis, which is always after gas infection, group A streptococcus. Okay, yes, group A beta streptococcus. So beta streptococcus only, no? So beta streptococcus are of 20 types. What are the 20 types? Group A to B. Among them, group A is most common. The name of the group is Streptococcus pyogenes, and that is causing PSGN as well as rheumatic fever. So the correct answer here is group A streptococcus. I guess the next question is neonatal meningitis is caused by. Is what it was a straight question. I guess it was not a clinical scenario based question. The straight question, neonatal meningitis. They are asking you this specifically neonatal, up to 28 days, meningitis is caused by which organism? So it's a bacteria. First, you have to understand the type of the meningitis, bacterial, viral, and tubercular. Among that, the bacterial one will cause the neonatal meningitis. Now, you can see the age group is very important. This I always insist to learn. According to the age group, the organism you have to learn. So from up to 1 month, that is neonatal age, the most common organism is Streptococcus agalacti. This is group B streptococcus. Just now I taught you group A streptococcus. Group A streptococcus. So beta streptococcus are 20 types I told you. Group A to B. Group A, I told you it causes post-streptococcal glomerulonephritis. This one is group B. The name of the group B is Streptococcus agalacti, followed by E. coli. I guess you were having the option of Streptococcus agalacti. If it was not there in the option, go with E. coli. But I guess Streptococcus agalacti was there in the option. So correct answer is Streptococcus agalacti. If you are saying it's neonatal, if they ask you 2 months onwards till 3 year, answer is pneumococci. 3 year onwards till 20 year, answer is meningococci, and after 20 years again it's meningococci. So meningitis you have to learn according to the age wise. The organism differ according to age wise. Got it? Yes. So it is taught you several times in the class. Yes. So this is the question. I guess one question on the food poisoning. They have given you an oyster image. Have they given you an oyster image or some other image? So there is confusion in the question. I am not getting the question clearly. There was a question on the food poisoning, oyster image, or oyster food after eating shellfish or oyster, the patient have food poisoning. Was it a question? Yes. So if it was a question, the correct answer is Vibrio parahemolyticus. Typical clue. I always insist on the food after eating which the food poisoning is occurring. So every organism have a very peculiar food. If the person is ingesting dairy products, some cheese, paneer, like any dairy product, and after that the person have food poisoning, it is always staphylococcus. Okay, the person is eating fried rice, the Chinese restaurant, it is always bacillus cereus. And here after the oyster or the shellfish, it is always Vibrio parahemolyticus. So was Vibrio parahemolyticus was given in the options? Vibrio parahemolyticus was given in the option. Was there a question on this oyster? Oyster, after ingesting oyster, there was food poisoning, and in the option there was Vibrio parahemolyticus. So the correct answer here will be Vibrio parahemolyticus. Maybe the image is not given, I'm not sure, but oyster is mentioned in one of the question, right? And the answer for this question is Vibrio parahemolyticus. One more question on exotoxin was there. Exotoxin. Hana, exotoxin. There the answer was toxic shock syndrome. What was the exact question? You have to help me. I didn't got the exact question. Did they mention menstruating female using tampons? Menstruating female using tampons. So in that case, answer is toxic shock syndrome. It is the exotoxin which is secreted by the step. So there was a question on the exotoxin. They asked about the Kanagawa phenomenon. Yes, I put the Kanagawa phenomenon in the slide, but I was not sure whether they asked. So they asked about the Kanagawa phenomenon. Kanagawa phenomenon is the biggest clue given to you for this Vibrio parahemolyticus, the last question. In the Vibrio parahemolyticus, the diagnosis is specifically made by Kanagawa phenomenon. It is a blood agar with high salt content. So a blood agar with 7% of the salt content is known as Vagat-Summa agar. And Vibrio parahemolyticus is able to grow on this. Normally, bacteria don't grow on such high salt percentage, like such high concentration of the salt. But Vibrio parahemolyticus is a halophilic bacteria which can grow here. So correct answer is Vibrio parahemolyticus, surely. Oyster is a clue. Oyster, after ingesting oyster, the person is having food poisoning, and Kanagawa is also a clue. The next question is on this toxic shock syndrome. Do you have a question on toxic shock syndrome? Some student told me there was a question on toxic shock syndrome also. So what was the exact question? I will come with the exact question soon. So exact questions, exact options I will get. So micro questions were 7-8 questions I got till now. I'm not sure whether more questions are there or not. So if you find more questions on microbiology, you can text it on the Telegram group of the Cerebellum, right? So we will come with a detailed description with all the options correct and everything. Till now, this is the thing. Wishing you all the best for the results. That's all about it in the microbiology. That's it. So the next will be anatomy, I guess. So sir, it's up to you for the anatomy, I guess.
Yeah, thank you, ma'am. Thank you. I think audio, everything is okay. Dear students, please inform me that screen is visible. Okay. Priyanka, ma'am, can you inform me audio, everything is okay? Okay, yeah. Thank you, ma'am. So we are starting the session. Hello, dear students. Very warm welcome to all of you at this session. Hope your exam was well. Best of luck for the result. And I will not take too much time for all of you. And not with the integration, too many questions had been asked. Yes, tell me this all are the on basis of the students recall. Okay, so if anything is wrong, please inform me at the chat box. Okay, so question one student informed me that there was a question inability to shrug the shoulder, damage to the spinal accessory. Now was the question. I told you Pushpa jhukega nahi sala. Yes, such kind of a situation. But there is a one controversy. Few students are saying, sir, there was the our high scapular syndrome, congenital high scapular syndrome. That is a Springel's deformity. So one question, and nerve supply of the tongue. This question had been asked. Okay, yes, we already learned with the our foramen of Winslow, the Pringle maneuver. Foramen of Winslow, this question had been asked. Yes, wrist drop, radial nerve. The classical question had been asked. The trichobasor, again, it was repeated in FMG exam. Yes, trichobasor, surgery integration, this question had been asked. The question over the mediastinum and the phrenic nerve, it had been asked. And housemaid knee. Yes, earlier I was teaching the housemaid knee. I was teaching the clergyman knee. But right now, we not included, but this question pattern again came into the our exam pattern. Okay, yes. Now next, esophagus does not have which layer? So serosa is not there. So this was the our question. Few students were saying about the Popeye sign. So tell me, dear students, Popeye sign jo tha wo question mein tha ki nahi? Yes, more integration. Terion, extradural hemorrhage integrated with the radiology. Hiccup, mediastinum image was given. The answer was the phrenic nerve. And the question for the neural tube defect. ये फिर से repeat हुआ है. Neural tube defect, anencephaly, rachis, this all had been asked. Okay. Please inform me if any question is not there or we have to add anything. Congenital high scapular syndrome, as I told you, Springle's deformity, it had been asked. Shaft fracture, radial nerve injury, it had been asked. Cubitus valgus orthopedics integration, this has been asked. And I told you always the meralgia paresthesia and the cheralgia paresthesia, lateral cutaneous of the thigh, this question had been asked. Talus ossification, it occurs on the 7th month, it had been asked. And our favorite question, anatomical snub box boundary, it had been asked. Okay, yes. So just one quick review, question had been asked. Please tell me if any wording options are changed. Okay, yes. Question, a patient was in accident a month ago, still persistent wrist weakness, which nerve is injured? So this is the very simple question. We all know, sir, it is our, yes, wrist drop. So this is our situation of the wrist drop. So in our app, Cerebellum app, we had seen the wrist, our radial nerve injury, all the things, clutch palsy, the wrist drop, the finger drop, and the Saturday night palsy. So hope you all observe this one. Yes, there was the another question, in given case which nerve is injured, and I'm not having the exact image, but students are saying there was the fracture of the shaft of the humerus. Okay, auriculotemporal nerve. Okay, Dr. Dope, auriculotemporal nerve was asked. Okay, fine, I will include this one in the question. Few students we are saying about the nerve supply of the ear lobule. Okay, so right now we are moving, sir, this is our shaft. I am including the auriculotemporal nerve. Okay, yes. Fracture of the scaphoid was asked. Correct, scaphoid is the answer with the outstretched hand. So here one image we had discussed already in our Cerebellum app, integrated with the our anatomy, orthopedics, and our radiology. Yes, this is the question, boundaries of the anatomical snub box. You all the students are saying this one. Yes, we had seen the different boundary, and the mnemonic is आगे longest, पीछे longest, बीच में brevis. So entry boundary is formed by our abductor pollicis longus, extensor pollicis brevis, and posterior longus is extensor pollicis brevis. So students, we are saying that this question had been asked. We had seen this all the things in our cerebellum notes as well as videos, and here the cadaveric image practice also we done. Okay, talus ossification. Yes, Dr. Dope, talus ossification at the 7th month of the age, it was asked. Now, can you see, this is the one very favorite question, integrating with the our surgery, with the psychiatry, and with the anatomy, identify the image and diagnosis. So definitely this is our trichobezoar. One another option I'm not getting, please tell me if there is the any kind of the changes. Yes, in our app, Cerebellum app, we had seen the trichobezoar as well as phytobezoar. We have to send such kind of the patient, the females, they are having the habit to eat the air, that is a trichophasia. Yes, anatomy and the psychiatry integration, you have to send such kind of the patient to the psychiatry department. You can get at our Cerebellum app. Now see here, there is the one another question, obs-gynae integration. After vaginal delivery, a female presented with pain on anterolateral aspect of the thigh, anterior and lateral aspect of the thigh, which nerve was injured? And remember, during the our learning in Cerebellum app, I taught that lateral cutaneous of the thigh, which is coming from behind of the our inguinal ligament, it is compressed in many kind of the situation. The patient will present with the pain, tingling sensation on this side. So this is our meralgia paresthesia. And I told you that there is the many kind of the song like the Gia. Yes, Mera Le Gia, Mera Le Gia. And in the similar way, I told you there is one another paresthesia, Salmon boy, Aaj gaadi tera bhai chalayega, cheralgia paresthesia. Many times I've told you cheralgia paresthesia is important, but meralgia paresthesia is more important. So this was our question. Okay, site of aortic aneurysm, site asked in the cadaveric image. Yes, Dr. Dope, you are right, beta. Aortic aneurysm has been asked, but it was irritating to the nerve. Which nerve? Phrenic nerve was the answer. I think this is the question. Okay, now see here, there is the our all the boundaries we had already discussed in our videos. Now this is the esophagus. Esophagus does not have. Remember, esophagus is located in the thoracic cavity. Other all structure, stomach, intestine, duodenum, these all structures are in the abdomen. Remember, the serosa is nothing, sir. It is modification of the peritoneum. Getting the point, beta? Okay. And yes, esophagus is not in the abdomen, so esophagus is not having the serosa. So this question had been asked. Okay. Yes, supply of the pinna. So wrist drop image was there. Yes, we already discussed the medicine. Okay, supply of the pinna. So many nerves are there. Main nerve is the great auricular nerve. Yes, you will see that auriculotemporal nerve is also supplying. Also the laser occipital nerve. You will discuss this thing in anatomy as well as ENT. Now there was the one question. This is the very hit question. A patient met with the road traffic accident, presents in the unconscious state, BP is normal, and there was the biconvex opacity. Yes, idly shaped opacity, lens shaped opacity. Which part? Yes, this is diagnosis, the EDH, but question had been asked, which part was involved in such kind of a road traffic accident? Answer is this H-shaped area. This is our pterion. So with the three-dimensional orientation, many times we had seen this, all the things, sir. Yes, Monica, you are right. So can you see? This is our skull. And here you can see this H-shaped area is very thin. This is known as the pterion. The central thinnest part of this pterion is known as Sylvian point. If there is a fracture, there is the rupture of the middle meningeal artery, and this rupture of the middle meningeal artery results in the extradural hemorrhage. So this is very, very important. Never leave this topic. Okay. Stapedius and tongue supply. Correlation. Doesn't know what was actually. Yes, Medicine, can you tell me? I got that question that now supply the tongue, but I have no idea. I have not received such kind of the feedback that stapedius is the smallest skeletal muscle. It is the derivative of the second arch, so it is supplied by the facial nerve. It is clear. Okay, fine. Yes, treatment of the EDH. So you will learn there in your clinical part. Okay, Vash, a patient presented with the road traffic accident. On investigation, yes, EDH was found. Which part of the skull was fractured? Pterion. We did our integration in cerebellum regular notes as well as quick revision notes along with the cavernous sinus thrombosis also. Okay, yes, the very hit question, neural tube defect. Students, we are saying the image for the anencephaly with the combination of the craniostasis. Also, you can say rachis. Yes, there is the absence of the cranial vault. Along with our spinal cord was also completely open at the backside. So this is our complete neural tube defect. So this is our anencephaly we studied in our cerebellum app. All the congenital deformity with our spina bifida, yes, anterior neuropore defect, posterior neuropore defect, all the things we had seen. Okay, this is the beautiful topic where you will learn about the vitamin B9. Okay, then anatomy integration. So biochemistry and anatomy integration. You will see in the pedia, you will see in the obs gynae. So pedia obs gynae integration. The treatment by the surgery. Yes, so surgery integration. Okay, many anti-epileptic drugs which are decreasing the absorption of the vitamin B9. So pharma anti-epileptic drug, phenytoin, carbamazepine, valproic acid, this all. So this is the beautiful topic and it is having the high chances which is going to ask in your next exams also. Okay. Yes, depressed fracture. You will see that depressed fracture of the skull in your forensic part beta, but you can integrate with the anatomy also. Okay. Yes, this was the question which you were discussing. Patient presented with the aortic aneurysm having multiple episodes of the hiccup. So remember, the hiccup is due to sudden contraction of the diaphragm. And what is the nerve supply of the diaphragm? Remember, the diaphragm is supplied by the phrenic nerve. In our app, I discussed earlier the phrenic nerve, and the mnemonic was also 3, 4, 5 keeps the diaphragm alive. Yes, phrenic nerve is the most important nerve for the diaphragm. So if there is a sudden contraction of the diaphragm, in that situation, there is a hiccup. So you have to just identify. Students were saying that any cadaveric image was given. So try to catch this point. Sir, this is our heart. Here is our ascending aorta, arch of aorta, descending aorta. You can see one nerve is coming from the front side. Yes, sir. It is crossing the pulmonary hyla from the front side and it is running towards the diaphragm. So if you are not aware about this nerve, even you can see that this nerve is coming from top towards our diaphragm. So this is your answer. This is the phrenic nerve. Getting the point better? Okay. Yes. Any kind of the image can be asked. I had put here another image. Sir, this is the phrenic nerve which is coming from the front. Another structure is the artery. So don't mark that structure. Okay. Yes. Morula gastrula ventral folds. Yes, Vash, can you tell me what is the morula gastrula ventral fold? Sacral caudal agenesis. Okay, I'm including this all the question. You are saying about the morula, gastrula, ventral fold. Okay. And you are asking that sacral caudal agenesis. Okay, fine. Option में nerve नहीं था. So can you tell me about the options, beta? Options में marking थी. Yes, you have to find out. You have to find out that phrenic nerve. But hiccup is related with the phrenic nerve. Okay. Yes. Getting the point, Bushra? Yes, yes. Medici Terion question with your craniotomy. Now, we had seen this, all the things. We had seen the mediastinum also. There was a such kind of the image, mediastinum, which we discussed in our anatomy, that mediastinum is having the superior mediastinum. Yes, sir. Then inferior mediastinum, again anterior, middle, and posterior mediastinum, and our phrenic nerve is passing in front of our pulmonary hilum part. Okay, fine. Now this is our Pringle's maneuver. This is the surgery integration which we had already talked in our anatomy videos. See here, we are inserting our finger in foramen of Winslow. Okay, so we can compress the free margin of the laser omentum. Yes, sir. Here is the free margin of the laser omentum. Compression of this free margin of the laser omentum, it will compress the VAD. Yes, vein, artery, and the duct. Okay, portal vein, hepatic artery, and the bile duct, they are compressed. So now you can perform the hepatobiliary surgery for the long time. This is the Pringle's maneuver. Okay, marking was on the trachea, aorta, and pulmonary artery. Okay, any more structure? You are saying, Bushra, marking was trachea, aorta, pulmonary artery. Yes, yes, Monica, it is the epiploic foramen. So I will look for this question. Okay, because hiccup is related with our nerve. But if any more points, exact question pattern framing is required, we will see better. Okay. Yes, and you had seen this BPH topic. Our Dr. GRG sir, he told about this question, and I always saying that one question from the prostate. Why? Because 70% of the old people, 70% chances that they will get the BPH. So this question had been asked. Yes, sir. Elderly male with the urine hesitancy, retention of the urine, comes to the hospital, and which drug you will use? 5-alpha reductase in calcium channel blocker, AC inhibitor, aldosterone antagonist. Why I'm saying? Because already in our anatomy video, we integrated this our anatomy of the prostate gland with the pathology, and then all the treatment part also we discuss: alpha blocker, alpha 1 blocker, prazosin, tamsulosin, 5-alpha reductase inhibitor, finasteride. So best drug is the combination of the tamsulosin and the finasteride. This is the beautiful integration, and always this topic prostate will be asked. And if it is not successful, then we had talked about our TURP surgery also. So this is the beautiful part from the anatomy, many integration we found. Okay, yes, now supply the tongue. So remember, the now supply the tongue, motor nerve supply is our 12th cranial nerve, except palatoglossus. Yes, it is the muscle of the palate, so it is supplied by the pharyngeal plexus, vagoaccessory complex. But if you will talk about the sensory nerve, so in that situation, remember the anterior 2/3 general sensation by the lingual nerve, while the taste sensation by the chorda tympani. And remember, except our circumvallate papilla is supplied by the glossopharyngeal nerve. Very important question. While the posterior 1/3 part is supplied by the glossopharyngeal nerve, general sensation as well as special sensation both, and the posterior most part by the 10th nerve. Getting the point? Okay. Scissoring gait. Okay, so you will see the scissoring. Okay, I'm including this scissoring gait. Okay, fine. One question was, lady in labor, head of fetus is visible. Which nerve is injured? Okay. One question I got, that was our related to the melalgia paresthesia. But if any more question, kindly look at the obs-gynae part. Okay. Anterior test supply. Which test is lost? Okay. Anterior 2/3. So anterior 2/3, there is our now supply by the chorda tympani. Okay. Yes. Now, few students we are saying about our Popeye sign. I don't know it has been asked or not. Few students are saying, so classical sign, you will see there is a rupture of the long of the biceps. So classic sign for the biceps tendon, that is our Popeye sign. Remember, this question had been asked in your INICT pattern, NEET PG pattern, from where this question had been asked in your FMG exam. Yes, this is the question integrated with our orthopedics. Housemaid knee. Remember the housemaid knee, H for housemaid knee. pre-patellar bursitis. So there is the inflammation in front of the patella. I told you bursa is important, and we dedicated the many songs for the bursa also. Mohabbat barsa dena tum ke sawan aaya hai. In such kind of a funny way, we learned this bursa topic. Tip tip barsa pani. Do you remember bursa? So there is a bursitis. So housemates, they are getting repeated injury on the front side of the our knee part. So they are presenting with the housemate knee, and in the similar way, infrapatellar bursitis, that is a clergyman knee. So this is the our topic. Few students, we are saying that one question asking about the level of the line marks in between the two iliac crest. If the two iliac crest they are marked, so you will say, sir, this is our L5. So this is again another important topic. The green line, they were asked about the transtubercular plane. Answer was the L5. And this is the usual question, subcostal plane. Answer was the L3. And then there was a question on the umbilicus, L3, L4. So this is very hot topic, entry abdominal wall. I told that entry abdominal wall, one question sure shot. So these are the points at the last. Winners are not those who never fail, but those who never quit. So thank you very much. This was my session. If any doubt, please ask, and you can drop your queries or any kind of the update directly at the Cerebellum group, also at my number 91317833495. Yes, L4, L5 option. Entry two-third supply. Yes, entry two-third, that is supplied by the taste sensation by the chorda tympani nikhil. Okay. L4, L5 you have to go. Okay. L4, L5, L4, L5. Okay. Trotter line you will learn in anesthesia also. Yes, exactly, Nikhil. I am not getting the exact options. We will work on this all, and we will come with the proper exact framing of the question, exact options in our Cerebellum app. Okay, beta? Yes, yes. Okay, thank you. So I am now handling to the next teacher. Thank you. Any kind of doubt, please drop at the Cerebellum Telegram. Otherwise, you can message me also. Thank you. Thank you, everybody.
So hi everybody, I hope I'm visible and I hope I'm audible. Okay, so we will be discussing obs and gynae, and when I started out with the recalls, I realized initially I thought very few questions are there, but then lots and lots and more questions came cropping up. So I think we have between 25 to 30, and that's the usual number in obs and gynae. Okay, so let's start. Some of them, of course, are overlapped. Some have overlapped with PSM. Some have overlapped with some other subjects also, but we'll quickly go through everything. I won't take too much time, and I think most of you found obs and gynae easy, right? Am I right? So I think it was quite, except maybe a few questions, most of it was very, very straightforward. Okay, so let's just start. If there's some questions which I put in the end, which I found a bit incomplete, just help keep adding on to what is missing. Okay, so in which of the following will you not do induction of labor? Okay. So where will you not do induction of labor? Let me just switch on the chat box also so I know. Yeah, okay. So I think we're very straightforward here. Here in placenta previa is a complete, central placenta previa is a complete contraindication for a vaginal delivery. If there's any contraindication for a vaginal delivery, you will of course not at all induce her, right? Okay, so then let's go to the next one. This has been covered already by Dr. Vivek, and we all know the answer is less than 70. The current maternal mortality ratio is 103, and the aim is to bring it to less than 70 by 2030. Okay, then there were several questions on MTP, and this is on the new MTP Act, the amendment of 2021. So I thought, let me just quickly go through them. They've been covered, I know, but let's quickly go through them. A fetus was diagnosed with the NTD, neural tube defect, and wants MTP at 21 weeks. Now, remember, under the new act, what it says is that only the woman's consent is required, right? And if she is less than 20 weeks, opinion of one doctor. If she is between 20 to 24 weeks, opinion of two doctors. And if she's above 24 weeks, if you're doing an MTP for a substantial fetal anomaly, then we require the opinion of a medical board. So that's very important. So less than 21, 20 to 24, 2, and After 24, opinion of a medical board. Now, this was the second question. Your husband's permission is not required at all. Remember, it's only the woman's consent, and that's very important. Nobody else's parents' consent or whatever is not required if the woman is mentally sound. Okay. Now, MTP after 24 weeks, there's some confusion in this question. Okay. So, MTP after 24 weeks is not done for, or the exact question, I'm not sure what it was. If anybody gets the question, do let me know. I think it was MTP. The exact question, I'm not sure. But if we talk about MTP less than 20 weeks, okay, then we have the standard indications. Okay. Okay. I'm still not getting on the chat box what this question was. But remember, after 24 weeks, okay, after 20 weeks, my pen also is not working today. So after 20 weeks and before 24 weeks, there are only certain indications. So this is the table that you should remember. Less than 20 weeks, you can do it for maternal indication, for fetal indication, if it's a rape victim, or for contraception failure. Between 20 to 24 weeks, there are only some special indications, and those include rape, a minor, if there's any disability in the woman, if the woman has had a change of marital status, that means she's maybe become a widow. If there is a humanitarian setting, like if the government declares war or some natural disaster happens, then also it can be done. And fetal malformation. So fetal malformation remains. That's why I think there's something wrong in the question. Yeah. MTP done up to 24 weeks, except I think hona chahiye. And then the answer comes contraceptive failure. But I don't know how it was framed. Let me go through some more recalls and then we understand better how it was framed. After 24 weeks, it is done only and only for substantial fetal malformation. So fetal malformation comes in all three categories. So it depends on how the question was formed. Okay. But this table is important. So you should know this, and this is there in the lectures. All right. Okay. Post-delivery, the uterus will correspond to how many weeks of gestational age? And we know after delivery, the uterus comes and lies at the level of the umbilicus. So the answer here is 20 weeks gestation. This was pretty straightforward. It's a repeat previous year question. It comes very often. You should know the sizes of the uterus in pregnancy and after delivery also what happens to it. Okay. Pregnant woman with heavy bleeding, on examination, there is hypotension, fetal heart rate is absent. So there's a direct clinical scenario. And this might not be the exact scenario, but the clinical scenario that was given pointed to abruption. So remember, antepartum hemorrhage and placenta previa. Okay, my pen is not working. Yeah, antepartum hemorrhage and placenta previa are two important points, two important clinical scenarios. You should be very clear how to differentiate. Okay, usually antepartum hemorrhage is the critical one. It presents with maternal shock and fetal distress or fetal death. Placenta previa is more of a recurrent, painless vaginal bleeding. Yeah. Okay, then there's a question on, again, this is a very commonly asked question, the 3 swab test. The middle swab was stained with dye. So you can see in this diagram very clearly, if the lower swab is stained with dye, it's a urethrovaginal fistula. If the middle swab is stained with dye, it's a vesico-vaginal fistula, what was asked in the question. And if the upper swab is stained, in fact not stained, it is not stained with dye, but otherwise wet, it is a uretrovesical fistula. So this 3 swab test is very, very commonly asked. Okay. Then this is another classical previous year question which comes in almost every other exam, be it FMG, NEET PG, INI, it's always asked. So this is the snowstorm appearance, and here we know which hormone is increased. We know HCG is increased. Okay, this is a complete molar pregnancy. Okay. Then this has been covered by Sir in anatomy. It's very commonly asked, again, repeatedly asked in some form or the other. So neural tube defects, how they look like, how they present, what is the prevention, all this is a very high yield area. This is anencephaly. And I think साथ में spinal deformity भी दिया हुआ था, right? Okay. Identify this maneuver. What is this maneuver? What is this maneuver? This is the Richard's maneuver. This is basically delivery of the head in a controlled manner to prevent sudden extension. The controlled delivery of the head is done by Richard's maneuver. Okay. This is also will overlap with surgery, but we all know what this is. This is a Verey's needle used to create pneumoperitoneum. Again, a favorite. एक instrument आना होता है, and from obs and gynae, and usually they ask very easy ones. This also is very straightforward. Verey's needle. Okay. Then there was a question on emergency contraception. So contraception is also an area which always comes. Contraception, MTP, these are commonly asked areas, which is not used as an emergency contraceptive. So they had given ulipristal, which is used. They had given ulipristal is used. The combined OC pill is the use-based regime that is used. LNG single 1.5 milligram tablet is also used. I think this was the option which was the wrong one. Okay, so if you're giving LNG 0.575 milligram, you have to give 2 tablets 12 hours apart, not in 24 hours. So this was the wrong option. If this was the question, if there are any changes, do let me know. Okay, but emergency contraceptive, straightforward topic. Okay. Then there was a question, what is the drug used in chemoradiation in cervical cancer? Okay, and the answer to this question is, anyone? The answer, if this was the question, is, okay, there was Copperty. Copperty is also used as emergency contraception, so that's also all right. The answer is cisplatin. So cisplatin is used in chemoradiation in cervical cancer. Okay. Okay, so copper T was given. Treatment for PPH will come in the end. That question was there. I need to discuss that also. I put it towards the end. Okay, let's continue. Okay, male. So there's a question on male infertility. This was Kallmann syndrome was given. Okay, and which is incorrect was asked. Okay, so we all know in Kallmann syndrome there is gonadal dysgenesis. So testosterone levels are low. Okay, and what happens is FSH levels in turn will be high. So low FSH is wrong. Okay, and FSH levels would be high. So it's hypergonadotrophic hypogonadism in Klinefelters. So male infertility again is a very commonly asked topic. There were 2 or 3 questions on male infertility and spermatogenesis. Okay, copper T was not in the option, was not. Okay, it's all right. So we know the correct answer, what it was, right? Okay, what hormones are secreted by the Leydig cells? So we know the Leydig cell secretes or produces testosterone. And the Sertoli cell produce 2 hormones, inhibin, okay, and AMH. Okay, you'll have to excuse my pen for not working today. Okay, so AMH, yeah. So these are the hormones secreted. There was a diagram given. I think physiology has covered this, right? So this was also pretty straightforward. And the third question which came from male infertility was a patient with chronic lung, with recurrent lung infections and male infertility. Am I right? And I think this was Carter-Jenner syndrome or primary ciliary dyskinesia. It was a question you could like integrate with pathology or medicine or gynae put together. So there was a question on primary ciliary dyskinesia, which is basically immotile sperm seen in Carter-Jenner syndrome. Okay, anything else I need to add to this question? So male infertility, again, a very high yield area, which usually gets asked. Yeah, Carter-Jenner syndrome. Okay. Then there was a clinical scenario on diagnosis of preeclampsia. I think it was a 32-week old lady with blood pressure given high with urine albumin 2+, and the diagnosis was asked. Was that the question, or was there anything else to it? It seemed pretty straightforward and very easy. Was there anything else, or was this the question? Anybody? Okay, so I'm just waiting. There's a bit of lag in the chat and the Zoom, but I'm not getting any responses. We move on. There was a straightforward clinical scenario on diagnosis. Dipstick was given. So urine dipstick was given 2+ nickel, and that I think is straightforward diagnosis for preeclampsia. Okay. There was a question on the quadruple marker. When is the quadruple marker done? And quadruple marker is done ideally between 15 to 22 weeks. That is the second trimester of pregnancy. It is a screening test for Down syndrome. Okay. And yeah, so Achokir was asked inhibin HCG test. Okay, so inhibin, HCG, alpha fetoprotein, serum estriol are part of the quadruple marker. If you remove inhibin, it is the triple marker. Both are done in the second trimester. Okay, so these are screening for Down syndrome. Okay. Then there was a question on GDM, 32 weeks lady who is diagnosed to be GDM. When was her screening test done? That was the question. There's a clinical question again. Okay, clinical question on GDM. When do you diagnose GDM? ऐसे कुछ था questions में कि GDM कब diagnose होगा? Anything? Yeah, Nishan, 16 to 18 weeks is quadruple and triple both, but you can do it between 15 to 22 weeks. What about screening for GDM? पे क्या question था? Can anybody tell me? Okay, so is the question straightforward, I think, and the answer, when do you screen for GDM? You screen for GDM between 24 to 28 weeks, ideally. Okay, 24 to 28 weeks. Okay, all right. Which of the following is a direct cause of maternal death? ये उसमें भी covered हुआ है, Dr. Vivek ने cover किया है. So is a direct cause, and the options given were anemia as an indirect cause, heart disease is an indirect cause, embolism is an indirect cause. What is a direct cause? It is preeclampsia. But the most common direct cause is PPH, followed by hypertensive disorders of pregnancy, followed by sepsis. Okay, so you have indirect causes and direct causes, and the most common direct cause is PPH. The answer here was preeclampsia. Okay, अलग-अलग options थे. GDM वाला था 24 था, and then 28 था. Okay, there was not 24 to 28. Anybody else can tell me what the options were? Okay, there's a question on flu cells, on bacterial vaginosis. I don't have that question. Okay, there was a question on recurrent abortions. Yeah, I have that question. 1 second. Okay. There were no questions on cancers. There was a question on chemotherapy. I think was wohi tha on cancers. Okay. Which is not a hyperestrogenic condition. Was this question there? Which is not a hyperestrogenic condition. So when we talk about hyperestrogenic condition, okay, when we talk about hyperestrogenic conditions, remember that if the woman is nulliparous, if she has an early menarche, late menopause, endometriosis, tamoxifen, okay, and especially if she's on the fatter side, so obesity, PCOS, these are all hyperestrogenic conditions. So low BMI is not a hyperestrogenic condition. Okay, so high BMI is a hyperestrogenic condition. And what are the hyperestrogenic conditions? We should know: endometrial hyperplasia, endometrial cancer, endometriosis, polycystic ovarian syndrome, fibroids. These are all hyperestrogenic, associated with hyperestrogenism. Okay. It was which won't cause endometrial cancer. So similar, right? Which will not cause endometrial cancer. Basically, ki kaun sa hyperestrogenic nahi hai. Okay. As I said, these are recalls. They need a lot of correction, Abhi, but I'm just trying to give you the basis of what was asked. Okay. Okay, the other name for an outlet forceps, but I think a question aaya tha ki the head is at the outlet. Which forceps will you use? Hai na? So if the head is at the outlet, you'll use a Wrigley's forceps. The other name for the outlet forceps is a Wrigley's. Keelan's is a rotational forceps. It is used when the head is much higher up. Piper's is a breech forceps used for after coming head of breech. Okay. And Das is a low forceps. So the outlet forceps is the Wrigley's forceps. Okay. Question was risk factor for endometrial cancer. Okay, got that. Okay, I'll correct that. Question was which is not causes hypertrophy endoderm. Okay, got outlet forceps ho gaya. PCOS wala mujhe, I need you to help me with that. We're coming to that. Okay. Fifth, this we've covered postpartum blues. ये मैं cover नहीं कर रही हूँ. Psychiatry में cover हो चुका है. ठीक है? Okay. This was classic question again. A previous year, usually very commonly asked. Blues या depression usually पूछते हैं. Okay. Then comes the PPH question. I need you to help me out in the PPH question. Question में क्या दिया था? Ergometrin was given, oxytocin was given, but patient continued to bleed. What do we have next in our armamentarium? और क्या हम दे सकते हैं? हम दे सकते हैं misoprostol, अगर prostaglandin पूछा गया, हम दे सकते हैं PGF2 alpha, carboprost. अब इनमें कौन से options थे? Dinoprost था या dinoproston था? Is important. Because if it was dinoproston, this is PGE2. ये PPH में use नहीं होता है. Misoprostol is used. But if it was carboprost, this was given, this is PGF2 alpha या carbitocin दिया था, what was given? Anybody can remember what exactly was given? Was PGF2 alpha given? Okay, suction is done till what age? Suction evacuation is done till 12 weeks of pregnancy, if that was a question. इसमें मुझे options बता सकते हो PPH वाले में क्या options थे? Was PGF2 alpha an option or not? Alprostadil was an option. Okay, so misoprostol bhi tha, PGF2 alpha bhi tha. Then to choose a better answer might be PGF2 alpha because it has a quicker onset of action. Misoprostol is by the oral or the mucosal route, the onset of action takes time. So a quicker, more faster onset of action would be a parenteral, and maybe alprostadil or PGF2 alpha would have been better. If somebody can help me out with the question again, it would be very useful. Okay, so carboprost would be better because prostaglandin F2 alpha, because it's a parenteral administration. Misoprostol takes at least 30 minutes to act. That's why it's better for prophylaxis. But it's also given for treatment. Okay, dinoproston we don't give, it is PGE2. Itna strong neurotonic nahi hai. It is more of a it is used for induction of labor, not for PPH. Okay, so probably carboprost would have been the better option here. Okay, unless there's something else in the question which we are missing. Okay, there was a question on shoulder dystocia. Was there the maneuver was asked? Was shoulder dystocia asked? Anybody? Because it's a commonly asked topic and it was not asked. Okay, there was some doubt here whether it was asked or not. So this was not asked. Secondary amenorrhea was asked. I think a recurrent abortions wala question tha. Recurrent abortions with ye pucha tha recurrent abortions with secondary amenorrhea of 24 weeks or something was asked. Was that asked? So the answer would have been Asherman's or intrauterine synec. ये भी doubtful था, पूछा था या नहीं. Some students were saying आया था कोई secondary amenorrhea with recurrent abortions. Okay, it was not there. Done. PCOS is the last question. What was asked on PCOS? Anybody can tell me? Okay, galactokinesis was a question. Okay, I'll add that. PCOS पे क्या question था? So OBG was so easy, I think that everybody's marked all the answers and forgotten about it, right? So OBG was actually very straightforward. Nothing out of the box came. है ना? Okay, prolapse was there. Yeah, this also I heard prolapse was there. McCall's scaldoplasty पूछा था क्या? McCall's scaldoplasty. Okay, Sainike was there. McCall's scaldoplasty is treatment of enterocele. Remember this. Treatment of enterocele is McCall's scaldoplasty. या तो पूछा था McCall's scaldoplasty किसके लिए होता है? Or they asked enterocele, how will you repair an enterocele? So something was asked. Okay, PCOS was given. Okay. Okay, used for which prolapse? It is used for enterocele. Okay, so this completes the list, I think. Okay, and I think most of you have done very well in OBG. It's very straightforward, very from the book, and nothing has come as a surprise. And I wish all of you the very best of luck. I'm sure you'll all do me very proud. Okay, so I think we'll hand over now to dermatology. Dr. Srinivas is there?
Yes, madam. Thank you so much.
So, sir, over to you.
Thank you so much for the detailed discussion of the gynecology questions, ma'am. So, students, now we are going to begin the dermatology discussion part. So I hope my screen is visible to all of you. And I hope my audio is also working fine. So this was the question which was asked in this examination. So you can see question says, so I know that you have been almost active for the 24 hours, the students who have given the examination. So I'm going to quickly take you through the questions which are asked, and I'm going to tell you what are the answers. There were quite a good number of questions which were asked from the dermatology. So 50-year-old man, an elderly person coming with the lesions which you are able to see here, which are having silvery white scales, on the top of which you can see silvery white scales, and these lesions are basically plaques, which are erythematous red plaques. And the next question says, on examination, painful and swollen fingers are noted, and there is inflamed wrist joint. So what is the most likely diagnosis? This was the question which I have received from many students. Okay, opic tha back part of the body. Okay, wherever this lesion was there. So ultimately, this is a description. So erythematous plaques with silvery white scaling. So if these kind of lesions, which are very much characteristic of psoriasis, are present along with inflammatory changes in the joints, the two smaller joints, you should always think about the diagnosis, which is psoriatic arthritis. Okay. So these were the other options. If there is any discrepancy in the other options, you can please let me know. Okay, most of the students have marked the option B. So this is the part which is mentioning about the inflammation of the fingers, which is called as dactylitis. And you can see these are the differences. Quickly, we are going to see between psoriatic arthritis and reactive arthritis. So psoriatic arthritis, it is a type of arthritis which is seen in patients of psoriasis, and it is associated in age group which is more when compared to the reactive arthritis. Why? Because in reactive arthritis, you can see the age group is going to be little bit younger, 20 to 40 years, and this is associated with infections, triggered by infections, which could be gastrointestinal or genitourinary. And also you can see in psoriasis, it is usually going to be asymmetrical, and it is going to involve the joints which are smaller. Whereas here you can see this is going to involve reactive arthritis, larger joints are going to be affected. So they were the differences. And this question, many students have told me that it came, a patient presented with these lesions to a doctor, and he was treated with topical steroids. So what is this condition called as? So in the image, you can see that there is again an annular lesion. There is an annular lesion which is having peripheral erythema. And in the center, you are able to see there is clearing. So peripheral erythema, along with that, there is even scaling. So if this kind of an annular lesion is seen, you should always think about tinea. But in the MCQ, it is in this question, it is mentioned that there is history of usage of topical steroids. So if there is a tinea which is modified due to this topical steroid usage, then the answer is now going to be tinea incognito. Okay, tinea incognito. Was this a question there, and were these options mentioned in the today's examination? Please, in the comments, in the chat section, please do confirm. Yes, Dr. Gohil, sausage fingers, that is dactylitis. It is seen in psoriatic arthritis. So was this, the lesion exactly asked in the examination, or was this some different? Many read different. Patchy lesions in the legs. So was the patchy lesions in the legs photo for this question or for any other question? Yes, please just put your answer in the chat section. Was the this type of annular lesion was there? There was another option. Okay. So please, in the chat section, on the comment section, please different lesion. Yeah, different lesion. So possibly they might have this tinea incognito. Whenever there is a tinea which is modified due to the steroid usage, this is going to be called as tinea incognito, and there is going to be certain changes because of the usage of the steroids. There will be reduced itching, that will be the first thing, and there is going to be diffuse scaling all over these lesions, Most likely they might have given a image where there was more scaling. Okay, so please put in the chat section in the comment what was the exact image you can describe, or in the Cerebellum Telegram channel also, or group also, you can post that particular image. So this is the next question. We can say this is a repeat question which was asked in the previous FMG exam itself. So this image, I think it was already discussed. This is seen in filariasis, lymphatic filariasis. Lymphatic filariasis. And as the name itself suggests, it is due to the involvement of the lymphatics, Okay, so I'm not going to discuss this in a greater detail. And this is the next question. Identify this condition where you are able to see the lesions which are having some verrucous surface or rough surface, which are present over anogenital region. Anogenital region is having some lesions which are looking like cauliflower-like growth with verrucous or rough surface. Whenever you get to see these kind of lesions, you should always think about warts. Because they are present in the genital area, they are called as genital warts. And these are due to human papilloma virus 6 more than 11. And also other HPV like 16 and 18 are also associated. But in the options, you can see that HPV is not mentioned, warts is not mentioned. So what is this condition? If you have marked option A as the answer, absolutely correct. Please remember, there is a very much confusing term, which is condyloma lata. But condyloma lata, you can remember that it is associated with secondary syphilis. It is associated with secondary syphilis, condyloma lata. I hope everyone has made this question correct. So this is the next MCQ. Identify this condition. So basically, dermatology is a very much visual field, and likewise, the MCQs were also asked with images and the options. That's all. Some questions were not even having any description. So if this question, for this question, what did you all answer, and what were the other options which were given in this question? If you do remember, please help me to fill out the other options. And I hope every one of you have marked this question right, because this is also a previous year question, and we have discussed this in detail in our Cerebellum app also. Very good. Malignant melanoma was the option, and yes, it is the answer here, malignant melanoma. So what are you able to see in this image? You are able to see there is some dark lesion, that is hyperpigmented macule, and a patch is present. And what are you able to see? That it is having asymmetry. It is having asymmetry. So if you draw like this, then you can see that this quadrant is having more amount of the lesion. So asymmetry is there, A for asymmetry. And if you observe the borders, the borders are very, very irregular. Irregular borders are there. B is also there. C for color. See color changes, you can see in few areas which I am marking with highlighter, the lesion is very much hyperpigmented, and in other areas which I am marking with a pencil, it is very mildly hyperpigmented. So color difference is also there, and obviously you are able to see that the diameter is more than 0.6 millimeters. The diameter is more than 0.6, sorry, it is centimeters. And also E in the lesion, you are able to see that there is some kind of evolutionary changes, that is some growths are coming out of this lesion. So all these 5 features, that is A, B, C, D, E are present, which are going to give us a diagnosis of malignant melanoma. And this is the next question. I hope everyone has marked the same question. Female, okay, fine, diameter, right. So which of the following deficiency associated with poor wound healing, diarrhea, dermatitis, and alopecia? So please in the chat section write down were all these options given in the question, and also were all these points mentioned in the question. As I have told, poor wound healing, dermatitis, diarrhea, and also alopecia, or were there any more points given in the question apart from this? So yes, infertility was also given. So some students, Dr. Nikhil is telling infertility is given. So please confirm the rest of the students. Was it given in the question? Yes. Okay. So this was also given. So with all these options, please remember we have to think about zinc deficiency. Zinc deficiency is going to specifically produce in children acrodermatitis enteropathica. I think sir has already told, Vivek sir. So acrodermatitis enteropathica. A for you can remember it as alopecia. D for you can remember it as dermatitis. So D for dermatitis. So this A for alopecia, and this E for enteropathica, which is diarrhea. So acrodermatitis enteropathica. Somehow examiner is very fond of the poor wound healing. So there was one more question related to this poor wound healing or delayed wound healing. Delayed wound healing after minor surgeries due to deficiency of. This is another question. So if you have marked the answer as vitamin C deficiency, then you are absolutely right, which is also called as scurvy. And basically, because of the vitamin C deficiency, there is going to be a defect in the collagen synthesis, which is going to manifest with delayed wound healing clinically. Okay, I hope this question was there. Vitamin C deficiency. Yes, absolutely correct. Everyone, those who have marked vitamin C. And apart from this, you can remember these are the other causes for the poor wound healing. So vitamin C deficiency, zinc deficiency were asked. And the other ones are these: vitamin A, E, protein deficiency, iron deficiency, vitamin K deficiency, B complex vitamin deficiency, and copper. This is probably very, very important for all of you to know. And this question, please in the chat section write down whether this was asked. So Sjogren's syndrome, it is associated with dry eyes and dry mouth. So what were the other options, and whether this question was actually asked in the exam or not? Please put your answer in the chat section. Okay, this was not there. Fine. And this question, I think it was already discussed. History of burns 3 years back, and now patient is presenting with this lesion where you are able to see there is an ulcer. And please remember, whenever a patient presents with an ulcer, which previously had a burns history, then you should always think about one very important condition, which is called as Marjolin's ulcer, which is also called as Marjolin's carcinoma. So basically, this is a squamous cell carcinoma. Basically, this is a squamous cell carcinoma. And this question, some students told that this came in this today's exam. Patient presented with hypopigmented lesion associated with loss of sensation over the lesions. So what is the diagnosis? Please tell me, students, whether this question was actually asked in today's examination or not. Whether this question actually came in today's exam, where they have given a hypopigmented lesion and they have mentioned that there is loss of sensation. So if at all this was asked, then straight away the answer is going to be leprosy, which is nothing but Hansen's disease. So please whole pattern. Yes. Okay. Loss of temperature sensation was given. So thank you so much, Dr. Nikhil Singh, Raj Purohit. Loss of temperature sensation was mentioned. And what were the other options? If you can recollect, recall the other options. Okay, no loss of sensation, but loss of temperature sense was given. So what were the other options? If anyone of you can remember, please help me out in remembering these options with the recall. Don't rely on PYQs and rapid revision. That's not going to work. They have changed the whole pattern. Yes, Dr. Luca, very much you should have strong concepts, and on the top of which you are going to work with the grantors on the MCQs, work on MCQs, and then you are going to become strong in all the subjects. That is how you should improve all the subjects which are you are reading. No loss of sensation. Okay, fine. Some students are telling there is a loss. So whether this question was there, child of age 3 years presented with generalized vesicular eruptions over the body involving the trunk. What is your diagnosis? So in the image, there were vesicular lesions. They were vesicles which are present on erythematous base. So giving a dewdrop on rose petal appearance. Yes, so I think this question was there. So please confirm. Yes, okay. So the answer is going to be straight away varicella, which is also called as chickenpox, which is produced by varicella zoster virus. Varicella zoster virus. And there are so many buzzwords related to this. Please remember this varicella zoster virus. It is in the children going to produce this dewdrops on rose petal appearance, that is vesicular lesions, which are going to be present over the centripetal areas, centripetal distribution, and the spread is going to be centrifugal spread. Centrifugal spread will be there in the lesions, and there's going to be one very important term which all of you should remember, that is pleomorphism. That is, at a given point of time, a patient is going to have all the types of lesions at a time over the body. So this is called as pleomorphism. So all these features are going to be there, and once the virus is going to be treated or by self-resolution, it is going to resolve. This virus is going to lie dormant in the dorsal root ganglion. This is going to lie dormant in the dorsal root ganglion, and this is going to manifest in the form of varicella herpes zoster. This varicella zoster virus is going to present in the form of herpes zoster. So this is a very important topic for all of you. So this question is already discussed, so I do not want to go into the details. And was this image there in the today's exam? Please let me know. So Dr. Islam is telling there was coryza rhinorrhea also, and involved palm and back of the hand. So what is this particularly? What were the options? If you can remember, anyone can remember, please do let me know. So if this image was given, so yeah, then you should think about a condition which is called as necrotizing fasciitis. Was this present in the options? Necrotizing fasciitis what were the other options? If you can recollect, please put the other options in the chat section. Options was a pulmonary hypertension. So over the skin, whatever you are able to see, you can first try to identify. You are able to see some redness is there over the skin. And apart from that, you are able to see there are some blackish lesions, which most probably are ecchymotic lesions, which happen due to the extravasation of the red blood cells into the skin. So this is ecchymotic lesions and redness. And what was the other question? Body which was given, if you can remember. So measles was there in the options. So measles, and some students are telling that it is gas gangrene was there. Acute pancreatitis was also present. Okay. So if this kind of erythema, and also you can see some bullous lesions are given in the bullous lesions are seen in the image. So if this is the picture, then you can think about one bacterial infection which is called as necrotizing fasciitis, which is going to be due to both aerobes, anaerobes, and anaerobes, and there is going to be involvement of the skin. All the layers of the skin will be affected, that is epidermis, dermis, and the subcutaneous tissues. And not only that, even the fascia also will be affected. Fascia is also going to be affected. And as you can see here, these are the organisms. Group is Streptococcus, Staphylococcus, and others, Vibrio and Clostridium, can also produce this condition, necrotizing fasciitis. And you can see there is going to be weakened immune system, because of which there is going to be extensive involvement of the skin, which is going to manifest with redness, swelling, warmth, and pain, all the inflammatory changes. And along with that, there is going to be involvement of the pain. A lot of pain is going to be there. Pain is also going to be mentioned. And apart from that, blisters can develop, and ecchymosis can also be seen. So this is how you can identify this condition, necrotizing fasciitis. Okay. So I hope these were the questions. If there are any other questions related to dermatology, please put your other options which were asked, other questions which were asked in the comment section if you are watching this in the recorded session. And for those students who are asking for a Telegram group, so the Telegram group is by the name Cerebellum Community Official, And if in case you want to ask anything related to dermatology, you can WhatsApp me on this number 83106-75025. And I hope that you have gained some valuable information from this recall session. And please remember, the questions are going to be more and more difficult. Instead of the PYQs, maybe there's a possibility that previous topics are the ones which you have to be thorough in. Okay. So hesitating mark on hand. So that will be taken care of by our forensic medicine, sir. So the next faculty, I hope.
Dr. Parineet is coming.
Yeah, Dr. Praneeth sir from ENT is going to discuss the ENT topics, ENT recall questions. So till that time, any student having any queries, please put your queries in the chat section. And how did you feel the exam overall was? Paper 1, students told that it was very difficult, and students told that paper 2 was comparatively easy. So what was your thought process related to the questions which were asked in this today's examination? Please put in the chat section. And whatever has to happen has happened. So just watch this recall session now, or relax, and again, take some rest for a few days till the results. Stay cool, okay, till that time. Hesitating mark on hands. Okay, it was about alcohol. Yes, I do bless that all my students are going to do great in the results and come back, and please also give us the surprise of getting great, awesome marks, not just passing 150, as we have made course 200 plus is going to be our target. Too lengthy paper 1. Yes, this was the thing which students told, because of which the paper 1 was very difficult. They felt it so. Pattern very changed. Yes, Dr. Anil, definitely the pattern is going more towards lengthy questions, and in no way FMG examination is inferior to any other exam. I can surely say that this FMG exam is on par with other examinations, NEET, even next, and also INICET also. Option was so near. Yes, very tricky, right? Anil, Nikhil, this happens every time in the examination. So Praneeth sir.
Good evening, sir.
Very good evening, sir. So students, be ready for the discussion of the ENT recall MCQs by our Dr. Praneeth sir. Handing over to you, sir.
Thank you, sir. Good evening, dear students. Hello.
Yes, sir. Your voice is absolutely
fine. Just a minute, sir. Yeah, I'm sharing my screen. Hope audio visual is fine, right?
Yes, sir. Yes, sir.
Exam went well, dear students. I won't be taking much of your time. And quickly, I have got a few questions. First of all, there is a question of caloric test. On which direction the gaze, the nystagmus happens when cold water is given. So you remember the mnemonic cows. So when you give cold water, the nystagmus will be towards the opposite side. And when you give warm water, the nystagmus will be towards the same side. For example, in the right ear, if you are giving a cold water, the nystagmus will be towards the left side. And in the same ear, if you are giving warm water, the nystagmus will be towards the same right side. So this is how in a normal patient, this pattern will be happening. If this pattern is not happening in any person, then that is abnormal. Okay. So this is what you infer in case of your caloric test. Okay. So whether your peripheral labyrinth or your vestibular apparatus is normal or not, to check for that, you will do a caloric test. You all know that. Now, coming to next, another question was given. In the case of maxillofacial trauma, in what way you establish a patent airway? See, for example, see, this is your nose, upper lips, okay. Here is your uvula. Okay. And you are having like this, right? Okay. And this goes down trachea, and this will be going into your lungs, right? Okay. See, when there is a fracture in this area, okay. So what happens? There will be a trauma in this area, and the airway, through the nasal airway as well as oral airway, gets disturbed. So you cannot put an oral tube as well as a nasopharyngeal tube here in this way. So instead of that, you can put a tracheostomy and you can secure the airway in this way, right? So bypassing the fractured area, this is the fractured area. So you are bypassing this part and you are providing a secure airway down here. So this is your tracheostomy is the answer for that question, right? Now coming to the next question. So this image was given showing omega epiglottis. So where do you find an omega shaped epiglottis? In cases of laryngomalacia, right? In case of laryngomalacia. So see what happens here in case of laryngomalacia. Whenever the epiglottis gets curled on itself, okay, curled on itself, and what happens? The airway gets narrowed. See, whenever in the upper respiratory tract, if there is any narrowing of the airway, you will be getting an inspiratory stridor. And if it is in the lower airway, you will get an expiratory stridor. And if it is in the midway, in the area of subglottis, you will get both inspiratory as well as expiratory. The obstruction here, the narrowing of the airway here is in the supraglottis. Okay. So there, that is in the upper respiratory tract. So obviously the patient will be having inspiratory stridor. Okay. And in these upper respiratory tract obstructions, like your laryngomalacia or acute epiglottitis, the child always tries to lean forward. So the epiglottis falls a little bit anteriorly, and the posteriorly airway will become a little bit better. The patient will have a little bit better breath, right? And coming to another question was given, site of facial nerve lesion, right? So what is the site of facial nerve lesion? See, with the help of few topo diagnostic tests, we can detect the lesion where the facial nerve lesion is present. When you are studying about the facial nerve, if this is the medial wall of the middle ear and this is the posterior wall of the middle ear, right? You all know your facial nerve will be entering into the middle ear from here, okay? And as soon as it enters the middle ear, it will be giving a ganglion called as geniculate ganglion. From the geniculate ganglion, GSPN will be given, and that will be supplying for lacrimation, right? And this nerve runs horizontally, posteriorly, and it bends downwards on the posterior wall, and it runs vertically on the posterior wall. On its way, it will give nerve to stapedius. This is nerve to stapedius, which is responsible for stapedial reflex. And down here, it will give another branch, that is chorda tympani, which supplies anterior 1/3 tongue taste sensation. And after that, this will be terminating in 5 terminal branches. And those 5 branches will be supplying all your one-sided facial muscles. Right side facial nerve will be terminating in 5 right terminal branches, and all those 5 branches will be supplying all the facial muscles to that particular side. See, when the question says that there is a loss of taste sensation in anterior 1/3 of tongue, means the chorda tympani is not functioning, right? You can see here, the chorda tympani is lost, okay? From the question, we can see the chorda tympani is lost. And also, all the loss of closure of left side eye, means one side, so eye closure is absent, means one side facial muscles are not functioning, okay? So left side of the facial muscles are not functioning. That means, so these are also not functioning. Means the lesion should be somewhere over here in this area, okay? It should be somewhere in this area, means lesion should be present on the vertical portion of the facial nerve, portion of the facial, okay, or the mastoid of the facial nerve. So this is how you come to know. The question was also given as lacrimation is also absent. Then the lesion should have been somewhere in the inner ear level or the supra level. Okay. So that is how, with the help of these topo diagnostic tests, taste sensation, lacrimation, stapedial reflex, and also your facial muscles. Okay. With the help of these, you can identify level the area of the lesion of the facial nerve. And now nerve supply of the ear lobule. Majority of the ear is supplied by your greater auricular nerve. Remember that. If you see, except a few areas over the pinna, see the anterosuperiorly, this is the auriculotemporal nerve supply. Here in the concha area, this is your facial nerve branches as well as vagus nerve branches. On the medial side also, you have the similar. This is lesser occipital. And all the remaining part is supplied by greater auricular nerve. So this is the cartilage devoid lobule part of the ear, right? So this one is supplied by greater auricular nerve. This is the answer. And now coming to nasolacrimal duct obstruction question was given. See, on both sides, okay, from the eye, okay, there will be lacrimal puncta will be there, right? Opening will be there, through which lacrimal canaliculi will be opening. And these lacrimal canaliculi will be joining together to form a common canaliculus. And this will be opening into a lacrimal sac. And this sac will continue down as a nasolacrimal duct. And this nasolacrimal duct will be opening into your inferior meatus. So this is inferior turbinate and this is inferior meatus. Okay. Middle turbinate, middle meatus, superior turbinate, superior meatus, right? So if there is a block here in the nasolacrimal duct, if there is a block, what you have to do? You have to provide an alternate route for all the tears that are coming from here, and you have to provide an alternate route into the nasal cavity. So what is this surgery called as? Dacriocystorhinostomy. So DCR is the option for this question. So whenever there is an NLD obstruction, DCR is the treatment of choice in these cases. Okay. Now coming to the next question. The question was not sure exactly what was the question was asked. I just got this location of bulla ethmoidalis. So if this is the bulla, what is bulla ethmoidalis? Ethmoidal bulla is the largest anterior ethmoidal air cell. Where are these ethmoidal air cells located? These are located in between the middle turbinate and lamina papyracea. So you can see large air cell here is ethmoidal. You can see here, this is from here onwards, your unsaid process is coming, right? This is the septum, and this is other side middle turbinate and process, and you can see the ethmoidal bulla. This is the lamina papyracea, and this is the middle turbinate. So in between the lamina papyracea and the middle turbinate, your ethmoidal labyrinth will be there containing all the ethmoidal air cells. Okay. So largest anterior ethmoidal air cell is bulla ethmoidalis, and you can see these are maxillary sinuses here in this area. Right. Now coming to cartilaginous septal perforation, these are seen in tuberculosis. Okay. Also, bony septal perforations are seen in syphilis, okay, as well as your vaginous granulomatosis, sarcoidosis, okay, all these granulomatous diseases also, you can see the both bony and cartilaginous destructions. If only cartilaginous was asked, if in the options tuberculosis is there, you can select for this. And most common artery to bleed in case of nasal bleed. You all know what is artery of epistaxis. Simply the question is asked in another way. What is the artery of epistaxis? Sphenopalatine artery. Majority of the nasal part has got blood supply from sphenopalatine artery. Majority of the area in the nose gets its blood supply from this sphenopalatine artery. So most of the times the nasal bleed will be from the sphenopalatine artery. That is why when the packing techniques are not successful, when they get failed, what you will do? You will go for ligation techniques. So first artery that you ligate in case of epistaxis is sphenopalatine artery, because this is the major artery that gets involved in epistaxis most of the times. Okay, very easy question. And now, so these are the few ENT questions that we can recall as of till now. If further in detail questions along with their options, once we get, we will post it in the YouTube channel also. We'll posting a separate video. So hopefully with this we will end our ENT's discussion, and Gaurav sir is ready with his questions. Sir.
Thank you, Praneeth sir. Thank you very much.
Sir. Please take over, sir.
Yes. Okay, just sharing my screen. Just give me a second. First of all, good morning to everyone. Good morning, हो गई है?
Yeah. Good morning, हो गया sir.
Okay, I hope my screen is visible. And one thing, hats off to all of you who are here still in this time and those who are attending. कई लोग एक दूसरे को कह रहे हैं सो जाओ, पर सोने का नहीं है, ठीक है? जो जाग रहे हैं, जो पढ़ रहे हैं, hats off to you, all of you. You are doing great, and definitely this is one step towards the success that you're going to have. So keep working hard, that's for sure, and we will rock. As you have seen, questions are becoming more and more closer to the question that are being asked in next type of exam. जो जिस तरह के क्वेश्चन हमारे नीट में उसमें आते हैं वैसे से क्वेश्चन अब कुछ इसमें आने लगे हैं. No, Josh has to be high. Experience yourself. We have to keep the Josh high. Okay. So I'm Dr. Gaurav Nagpal. That's my mobile number. I hope किसी को pink eye is spreading rapidly in the country. Conjunctivitis cases are बहुत coming. Lots of conjunctivitis cases are coming. They are all adenoviral cases which are being reported across the country now. Earlier it was in Delhi NCR. Now we are getting cases from Jaipur also, from Agra, from Lucknow, from entire North India. We're getting lots of cases of adenoviral conjunctivitis which are happening. And I hope all of you are doing fine और किसी की eyes में redness nahi hai. Okay. So let us quickly recall whatever questions I have been able to correct. One question was there, iron containing foreign body in eye. Okay. So दो तो ये KF ring, one was sunflower cataract. These are both seen in copper. Okay. So sidrosis bulbi was the correct answer. The third choice I have not been able to find. Sidrosis is iron in the eye. It is a very fulminant reaction, causes lots of endophthalmitis. So sidrosis bulbi was the correct answer which was there. Okay. Anybody has any doubt in this? You can send it in chat. I am watching the chat also. No? Okay. Let's move to the next question. Okay. Next question. 1-1 CMV retinitis. Okay. Alpha is having conjunctivitis. You can DM me on my mobile number. I'll tell you the treatment over the phone itself. इतने सारे cases आ रहे हैं कि phone पे treatment बता रहे हैं हम लोग. Now moving on to the question on CMV retinitis, there was a picture which was given of retinitis on retina. So there was a lot of hemorrhages and you were asked to identify, and the drug of choice that was asked was, so the drug of choice for CMV retinitis is ganciclovir. It is given in intravitreal form. Intravitreal ganciclovir is the drug of choice for CMV retinitis. That is the drug of choice. It was an image-based question. I'm not able to trace the exact image. If somebody is able to find out from the net, they can let me know. Okay. So that was the next question just there. Next question, which is very, very start question. This I have been repeatedly telling in my lectures. You have to draw this diagram. You have to remember this diagram. This diagram is repeatedly asked in some form or the other. So homonymous hemianopia with macular sparing. Homonymous is after the optic tract. So all the lesions which are beyond the optic tract are always homonymous. Only optic chiasma lesions are heteronymous. Hetero is opposite side. Homo is same side. Okay. Same side. So homonymous hemianopia with macular sparing. Macular involvement, macular sparing is in the occipital lobe. So occipital lobe lesions are homonymous with macular sparing. This is what is characteristic. Okay. Now, one question that you can ask, you can remember is on Mayer's loop and Baum's loop. Mayer's loop causes superior temporal, supratemporal quadrantanopia. Mind in sky temporary, mind in sky temporary, mind in sky, Myers and sky, superior, supracont, pie in the sky, and bombs on floor. Your bums are on floor now, so bombs on floor. So bombs loop, you have pie on the floor. Pie on floor kind of lesion. So Mayer's loop and Baum's loop, you should remember this. Okay, this will come again and again. It will come in your next exam also. It will come in your NEET. It will come in your INACT. It will come everywhere. This diagram is going to come in everywhere. Yes, Nikhil, we are coming to that question also. Shortly, we'll come to that question also. So I hope you were able to do this question correctly. One question was on hypertensive retinopathy. I have not been able to find out what question was there, but I have been told that there was a hypertensive retinopathy question. This is a Keith Wagner classification. Keith Wagner classification, where you have grade 1, which is generalized narrowing of arterioles. Grade 2 is your focal narrowing. Focal narrowing se yaad rakho, you have AV crossing changes. AV crossing changes, which are your Salu sign, gun sign, and bonnet sign. These have started coming. Grade 3 is your grade 2 plus your hemorrhages and cotton wool spots. Hemorrhages and cotton spots. And grade 4 is your papilledema. Anybody able to tell me the choices that were there? What was the question? Question mentioned right, left side, right side involvement. Okay, Shahjigar, that was the question here. So see, on your left eye, you have left involvement. On your right eye, you have left involvement. So that is what must have been there. So the answer which coming was of homonymous hemianopia, same side homonopia. Okay, so that must have been the question. Okay, Shahjigar. So this was your hypertensive retinopathy. Anybody has any choices of hypertensive retinopathy? You're able to recall the question? No. Okay, so moving on to the next question. One question was, I believe, on most common intraocular malignancy in adults. Was there a question on this? Most common intraocular malignancy in children. This is normally asked. That is your retinoblastoma. Intraocular in children. Intraorbital in children is your rhabdomyosarcoma. Okay. Intraocular in adults. You can have two answers. One is your primary. Primary would be your choroidal melanoma. Choroidal melanoma. And secondary is from other body organs. You can have secondaries. If you have to choose between these two, then secondaries are more common than the primary. Okay, if you have to choose between these two, then secondaries are more common than the primary. So it would depend upon what choices were given. Most common intraocular malignancy in adult. Primary malignancy of the eye would be choroidal melanoma. Secondary malignancy would be secondaries from some other organ that is there. Okay, so this was one more question which was there. Now, Nikhil, this was the question which was there. Yoke muscle for levodepression. Levodepression. Hibrul Islam, yes, most common ocular tumor was questioned. So most common ocular tumor would depend upon in whom, whether it was adults or children, whether it was intraocular or whether it was intraorbital. Okay. Intraorbital in adults would be hemangioma. Intraorbital in adults would be hemangioma. Okay. So coming to levodepression in adults or levodepression yoke muscle. So levo is left side out and down. Left side out. First is out. When the eye is out, the elevator and depression are the recti. So elevator is superior rectus and here is your inferior rectus. So left inferior rectus. The yoke muscle, for yoke muscle, just reverse this ratio. So your becomes right superior oblique. Okay. L becomes R, I becomes S, and rectus becomes oblique. So these are the pair of yoke muscles which are there. Left inferior rectus, right superior oblique. This is the pair of yoke muscle for levodepression. In an abducted eye, only the recti act as elevator and depressors. So if this eye is abducted, the recti act as elevator depressor. In adducted eye, when the eye goes in, obliques act as elevator and depressor. Okay, so this is the pair of yoke muscle which is there for levodepression. Okay, that was the answer. Was there a question on astigmatism, refraction and astigmatism? I think there was a question on refraction in astigmatism. Anybody? Refraction in astigmatism you would like to do in maximum cycloplegia, that is under 1% atrophy. That is under 1% atrophy. Okay, that was there. So under this is the strongest cycloplegic. So for refraction in astigmatism, you would like to do it under maximum cycloplegia. Okay. Oil droplet reflex. Very, very sitting question. Easy answer. Oil droplet reflex. Okay, in galactosemia. Oil droplet reflex in galactosemia. Okay, oil droplet cataract in galactosemia. And if it is oil droplet reflex in cornea, then the answer would be keratoconus. So if you can help us in finding the right choices, it would be great. So oil droplet cataract would be galactosemia. Oil droplet in cornea would be keratoconus. Okay. Was there a question on visual blurring in papilledema? Visual blurring in papilledema. Visual blurring in papilledema is called as amaurosis fugax. Amaurosis fugax. Okay, I believe this was an image-based question. If the image was of papilledema, then this is amaurosis fugax. If the image was of optic neuritis, then your visual blurring would be visual loss. It would not be blurring, it would be visual loss. In both papilledema and optic neuritis, the optic nerve appears to be swollen. Optic nerve edema is there. Okay, this is there. So these were the questions which were there. Was there a question on cataract treatment? Cataract treatment. You have ICCE, you have ECCE. ECCE can be done by either your conventional ECCE or you can do it by your SICS, small incision cataract surgery. You can do it by phacoemulsification. And you can do it by femto laser assisted cataract surgery. These are the different types of ECCE. Gradual loss of vision was there. Gradual loss of vision in papilledema. Nylon 10-0 would be used in conventional ECCE. Nylon 10-0. Nylon 10-0 is suture which is used in conventional ECCE. Rest all are sutureless. These all are sutureless surgeries. So if there was a choice of nylon 10-0, then conventional ECCE is the answer. Okay. So that was the questions which are there, waiting for getting the proper answers, proper choices, and then we'll be able to share a better video with this. So that is my fun part. What do you call a bright student studying to be an ophthalmologist? A good pupil. Okay. So please do send me your questions, do send me your queries on this number. We'll be able to answer and make a better recall of this. All the best, dear students. All of those who have appeared, दिल से दुआ है आप सब succeed करें. All the best. Over to Dr. Janvi ma'am, please.
Hello students, hello sir. I'll take it on from here.
Thank you, Janvi ma'am. Welcome. Good morning.
Good night, good morning, both of them.
Okay.
Okay, so from anesthesia, we had very simple 2 questions that had come, and I'm quickly going to cover both of them. The first one can actually be an integration between anesthesia as well as surgery as well as medicine. It can come out of any 3 of these subjects, but I'm covering it over here. So what is the fluid of choice for surgery? Blood, colloid, crystalloid, or FFP? I don't know if FFP was the 4th option. I did not get the 4th option here, but I've put it over here. The answer is very clear. The fluid of choice for surgery is always crystalloid. When they just say fluid of choice, they are trying to ask you what is the maintenance fluid. Okay, so whatever we are losing during surgery in insensible losses, like the abdomen is open and you're losing evaporating fluid, then in that case, all of those urine, sweat, everything, whatever is lost, it can be maintained by giving the patient crystalloid. Blood is given as a replacement fluid for all those who will be attempting FMG later on, or for those who are watching this just to get the recall. If they ask you the second part of this question, what is the crystalloid of choice in surgery, then it will be Ringer lactate. And that is because that is the closest to human plasma in its osmolarity. Okay, so since RL and plasma are isoosmolar, fluid of choice for surgery is crystalloid, and in crystalloids it is RL. And the second question was one of my favorite questions that we have. So identify this classification. It does not really need any options at all. It was very simple. I have taught this multiple times in my videos, in the Mission FMG video, as well as in my RR and main videos. And this is nothing but an Malampati classification. Malampati classification, it has 4 grades, and this gives us an idea about the airway of the patient, which is seen pre-operatively in pre-anesthesia evaluation. Okay. So Malampati classification class 1 means the patient will have an easy airway. Malampati classification class 3 and 4 means patient has a difficult airway. Now, from FMG point of view, you don't need to know how does Malampati class 1, 2, 3, 4 look like. You just need to know what is the classification and which of these can be a predicted difficult intubation, and that is class 4. So that was the answer. Were there any other questions from anesthesia? I don't think there were any other questions from anesthesia. If there were, you all can type it in the chat box so we can continue with the surgery class now, the surgery recall now. And if any anesthesia questions you all remember, you all can let me know. I'll come in between and answer them. All right. I hope that all of you all got these 2 questions correct. It was really easy. And over to Dr. Amrit, who will be teaching the surgery questions now.
Good evening to all of you. Hope you are all having a good time. You should relax also a little bit that your exams are over. So I will quickly take you through some of the questions. Some of the questions that I have received, they were not the most difficult ones. But yeah, they were very integrated. Like I believe some questions may have been covered in anatomy, in pathology, in radiology also. So let's quickly go through the ones that I have gotten in surgery. So this was one of the standard questions. Lady with a breast lump who had a peau d'orange occupying more than 2/3 of the breast. What T stage does it relate to? So this was the question, very standard question. And if it is peau d'orange more than 1/3 of the breast, it is going to be skin involvement. So if there is peau d'orange, it means there is skin involvement, and skin involvement means T4B. Right, skin involvement means it is going to be T4B. So this question was there. Then this is I'm not sure of the recall very properly, but you can let. And there was a lady with a nipple discharge, and they are giving the diagnosis of duct ectasia. And what is the procedure to be done for duct ectasia? This was what was asked. So what is the procedure to be done for ductectasia? If it is only ductectasia, the answer is going to be Hadfield. Okay, Hadfield means you are going to do conical excision of the ductal system. So conical excision is done. Microducectomy is done for duct papilloma, which affects a single duct, that is duct papilloma. For that, you are going to do microducectomy. All right, mastectomy and all are not going to be done in this case. So that is obviously out of the question. Right? So moving on. Then there was a question where there was a patient's image where some bruising was seen on the abdominal wall. Perhaps it was Gray Turner sign. Either it was Gray Turner or it was Cullen sign. And they had asked, what is the diagnosis? And these are the two options that I got. The answer is going to be pancreatitis. Best answer would be hemorrhagic pancreatitis. So maybe the option said some students are saying it was necrotizing pancreatitis, but actually it is seen due to hemorrhage. The best answer would be hemorrhagic pancreatitis. In portal hypertension, you will see caput medusae. And the recall that I have gotten, it didn't look like caput medusae. In caput medusae, you would get paraumbilical veins. I don't think that's what it was. Okay. This question, I'm not sure if it has been covered before. Maybe the radiology, Dr. Zainab may have covered this. So they had given you a scenario of a patient with head trauma. The vitals were given, and there was a CT brain image where there was an EDH, maybe there was mass effect, and they had asked you the next step. If there is EDH, big EDH, if they give you the volume, if the volume is more than 30 cc, usually the best answer will be immediate craniotomy. I think the other options were reduce the blood pressure. I think that was one of the other options. This is done in subarachnoid hemorrhage. Okay, not in traumatic EDH. EDH, you're not going to reduce the blood pressure. That is, of course, not going to be done. And one option I think was give anticoagulation. Of course, that is also not going to be done. The best answer would be immediate craniotomy if it was an EDH with a mass effect. Okay, this was a normal standard question. So they had given a patient who has headache, palpitations, episodic hypertension. This is like the triad of pheochromocytoma, right? In which you get headache, you get palpitation, and you get sweating. So the best answer there would be pheochromocytoma. This was an easy question, no rocket science here. They had given the image of a limb, probably it was a filariasis limb, and they had asked you what is affected in the limb that was shown. Is it an arterial disorder, venous disorder, lymphatic disorder? Of course, it is going to be lymphatics. Right, so the problem there was lymphatics. Lymphatic damage leads to filariasis or elephantiasis. That was the image that was given. This was an interesting question. They had given patient who had a history of some surgical procedure. You can tell me what the procedure was. Maybe I will get a better answer. So they had given the image of some surgical procedure. And they had given some growth at the surgical scar. Now, some students are saying it looked like Marjolin ulcer. But mind you, it could also be a keloid or a hypertrophic scar. I have not gotten the image. If anyone can share with me approximate image of what the scar and what the growth look like. Most students are saying it looked like Marjolin ulcer. And Marjolin ulcer, it's a squamous cell carcinoma. So the edges will be everted. If the edges are everted, it will be a Marjolin ulcer. All right, but it could also be a keloid or a hypertrophic scar. It depends on what the scar was showing and what was the natural history that they had described. This was a standard question. They had given the image and they had asked you, what is this? This is Verey's needle, which is used in pneumoperitoneum when I'm doing a laparoscopic surgery. So it is used to establish pneumoperitoneum by the closed technique. Okay, optical trocar is used when I'm doing open technique. So this was another easy question. This also standard question. There is a young child who has bilious vomiting. Double bubble sign was seen on X-ray. The answer, of course, is going to be duodenal atresia. Some students are telling me maybe the child was 6 weeks old. Okay, duodenal atresia will not be in a 6 weeks old child. And some are saying it was non-bilious vomiting. So just be sure about it, whether it was bilious or non-bilious, because if it is 6 weeks, and non-bilious? The answer is going to be pyloric stenosis. Okay, so pyloric stenosis is seen in 1 month old baby, and there the vomiting is going to be non-bilious. But if it is bilious, double bubble X-ray, it is going to be, of course, duodenal atresia. And this was the image that I got. They had asked you what procedure is being done or what is the technique. I didn't get the recall of the options, but easy question. They are clamping the hepatoduodenal ligament, the hepatic artery, and the portal vein. So this, of course, this is the Pringle maneuver, which is done in liver injury. Right? This is the Pringle's maneuver, which is done in liver injury. So it is used to identify patients with liver trauma. So if a patient has liver trauma or bleeding from liver and I have done a laparotomy, and if I want to identify the source, one of the ways is by clamping. Okay, so when I will clamp, if the bleeding stops, it is arising probably from the portal vein or hepatic artery. If it doesn't stop, it is coming from the hepatic vein. If the bleeding persists, the source is hepatic vein. All right. So these are some of the recall questions that I got. If I get any more, I will share them also. And if there are any more, you can also let me know on my Telegram. So hope you guys did a good job. I don't think the surgery questions were very difficult, but yes, they were integrated. Lot overlap with anatomy and radiology and pathology. So maybe that's how your preparation should be. So all the best, guys, and have a good time. So, Atul sir, are you next?
Yeah, thanks, Dr. Nasta.
Okay, thank you, Dr.
Am I
Atul.
audible?
Over to you. Over to you. Thank you.
Let me just share the screen. Is my screen visible?
सर स्क्रीन शेयर हो रही है बट अभी उसमें कुछ आ नहीं रहा.
Just maybe we can wait for a minute.
Yes, sir. Now it's visible.
Okay, so thanks everyone. I think, see, from forensic point of view, a lot of questions were asked. If I purely talk about forensic medicine, the questions were like more of moderate category. They were neither too easy nor too difficult. But I realized many of the questions in other, especially the paper one, was very difficult. I am not sure that. It seems that the examiner is deviating from the basic concept that here this is a screening test. So this was a bit disheartening that they deviated from this basic concept. But anyways, we can always, so if the exam is going tough, we can always increase our preparation. So let's start. I know it's very late. So first question I think was simple case where the ossification center of talus. That was the main highlighting feature, that the question was at what age the talus appears, and the significance of the talus appears at 7 months. So the answer is 7 months. And here the significance of 7 months is this is the age of viability. It is that is this age the fetus is considered to be a viable fetus. It can have separate existence from the mother. So if we just look at the age of ossification centers, these are the different ossification centers seen in intrauterine life. The first ossification to samples appear this body of clavicle, which appears at the 1.5 months. The 7 month has a significance of the age of viability, where 3 centers typically appear: S2, S3 of mandibular sterni and talus. So any center which is appearing at 7 month and after 7 month indicates that the fetus was viable. So I will just take a pause here. So just wanted to ask that, am I audible properly or not? Because there was some connection issue.
Sir, you are audible. You can continue, sir. Dr. Gaurav this side. You can continue, sir.
Thank you. So the next question which was asked was on the that a dead body has been recovered from a river and the body has signs of drowning and also has multiple wounds. Now, see, I do not have the exact image, but what I could gather was these image had multiple almost parallel cuts on the front of the forearm. And main confusion was whether it's a defense wound or a hesitation wound. Now, the defense wounds are something which indicates murder, and the hesitation wounds indicate suicidal attempt. In my understanding, it was a case of suicidal attempt. And how do you differentiate? Because the typically multiple parallel superficial cuts, they indicate suicidal attempt. So in this question, the in case of a defense wound, the wounds will not be parallel. There will not be multiple wounds on the front of the forearm. It can be on the front also and the back of the forearm also. Moreover, they will not be superficial. They will be deeper in case of a defense wound. So if we just go at the difference between the hesitation marks and the defense wound. Now, hesitation marks are typically a feature of if a person is trying to commit suicide, he is initially hesitant and he makes superficial cuts. Whereas in defense wounds, they happen when the person tries to save himself. So that is the reason hesitation wounds will occur usually on one side, whereas defense wounds can occur on both the sides because the person can try to save himself from front of the arm also and back of the arm also. And hesitation wound because the person is hesitant, so these wounds are superficial. In defense wounds, because the person is trying to save himself, the wound, the force is by the opposite assailant. So these wounds are deeper. So here, because there were multiple superficial wounds all on the front of the forearm, so I think that was more of a hesitation wounds, suicidal wound. Rather, I do not have the exact picture, but this is the interpretation. The next question was that a man was working in an industry without wearing helmet. Heavy hammer falls on the head due to slipping from the hammer of his colleague working on the top floor. And the X-ray was shown where a dense eco-dense opacity was seen. But the main thing here was that there was a hammer was written, a heavy hammer. And heavy hammer will always cause a depressed fracture because it's a object with a heavy object, but with a small striking surface. Whereas when a person falls on the ground, there is a linear fracture. Whereas any heavy object like hammer typically causes depressed fracture, which is also called signature fracture. And if we go to the different kinds of fracture, this is typically a depressed fracture, as you can see in the photograph, where the bones are displaced inwards. The second is diastatic fracture seen in children younger than 3 years, where the sutures get separated because the sutures are not yet so much fused. Then suture fracture, which is seen only in infants, is a ping pong fracture, where the skull gets compressed like a ping pong ball. Okay, so remember one thing, Pons fracture less than 1 year, whereas diastatic fracture less than 3 years. Then ring fracture is typically a fracture around the base of the foramen magnum, which occurs due to fall from height. So ring fracture occurs due to fall from height. And another, so actually in the base of the skull, there are two kinds of fracture. One is the ring fracture, which occurs due to fall from the height. Another fracture which occurs in the base of the skull is hinge fracture, also called motorcyclist fracture, in which the skull is divided into anterior half and posterior half. I'm sorry, no, I'm not able to write here because of some technical glitch, but I hope I'm able to explain the question. So the gutter fracture is something which occurs due to a bullet, where a long, narrow, depressed fracture, as you can see, it is formed. So it occurs due to a bullet passing adjacent to the skull. So in this particular question, it was a hammer was used, and hammer will always cause a depressed fracture. Now, a 10-year-old boy will have how many permanent and how many temporary teeth? So here we have to understand that age of 6 to 11 years is a period of mixed dentition. And during mixed dentition, total number of teeth are always 24. Now here, so 6 to 11 means initially the temporary are more, later on the permanent are more. So here it's simple that when it starts from, initially it starts from 4 temporary and 20 permanent. Sorry, it's opposite. Let me clear it. So it is permanent here. And so initially the permanent are less, temporary are more, and slowly the order reverses. So here another way of calculating is that number of permanent teeth is equal to age minus 5 multiplied by 4. Here the age was 10 years. That means the permanent teeth was 5 into 4, 20. Now this 16 can be overlapping. The main thing here to understand was that because the child is towards the higher age group, 6 to 11 is the period of mixed dentition, and child is towards 10-year-old age group. So number of permanent teeth will be more than temporary. And here in this question, there was this choice of 16 and 8, where actually the permanent teeth were more than temporary. So this will be the answer. Now, skull is brought for postmortem examination. Police has also given. So on one hand, we have the skull. On another hand, we have the photograph. So how do you identify? I think this was simple here. The answer is superimposition. Here the answer is simple superimposition. So here, actually, what do? We take the photograph of the skull. What we do is we take the photo. Photo is first of all enlarged to the natural size so that we can superimpose the two things. Negative of the photo is prepared. Then the photo of the skull is taken, and the negative of the skull is also the negative of the skull photo is prepared, and both are superimposed on each other. If they are actually belonging to the same person, then they will all the bony contours, they will align with each other. Now this was actually I do not have the complete choices. What I can see is that there was some question on the yellow oleander, and there were different choices. The interesting part here was the question was itself saying that it's a case of yellow oleander. So probably what was asked was about I don't know whether the principle was asked or the botanical name was asked. But here, if I tell you the concept, it will become clear. Actually, there are two oleander plants. One is the white oleander, also called Nerium oleander. Other is the yellow oleander, which is called Cerebra thevacea. So in the question, it was clearly written yellow oleander. Now, yellow oleander is also called Cerebra thevacea. And the active principle in this are thevacea, thevotoxin, cerebrin, and persuaside. A close relative of oleander is Cerbera odolum. Here, the active principle are glycoside and cerberin. So I think the choices were close here, and certainly Nerium will not be the answer because that is a white oleander. I think students would have got confused between Cerbera thevacea and Cerbera odolum. Cerbera odolum is actually not an oleander. It is it belongs to, it's like a cousin of oleander, but it's not an oleander. So here actually the answer is Cerbera thevacea, but I can say that by all means, this was not a question of the FMG exam, and this our examiners don't understand it. We can't do anything about it, but this was certainly not a question of FMGE. Another question was, I think on gunshot wounds, we always have a question that we have here the image was not given. What was given was a stellate-shaped wound was given, gun-shaped wound, and there was blackening around the wound. The moment it says blackening around the wound, the answer becomes close range. Now see, this stellate-shaped wound can be seen in both close range and contact shape. What is more important is blackening around the wound. So because in the contact shape, blackening will be present just around the margins, not around the wound. So if we see here, so there are basically classically 4 distances. In contact shot, if you see the first one, the singeing, blackening, tattooing are seen only on the margins, not around the wound. Whereas in close shot, you can see blackening around the wound. Blackening is so intense that basically it's only blackening seen. You can hardly see singeing or tattooing. In intermediate range, you can see only tattooing is seen, and in the distant range, you will not see neither singeing, blackening, or tattooing. Now, another question, the next question was very simple. Doctor comes to the court to present his post-mortem report. What kind of doctor is an expert witness? That is a very simple question. So nothing to discuss on this. Another question was on patient consumed 2 bottles of alcohol. So the patient has consumed alcohol. It will be either ethyl alcohol poisoning or it will be methyl alcohol poisoning. And there was blurring of vision was there. So that means it was a methyl alcohol poisoning. What's the treatment? Some of the students I heard got confused with the word flumazenil. They thought, consider it as fomepizole. Please remember, flumazenil is for benzodiazepine, fomepizole is for methyl alcohol. So here, actually, the answer is ethyl alcohol. We give ethyl alcohol to treat methyl alcohol poisoning. We should be knowing that the treatment of ethyl alcohol and ethylene glycol, MA is methyl alcohol and EG is ethylene glycol is almost similar. The main treatment is either you give ethyl alcohol or you give fomepizole. Both of them, fomepizole is also called for methylpyrazole. Either of them can be given for either methyl alcohol or either ethylene glycol. Then sodium bicarbonate to counter acidosis and dialysis. So these are the common treatments for both. Then in something which is given only in methyl alcohol is folic acid to help in the excretion of the formic acid, and only given in ethylene glycol is vitamin B1 and vitamin B6, which helps to excrete the get rid of oxalic acid and glycolic acid. So treatment for this is also very simple. Iron toxicity, desferriaxamine, very simple question, nothing more to discuss here. It was also a very simple question. Benzodiazepine is flumazenil. So the naloxone, here the answer is flumazenil. Then the antidote, these are very common things. Naloxone is the antidote for opiates. Atropine is the antidote of choice for all the cholinergic poisons, especially organophosphates, carbamates, and all the cholinergic poisons. And physostigmine is the antidote for all the anticholinergic poisons like dhatura. Then I think 2-3 questions were asked on the MTP. Now I do not have the exact question, but one question was MTP can be done up to 24 weeks. For here, I will say that as per the new law, the main thing that you have to think is that till now 20 weeks opinion of only one doctor is required. Earlier it was till 12 weeks one doctor, 12 to 20 weeks 2 doctors, but now till 20 weeks opinion of only one doctor is required and everyone can go for this abortion. Between 20 to 24 weeks, earlier beyond 20 weeks the abortion was not allowed at all. Now the abortion is allowed in some condition between 20 to 24 weeks, and in one condition even beyond 24 weeks. So that is, our law has already, a liberal law has become even more liberal. So here between 20 to 24 opinion of 2 doctors is required, and this is allowed in special categories like rape, minors, disabled women having significant fetal anomalies, and above 24 weeks at any period of gestation the MTP can be allowed if the fetal anomalies are very significant. But here the decision will not come from 1 or 2 doctors. It will come from a state government appointed medical board. So here, if you come to this question, so here the students would have got confused between, so see, in contraceptive failure, which is a routine thing, most common indication, it will be done till normal 20 weeks. In rape victim and congenital malformation, in both of them, more than 20 weeks can be allowed. These are higher sensitive things. Social indications to 20 weeks only. So very easy way to remember is something which is more sensitive, you can do after 20 weeks. Now here, question is up to 24 weeks. In congenital malformation, we can do even after 24 weeks. So here the answer becomes rape victim. The next question was something again on MTP related to consent. So with related to consent, I don't have the exact question, but we should be knowing is the woman's body is her right. She do not have to take the consent from husband, mother, father, and nobody. She don't have to take consent for MTP for anyone. So the consent of husband, father is invalid, but after 20 weeks, the consent of 2 doctors will be required. So from this, if you remember, you can come to the answer. Now, this was a repeated question. There was a tattoo mark, but it was not visible. Where will you see? You will see in the lymph nodes, because the tattoo ink gets migrated through the lymph vessels to the lymph node, where it can be easily identified. Now, graph of cooling of the body. So this is sigmoid shaped graph. This is also a simple question. This is a sigmoid shaped graph like this. Initially, there is a small lag period where in the number 1, if you can see, the temperature is not decreasing. Then number 2, here the temperature starts decreasing, and number 3, then later on, finally a stage comes when there is no further decrease in the temperature. So this is a inverted S-shaped graph, also called sigmoid shaped graph. Then I think I don't have the full question, but what I have is that there was some patient with EDH with an impact on pterion. Then the question was which artery will be affected. Pterion, as we all know, is the weakest part of the skull, and here the anterior branch of the middle meningeal artery runs below this pterion, so that will be ruptured. So middle meningeal artery is the answer. Now, some question was on the lead poisoning. What is the best to detect lead poisoning? Actually, we can use both blood and urine, but the gold standard is whole blood lead level. The gold standard is whole blood lead level, and more than 5 microgram per deciliter is considered diagnostic. We can do urine level also, but if you have to choose the best answer, it will be whole blood lead level. So I know it's quite late, but I tried to finish it fast. So we can now, if you have further questions, you can always share to me. I have shared my WhatsApp number. Then we can hand it over to the next faculty. So Mukta, who is going to be the next faculty here?
Hello, sir. My name is Dr. Anand. Hi, how are you? I hope you're good. Okay, we'll start off. I'll just open my mic and video. Hello, everyone. My name is Dr. Anand. Welcome to Pediatrics by Dr. Anand. A little late now, so let's start this beautiful session. So very importantly, we'll be speaking to the points and the important question which were there in the recall. We'll try to speak them and we'll be just to the point. We'll not go further beyond it. I'll just open my slide and it starts now. So very importantly, before starting any segment, we always have a quote, and the beautiful quote for today will be, I hope your exam was amazing and life is actually very, very beautiful, because luckily the question which came, they were just an amazing recall and we have done all those questions. Question number 1, fluid in the severe dehydration. Fluid in the severe dehydration, the options are normal saline, ringer lactate, DNS and isolate P. If I talk about only severe dehydration, we all know the fluid in severe dehydration is ringer lactate. If the question was fluid in severe dehydration, then the answer is ringer lactate. But some people had told the question was a child presented to clinic with complaints of malnutrition and severe dehydration. What would be the choice of IV fluid for this patient? As in, the patient is severe dehydration, but the patient is malnourished also. So it's like Sam with severe. Hello, Awaaz aa rahi hai? Hello.
Yeah, please share your screen, sir.
Okay, 1 second. I'll share my screen. 1 second. Yes, abhi aa rahi screen. Is it coming now?
Yeah, perfect, sir.
Okay, fine. No problem. We'll start. So, hello everyone. My name is Dr. Anand. We'll start the session and it's recall questions. And before starting any segment, we have a quick quote, and the quote says, "The life is beautiful." I hope your exam was great, and we'll try to cover as many questions as possible. And luckily, the question which came in the exams, we had done them before, so it was very good. The question number 1, we have a quick session, that is, what is the fluid in severe dehydration? As in, what is the fluid of choice in a case of severe dehydration? Fluid in a case of severe dehydration, we all know it is ringer lactate. That is one thought of question. There was one more recall in this. The question was not just severe dehydration. They are asking severe dehydration with malnutrition, what is the fluid of choice? The question was, a child presented to the clinic with complaints of malnutrition and severe dehydration. What would be the choice of the IV fluids? So SAM baby with severe dehydration, the best answer in that case would be ringer lactate in 5% dextrose. Ringer lactate in 5% dextrose. If it was just only severe dehydration, it was ringer lactate. It is SAM plus severe dehydration. The answer is 5% dextrose with ringer lactate. That you should know. Now, next important question, very easy question we had. Luckily, we had done a lot of questions like that. A child came with clinic with complaints of recurrent infections. Physical examination shows height for age be less than expected. This patient has decreased height for age. That is one highlighter. The parents also have a history of incorrect feeding technique. What is the appropriate term for the above mentioned condition? The appropriate term for above mentioned condition, when you have a decreased height for age, that is known as stunting. And if you have decreased weight for height, that is known as wasting. So decreased weight for height is wasting, and decreased height for age is stunting. Very clear-cut question without any delay. What is true about measles? Like, again, it's a recall question. The question was on measles basically, and we have done measles. Patient will always have 3C, very important. I have told multiple times. The patient will have cough, the patient will have coryza, and the patient will have conjunctivitis. So cough, coryza, and conjunctivitis happens in a case of measles. If I say polymorphous rash is more, the diagnosis more goes toward the varicella. If I say parotitis goes more towards mumps. So cough, coryza, and conjunctivitis are the 3 important C's of the measles. Now, next important question. A male patient with recurrent pneumonia who is infertile and foul smelling stool. Like this 2 recall I was able to get. The patient is having recurrent pneumonia and the patient is infertile. Now, which is this condition where there is stagnation of secretions? There is a condition among the 4 options where there is stagnation of all the secretions in my body, and that is why in the respiratory system I will have URTI, I will have LRTI, and I will have pneumonia. So the best answer for this condition, we have done that multiple times in our classes. So very important in a case of, in a case of cystic fibrosis, very important. In a case of cystic fibrosis, we all know that there is a stagnation of the secretions very importantly, and once there is stagnation of secretions, the patient will have URTI, LRTI, and pneumonia. And genitourinary system, the patient will have infertility, azoospermia, all those conditions. That is why the best answer for this question will be very importantly cystic fibrosis. Cystic fibrosis. Next question. The next question we have is diarrhea, dementia, dermatitis. There was one junior today. I would like to thank Dr. Priya, also one of my very dear juniors. She had helped me with the questions, and Dr. Jerry from Jaipur. So they had told, sir, a question I asked, diarrhea, dementia, dermatitis. If the question was just regarding diarrhea, dementia, dermatitis, so we all know vitamin B3 deficiency, niacin. Vitamin B3 is niacin, and niacin deficiency actually causes a problem known as pellagra, which has diarrhea, dementia, dermatitis, death. One more student had told me the question had come regarding something about thiamine. So vitamin B1 is known as thiamine, and vitamin B1 deficiency, everyone knows it causes Wernicke's encephalopathy. So some had said the recall was regarding Wernicke's encephalopathy. If it was felt like that, it is due to vitamin B1 deficiency, and B1 is thiamine. Thiamine deficiency causes Wernicke's encephalopathy. Child having breathing problem. There was a recall question. Child having breathing problem on the supine position, which relaxes while feeding. So which type of stridor is this? Like, this is what they had asked. Child having breathing problem on supine position and relax while feeding. So which stridor is this? So the definition of stridor itself is stridor is an abnormal. Stridor is an abnormal inspiratory sound. Stridor is an abnormal inspiratory sound which basically increases on crying or feeding. Abnormal inspiratory sound which increases during crying or feeding is known as stridor. That's a definition of Nelson. So that's why the best answer for this question is inspiratory. Stridor can be expiratory also. Stridor can be biphasic also. But the proper definition, if I talk about, yes, it is inspiratory. Next question we have, my junior said, again for this, I would like to thank Dr. Sarthak, one of my another very dear junior. He told that unanswered one question had come, case scenario of a child with bilateral oil drop cataract. So oil drop cataract, we all know we see in a case of galactosemia, whereas sunflower cataract you see in a case of Wilson, and oil drop cataract you see in galactosemia. The next question we had is, what is the dose of vitamin A? The dose of vitamin A in a child of 1 to 88. So very simple. If the child is more than 1 year old, we give 2 lakh international units. So this much I'm able to understand. I have to give 2 lakh international units. Okay. 2 lakh international units is given every 6 months till 5 years of age. If you talk about the proper immunization card, I have shown in the photo also, vitamin A is given every 6 months till 5 years of life. So that's why A becomes the very best answer. The next question we have is mid upper arm circumference. Mid upper arm circumference, 1,000 times we have done this question. Mid upper arm circumference in a case of severe acute malnutrition, the cutoff we have is mid upper arm circumference less than 11.5 centimeter. That's why C is the best answer. Prophylaxis of a baby of HIV positive mother. In our 2023 offline online lectures, everywhere I've told about it. If the mother is HIV positive, very important, you give nevirapine for 6 weeks. Like there's a detailed evaluation also. But if the mother is HIV positive, you give nevirapine for 6 weeks. Like very clearly, I have told recently only I have told regarding that. Down syndrome karyotype, if you all know, Down syndrome karyotype, Down syndrome 13, 18, and 21. So Down syndrome, we all know it is trisomy 21. There was a question, some student was saying there was a gap in the finger also. So there, this is like recall question. It was something pertaining to Down syndrome. A child with celiac disease is asked to avoid which of the following in the diet? Child with celiac disease is asked to avoid which of the following in the diet? So celiac, we all know gluten. Basically, there's a gluten problem. Whatever I eat, I go to washroom. I eat chapati. I eat wheat. I eat sandwich, burger, hot dog, pizza, pancake. I go to washroom. So that's what. So that's why wheat and other things are definitely not allowed. What is allowed is rice. What should I avoid is wheat. Okay, so I should avoid wheat, and what is allowed is rice. And there's a mnemonic we have done in our respiratory system. The mnemonic is bro. We all know that barley bread, rye, oats, and wheat is not allowed. So rice allowed, chicken allowed. That you should know. Last question I think we have over here is in Down syndrome, one more question they were saying, in which trimester quadruple scan is done for the antenatal screening of the Down syndrome? One junior was telling me first trimester scan was the question. One junior was telling me second trimester scan was the question. If we talk about the antenatal screening for the Down syndrome in the second trimester, so we all know we have something known as triple scan and something known as quadruple scan. Triple scan and quadruple scan, both if I talk about, they are done in second trimester. So if the question is in which trimester quadruple scan is done, then the answer is down second trimester you do the triple scan as well as quadruple scan. First trimester, what do you want to do? Beta HCG and Papa. Beta HCG and Papa, it is done in the first trimester. Because one junior had said the question, one junior had told me that first trimester scan, what investigation should be done? That was the question. If first trimester antenatal screening for Down syndrome you want to do, the investigation is Beta HCG and Papa. Papa is pregnancy associated plasma protein A. If second trimester of pregnancy you are planning to do the antenatal screening for Down syndrome, then you should do a triple or quadruple scan. That's it. What is the amount of milk given to a term baby in the first 24 hours after delivery? After 24 hours of the delivery, how much milk should be given to a baby? So roughly around, you can say 60 ml per kg is what the milk should be given to every term baby in first 24 hours of the delivery. 60 ml per kg, that you should know. Okay. There was one more question regarding this. There was one junior, he said me, there was a question regarding this, like I just should directly show you this one. Once I turn the baby, this one. Now, this was the question. We have done in our CNS classes 1,000 times. This is one neural tube defect which has the worst prognosis. Like in my every class, I've told this so many times, which is the neural tube defect which has the worst prognosis. So the answer is craniorecuschisis. Craniorecuschisis was the question, the one having the worst prognosis. They said there was a picture and we had to find it out. So it was having worst prognosis. One more picture, one junior had said like it was a case of anencephaly. As you can see very clearly, the head is not there. One of my juniors said there was a picture of anencephaly, and craniorecuschisis for sure was there. So craniorecuschisis was there, anencephaly was there, and this also some had told that omega-shaped epiglottis was there. So omega-shaped epiglottis, everyone knows it is seen in laryngomalacia. That's it. Last question, as a milk is we have done this question, milk wala part we have done. That's it. That finishes all the questions. Thank you so much. And before leaving, we always have a quote. You were born for a reason. The questions were given to you for a reason in your life. Okay, find that reason and enjoy living it. So I best of luck to all the students. I hope you get a good rank, and I hope you find a good way of, you were born for a reason, and I hope you have find out that reason, and you're enjoying your life very beautifully. Thank you so much. And now I would like to hand over the mic to the next person, next faculty, who will blow your mind with another set of questions. Thank you. So is my voice coming? Hello.
Hi, sir.
Great. So मैं out होता हूँ, ठीक है? I'll sign out. Thank you.
Yes, sir. Yes, sir.
Yeah, thanks.
Hi, guys. Hope you're able to see and hear me. Let me try and finish off the session as soon as possible, because we know we are like already into the early morning. Hope you all have done your exams well. So I'm just going to share a few questions with you. All right. All right. So I felt, I don't know, like how many of the questions are right. I just got in a kind of a bit of an urgency and a tangle. So hope like the questions actually reflect the real exam questions. So these are the 21 questions probably I could collect. So question number 1, I think they asked about the ABCD2 score. They typically asked like which of the following is not included in the ABCD2 score. I think the answer was previous stroke. So, in ABCD score, you have age, you have blood pressure, you have clinical features, you have D2, one D for diabetes and another D for duration of symptoms. So, but you don't have history of previous stroke or TIA. So probably like that is the right answer for that question. I think there was another question where they asked like a patient who had a road traffic accident, came with a typical Cushing's triad with bradycardia, hypertension, and altered breathing. And I think he had a GCS of just 6, if I believe, they asked what is the next immediate best step in the management. The right answer for that is intubation, because if the GCS is less than 8, obviously for airway protection, you need to intubate the patient. There is no doubt about that. And question number 3, so they asked about WP syndrome. I don't think ECG was given in that question. So which was wrong is basically QRS prolongation. But if they ask you which was right, then answer would be PR prolongation. So which was wrong? QRS prolongation. Which was right is QRS prolongation. And question number 4, I think, they asked about a nutmeg liver. I hope like there was an image also, a patient who had a raised JVP, who present with pedal who present with symptoms of cardiac failure. And they've given an image also with multiple small nodules. And basically this is nothing but nutmeg liver. So which is seen in patients with cardiac cirrhosis, or we can call it as heart failure causing like liver issues. And they asked about the tumor marker. So calcitonin, where this calcitonin will be used as a tumor marker. It's basically medullary thyroid cancer. So that was an easy one. I think so many people would have already discussed this question as well. What can be given in celiac? So I think there are 4 options, and that rice was the best option because it doesn't contain gluten. And there was another question on Bell's palsy as well. So what could be given as the first treatment? There was a confusion between prednisolone and acyclovir. So generally acyclovir doesn't have that much impact with regards to Bell's palsy. So the only treatment that has a significant impact on Bell's palsy and its recovery is going to be your prednisolone. And coming to question number 8, I think there was a question on ICH where they have given a non-contractility of the brain. There was a bleeding in the putamen. So I think they asked what shouldn't be done. So the right answer for that is thrombolysis. It shouldn't be done because obviously like it's a bleed. So it's an ICH. You don't do thrombolysis. And there was a question on clinical features suggestive of Wernicke's encephalopathy, and they gave the confusion, alcoholic, and all those situations that is suggestive of Wernicke's encephalopathy, and they might ask about the treatment, which is basically thiamine. So there are 2 schools of thought in this question. So one was about the feature suggestive of acrodermatitis enteropathica. So like the patient had dermatitis, poor wound healing, and so on. So where you answer zinc, probably if it's a 3D disease, that is dermatitis, diarrhea, and dementia, then you would have gone for niacin. So I don't exactly know what the question was. So this was the question I got. So probably like this is the answer. So I think there was a question on 80 milligram alteplase was planned for thrombolysis in ischemic stroke. They asked about what is the loading dose. Generally, loading dose is 10%. So loading dose is going to be 10%. Okay, whenever you're going to use alteplase for thrombolizing stroke, the loading dose is going to be 10%. So technically, I'm going to give 8 milligram as a loading dose. The remaining 90% will be given as a 1-hour infusion. And there was a question on GLUT2 also, so which was the transport on the contraluminal side. So for the absorption of the glucose from the kidneys, you need SGLT2, so sodium glucose transporter 2. But to push the glucose back into the contraluminal side into the blood, basically it is GLUT2. So the right answer for that is GLUT2. And there was a simple question on mountain sickness and its treatment. I think there was a case scenario where somebody was trekking in Ladakh and he developed features that are suggestive of acute mountain sickness. And for that, the treatment is going to be astazolamide. So prevention as well as treatment is astazolamide. So benzodiazepines, what is the antidote? I think they've asked that question also on flumazenil. And I think somebody has taken iron tablets in excess. In that case, what you'll use, it is deferoxamine or desferrioxamine. So whatever. But some people are telling oral, but we don't really use oral drugs in the setting of acute iron toxicity. In acute iron toxicity, in the emergency situations, we use only IV drug, that is deferoxamine or desferrioxamine. We don't generally go for oral treatment for urgent situations. So oral treatment can be probably used for chronic iron overload, like those who are having iron overload due to repeated blood transfusions and thalassemia. But apart from that, we don't use oral iron chelators in acute situations. So it must be basically IV, and that is desferrioxamine or deferoxamine. And there was a question on CMV retinitis. And what is the treatment of choice? The treatment of choice is basically IV ganciclovir. All right. And bedaquiline's mechanism of action was asked, which was an easy one. It is an ATP synthase inhibitor. And they also asked what is not the side effect of lithium. So it's an easy one. So basically it is tardive dyskinesia because tardive dyskinesia is kind of side effect of antipsychotic use, right? We know that it's not a side effect of lithium. So lithium causes diabetes insipidus, lithium causes hypothyroidism, and lithium causes so many other side effects, but definitely doesn't cause tardive dyskinesia. There was a question on cardiac tamponade. So they asked about the JVP finding in cardiac tamponade. Technically speaking, like we have already learned plenty of times about the mnemonic. So what you see in cardiac tamponade is the mnemonic is PATAX, right? So in constrictive pericarditis, you have accentuated Y descent, and in cardiac tamponade, you have accentuated X descent, but you'll have a blunted or probably even an absent Y descent. So in cardiac tamponade, you're going to have accentuated X descent, but an attenuated or absent or blunted Y descent. So that's the right answer for this question. And I think there was a question on penicillin-induced autoimmune hemolytic anemia, and they have probably asked the type of hypersensitivity reaction. It's technically like type 2 hypersensitivity reaction. So that's what I believe. So any autoimmune hemolytic anemia for that matters, or even immune thrombocytopenic purpura for that matters, is basically type 2 hypersensitivity, which is nothing but antibody-mediated reaction. So type 2 hypersensitivity is antibody-mediated. Penicillin-induced autoimmune hemolytic anemia, ITPs are all going to come under type 2 hypersensitivity. And I don't really understand what's that question on Duke's criteria. I couldn't find out the real question with regards to what is the question on Duke's criteria. So I think it's somewhat related to infective endocarditis. I don't understand. I don't understand what the question was really. I have no idea. Sorry for that. So do you guys have any idea about what is the question was on infective endocarditis? I'm just looking out in the comments. No, Varun Kumar, Monica, I'm not getting any replies. Okay, fine. So let it be it. So there was a question on Duke's and Trinity. Okay, there are 2 questions on Duke's criteria. Okay, cool. So 2 questions. 2 questions in the sense, what do you mean by the 2 questions? So, okay, anyways. So hope you have answered both the questions correctly. So because Duke's criteria is an easy one, it's not a very big deal. So the major and the minor. Major includes blood cultures and imaging. Minor includes predisposing factors, fever, immunological phenomenon, vascular phenomenon, and you have the blood cultures that don't meet the major criteria. So I think like this is it about the Duke's criteria. So based on that, I hope you would have answered. And I feel like medicine questions were simple, straightforward. There were not any twists and turns. Probably one question I would feel little tough maybe is like this alteplase question. The loading dose is 10%, probably it's 8 milligrams. So that's one question I felt little like, okay, maybe not so up to the undergrad level. It's a little bit at the postgrad level. But nevertheless, apart from that, most of the other questions were very, very simple and straightforward. So most of them were basically like previous year questions, and most of the questions were easy ones and something that we have discussed already time and again. Okay, I think that's it. So let me wind up and wish you all guys all the very best, and hope you all come out in flying colors, and see you on the other side. Thank you very much.